सा मैम ज्वाइन होने तक
Recording in progress.
टोटल सेशंस के बारे में थोड़ी सी जानकारी दे दो सर को रिगार्डिंग दैट। हेलो
हेलो सर। हाँ सर।
हाँ, मैम ज्वाइन होने तक सभी
हाँ।
को टुडे सेशंस के स्पीकर्स के और चेयरपर्सन की जानकारी दे दो तब दिस 5 सेशन जो होगा दे उसके बारे में।
ओके ओके सर। Today is the first day of the 4th national seminar Attack on 2022. So we are having 5 sessions today. After the inaugural ceremony, we will start with the knowledge sessions of today. First session will be conducted by Dr. Milind Gore sir and Dr. Salmali Pause ma'am. The speaker for the session is Dr. Hemakant Baviskar sir. The chairperson for the session is Dr. Rajesh Pawar sir. The co-chairperson for the first session is Dr. Nilakshi Pradhan ma'am. Then second chairperson for the first session is Dr. Jayant Kharat sir. The topic of the first session will be uveitis and its Ayurvedic approach. The second session will be conducted by session coordinator
Amar, you are not audible. Hello, Amar.
Hello.
Yes, you are audible.
Hello.
Yes, yes. Continue. Yes.
Dr. Ramya madam. Co-chairpersons for the second session are Dr. Suresh Podade sir and Dr. Akhilesh Srivastav sir. The topic of the second lecture is Ayurvedic Urology, the most amazing and promising branch. Then we will move forward to the session 3, which will be coordinated by Dr. Ajit Matke sir and Dr. Manisha Jagtap madam. The topic of the third session is common pediatric problems and their Ayurvedic management, issues and challenges. The speaker will be Dr. Snehalata Dornala ma'am. The chairperson for this session is Dr. Anjali Kamath madam, and the co-chairpersons are Dr. Mohan Raut sir and Dr. Lalit Vithlani sir. Then the next will be session 4, having the topic research trends and prospects of the Marma Chikitsa. The speaker will be Dr. K.M. Pratap Shankar from Kerala. The chairperson for this session is Dr. Sudhir Khandekar sir. Co-chairperson will be Dr. Sachin Khedekar sir The session will be coordinated by Dr. Madhulika Tiwari ma'am. Then in the fifth session, the topic will be fundamental approach in the therapeutics of the respiratory diseases. The speaker will be Dr. Shirish Srivastav sir. This session will be chaired by Dr. Vaishali Kuchewar ma'am and co-chair by Dr. Sujata Shamkuwar ma'am and Dr. Santosh Girbhede sir. This fifth session will be coordinated by session coordinators Dr. Nilesh Rajmane sir and Dr. Swati Ugle ma'am. After completion of these 5 sessions, we will come to the end of the day first. So this was about the today's schedule of the 5 sessions. In short while, we will be starting the opening ceremony of this seminar. Hello.
Hello. Amar sir.
Am I audible, sir?
Hello. Manoj sir, what about Nesri ma'am? Any update? Dr. Manoj Chaudhary sir.
Yes, I have joined. Thank you.
Okay, ma'am. Thank you, ma'am. I think now Amar sir can start our inauguration ceremony.
भारतीला बोलवतोस का जरा एक मिनिट
Amar sir, please start now. You have not.
Hello, sir. Dr. Rahul Suresh sir. Should I start?
Yes, start now, Amar sir.
Nisri madam has joined, no?
Yeah, start now, sir. Amar sir.
Yes. So, good morning to all of you. Myself, Dr. Amar Kamble. A very warm welcome to all the dignitaries, delegates, and participants in 4th National Seminar Attack-on 2022, having the theme Evidence-Based Ayurveda, which is accredited by the Maharashtra University of Health Sciences. I, Dr. Amar Kamble, on the behalf of all the Ayurveda Teachers Association team, welcome our respected chief guests, Dr. Hemalata Jalgaonkar madam, which is observer for the conference and principal of Ashtanga Ayurveda College, Pune.
Good morning.
Dr. Ashok Ji Varshney, Dr. Ashok Kumar Varshney Sirji, who is Rashtriya Sachiv of the Arogya Bharati. Then I welcome Dr. Shrikant Deshmukh sir, Dean Faculty of Ayurveda, MUHS Nashik, and respected Dr. Tanuja Nesri ma'am, Director All India Institute of Ayurveda, Delhi. So I welcome all the dignitaries and also the National President, Dr. Rahul Suryavanshi sir of the Ayurveda Teachers Association, Dr. Manoj Chaudhary sir, National Secretary of the Ayurveda Teachers Association, Dr. Nitin Tandurkar sir, National Vice President of the Ayurveda Teachers Association, and the entire Ayurvedic Teacher Association team. Now moving further, I would request all of you to get ready for the Dhanvantari Stavan. We will start the inaugural ceremony with the Dhanvantari Stavan. I request Dr. Aishwarya ma'am to start with the Dhanvantari Stavan. Dr. Aishwarya ma'am for Dhanvantari Stavan.
Sonia ma'am can continue. There might be technical issue with Aishwarya ma'am. Sonia ma'am, please.
Hello.
Yes, Aishwarya, you
Aishwarya
can.
ma'am,
Yes.
Yes,
start
yes,
with
yes.
Dhanvantari Stavan. Aishwarya ma'am.
Yes, yes, yes. नमामि धन्वन्तरिम् आदिदेवम् सुरासुरैर्वन्दितपादपङ्कजम् लोके जरारुभयमृत्युनाशम् धातारमीशं विविधौषधीनाम् शङ्खं चक्रं जलौकाम् दधतममृतघटम् चारुदौर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गम् कटितटविलसत् चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तम् निखिलगदवन प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्.
Thank you, Aishwarya ma'am, for Dhanvantari Stavan. Now, starting with the inaugural ceremony, I would like to introduce in brief about the Ayurveda Teacher Association. Ayurveda Teacher Association is the association which is working for the noble purpose of welfare of Ayurveda fraternity, Ayurveda academia, and improvement of its standards. ATA has organized, Ayurveda Teachers Association has organized 3 national seminars before, having overwhelming response from the participants and delegates, including paper and poster presentations all over the India, along with the feast of the knowledge from various honorable speakers all over the India. Also, Ayurveda Teacher Association has formed the students wing, and it is organizing the national webinars frequently. As you know, the theme of this 4th national seminar is evidence-based Ayurveda, which is the need of today's research-oriented and updated era. Hence, selection of this theme for the national seminar, we believe, is sincere effort from Ayurveda Teachers Association to enlighten the existing knowledge of Ayurveda and its propagation to our emerging Ayurvedic generation. So this national seminar is including the very knowledge fulfilled sessions by the expert resource persons all over the India. Now I request to give the introduction of this national seminar to Dr. I request Dr. Manoj Chaudhary sir to give the brief introduction of this national seminar. Over to you, Chaudhary sir.
Am I audible, sir?
Yes, sir.
Yes, you are audible.
Yeah, thank you very much. So, respected chief guest, our Dean Faculty of Ayurveda, Maharashtra University of Health Sciences, Nashik, and Principal of CSMS Ayurveda College, Aurangabad, our beloved Honorable Dr. Shrikanji Deshmukh, my mentor and teacher, Honorable Director of All India Institute of Ayurveda, New Delhi, respected Honorable Dr. Mrs. Tanuja Manoj Nesriji ma'am, Rashtriya Sangathan Sachiv of Arogya Bharati, our Guru and guide, respected Honorable Dr. Ashok Kumar Vaishnavi ji, Principal and HOD of Strirog Prasuti Tantra Department, Ashtang Ayurveda College, my senior and my guide, Honorable Professor Dr. Hemlata Jalgaonkar ma'am. She is here as an observer by MUHS Nashik for this conference. Honorable President of our association, Dr. Rahul Suryavanshi sir, Honorable Vice President, Dr. Chandurkar sir, all our panelists, all directors, national and state executives of Ayurveda Teacher Association, and all delegates from all over India, and some are from abroad also. A very warm welcome, all of you. Good morning, each and everyone who have joined and who are on YouTube also. We all are gathered here for inauguration ceremony of the 4th National Conference of Evidence-Based Ayurveda, which is accredited by our university, Maharashtra University of Health Sciences, Nashik. Every time when the association word is there, especially teachers association, usually most of the people thinks that they are only for demands they are gathered together, always demanding something more than what we have. But our ATA, that is Ayurveda Teacher Association, stands different from others because we always take efforts to have our teachers, scholars more updated, more deep knowledge, and which must be evidence-based, which we percolate to our career of Ayurveda, that is our students ultimately. This year, we have come with the theme evidence-based Ayurveda. So evidence-based Ayurveda practice is a hot topic for clinicians, students of the Ayurveda medicine, planners, patients, and overall public in large. Ayurveda is the science of life. We all know it defines the trinity of life as body, mind, and spiritual awareness, which are associated with health and illness of human body. Now, the Ayurveda practice is based on certain principles narrated by classics, that is Ayurveda Samhitas and tradition. Drug therapy, Kshara Sutra, Panchakarma are the famous acceptable interventions of Ayurveda. The contemporary approaches for bridging Ayurveda with evidence-based medicine, there is a need of assessment of quality, methodology, and extent of scientific research in Ayurvedic medicine. There is also necessity of the need to adopt epistemologically sensitive methods and rigorous experimentation using modern medicine. Many researchers from the globe concludes that the traditional knowledge systems like Ayurveda must be practiced on the basis of evidences only. For that, some may say that it should be integrated. Some may not agree with the integrated approach. Keep as a sole need of all Ayurveda community, we have come this year with the theme evidence-based Ayurveda. In those 3 days, we have 15 renowned scholars of Ayurveda. They are masters in their respective work area. We have tried to touch almost all specialties like eye, urology, pediatric problems, marma chikitsa, respiratory diseases, liver diseases, skin diseases, evidence-based panchakarma, management of acute stroke by Ayurveda, cancer care, infertility, osteoarthritis or other problems related with osteo, then diabetes and cardiology. Now, not taking more time, again, on behalf of Ayurveda Teacher Association National, I welcome all of you and I am sure you will definitely enjoy this feast of knowledge. Thank you. Thank you very much. Over to you, Dr. Amar and Dr. Sonia. Thank you very much.
Thanks a lot, Dr. Manoj sir, for the introduction of this seminar. Now I request Dr. Hemalata Jalgaonkar ma'am, who is observer from the MHS for this conference and principal Ashtanga Ayurved College, Pune, to have few words of guidance to us, ma'am. Over to you, Jalgaonkar ma'am.
Thank you, Dr. Amar sir. Very good morning to all. Honorable Dr. Nesrin Madam Ji, Director, All India Institute for Ayurveda. Honorable Dr. Deshmukh sir, our Faculty Dean. Honorable Dr. Vashne Ji, Rashtriya Sangathan Sachiv Arogya Bharati, and organizing committee members, President of ATA, Dr. Suryavanshi sir, Vice President, Dr. Chandurkar sir, Secretary and my colleague, Dr. Chaudhary sir, Treasurer, Dr. Margundi sir, Working President, Dr. Dudmal sir, and all national executives. I can say many hands and brains behind the motion. Thank you all. I am pleased to be the first speaker. I am privileged to get an opportunity to honor the chair with the stalwarts of Ayurveda. Very brilliantly selected the topic as evidence-based Ayurveda for the conference, as said by Dr. Chaudhary sir. This is like if you have talent, you have to show it in front of the world. We have a lot of potential in Ayurveda, but it has to come up in front of the people. I am sure research trials or evidences from all the nation or the doctors using traditionally and which is giving good results, if we share on such diets, will be definitely fruitful to entire population of Ayurveda and very easily acceptable as it is my personal experience. So I am sure the productive outcome of the conference will definitely be good. I am thankful to the organizing committee members of Ayurveda Teachers Association for giving me an opportunity to speak. Thank you again. Finally, on behalf of MEHS, I am wishing good luck and best wishes for the conference. Thank you all. Thank you once again.
Thanks a lot, Jalgaonkar ma'am, for your words of guidance. Dr. Ashok Kumar Varshne ji, who is Rashtriya Sangathan Sachiv of Arogya Bharati, is unable to join the seminar due to some technical problems, but he has given the best wishes to our seminar with the help of one video. Now we will share that video with you on the screen. Sonia madam, kindly share the video on the screen.
Yes, sure, sir. Sir, give me 1 second, sir. Okay.
Ma'am, voice is not audible. Sonia ma'am.
Sonia ma'am.
Voice is not. Okay, voice is not coming.
No voice.
Yes, sir. Sir, give me some time, sir. I'm. 1 minute. Now coming. Sir, voice is coming now.
No. No, it's not there.
Sonia ma'am, please
Hello,
stop your
sir.
sharing.
Voice.
Please stop your sharing. I will try from my side. If I share my screen, I will start. Sonia ma'am. Hello. Sonia ma'am, please stop your screen sharing because I getting messages that if another one sharing his screen, then you can't share your screen. Hello.
Hello, Sonia madam.
Hello. Amar sir, please stop sharing screen. I will try from my side. I have also that video.
Okay.
I think video getting some problem. We will share it next time. Sir, Amar sir, please go ahead. When technical problem resolved, we will play that video.
Sir. Yes, sir.
Yeah.
After resolving the technical problem, we will show the video. Now, sir, moving further, I request Dr. Shrikantji Deshmukh sir, Faculty Dean of Ayurveda, MUHS Nashik, to have few words and to have the few words of the guidance, sir. Shrikantji Deshmukh sir.
Thank you, Dr. Amar sir.
Thank you.
Very good morning to one and all. This is the fourth 3 days national conference by ATA on evidence-based Ayurveda. This 3 days national conference is going to be a feast for the all teachers, followers of Ayurveda, UG, PG and PhD scholars, then Ayurveda scientists, researchers, practitioners, and all other followers of Ayurveda. Today, we have eminent personalities like Dr. Tanuja Nishri Madam, who is the Honorable Director of All India Institute of Ayurveda, New Delhi, and shouldering the multiple responsibilities at national level. We have Dr. Ashok Kumarji Vashneya sir, who is the Honorable All India Secretary for Arogya Bharati. And also we have my colleague in MEHS Nashik. She is the Senate member of MEHS and observer for the today's this 3 days conference, Dr. Hemlata Jalgaonkar Madam. It is the privilege to be here on this platform amongst all of you and to share my views and to listen Dr. Tanuja Nishri Madam and Jalgaonkar Madam. I would like to congratulate all the team members for arranging this 3 days national conference on evidence-based Ayurveda. The president of the ATA is Dr. Rahul Suryavanshi. Then Vice President Dr. Nitin Chandurkar sir, Dr. Manoj Chaudhary, who is the Secretary of the ATA, and Dr. Anand Madgundi sir, who is the Treasurer, and Arun Dudmal sir, working president of ATA. All of you know that we are celebrating this Azadi Ka Amrut Mahotsav, and tomorrow we will be celebrating that 75th anniversary of the 15th August of our Independence Day of India. And whole year we were celebrating this Azadi Ka Amrut Mahotsav in the commemoration of the independence of India. And lot of activities has been made, and this is the amongst all other activities that we are today gathered here for this national conference. We know that Ayurveda has done a lot of researches in related to the COVID-19. During that period, the Ayurveda has proved its efficacy in the viral diseases and these pandemic situations. And all my colleague at university level, at Maharashtra level, at all India level has contributed at an institute level and personal level. Today, this national conference is based on the evidence-based Ayurveda, and evidence-based. This is the theme in the medicine. As all of us know that whenever there is a subject of medicine, or whenever there is a concept of medicine, everybody is talk about the health. And according to the modern science, health is the merely absence of disease. But according to Ayurveda, actually it is not an absence of disease, but it is the enthusiasm. Everybody is showing enthusiasm. Whenever there is enthusiasm, he is the healthy person. And the concept is mentioned by the Ayurveda long year back, and it is very true till today, because if we check everybody is the patient. If we check everybody's blood, there will be cells of cancer in everybody's blood, but it is not clinically proved and it is not clinically manifesting. And this concept, and it automatically get dies off, and we will not get the symptoms. It is the immunity which shows us that enthusiasm in our life. And the concept is still alive, because the Ayurveda Shastra is called as Shashwat, and that's why the principles are still alive in this era of competition. The evidence, it is totally related with the research, and in the field of research, whenever there is a research point of view, we think there is a we need evidences in this era. So this topic may help to all researchers, all PGs and PhD scholars in India. And I congratulate once again to organizers for arranging this type of conference. Especially, this is evidence-based Ayurveda concept. I would like to congratulate from my side, also from the university side, and best wishes to one and all. Thank you very much. Over to Amar sir.
Thank you, Shrikant ji, sir. Thank you, Shrikant Deshmukh, sir, Dean Faculty of Ayurveda MHS, for your encouraging words, sir. Thanks a lot. Now, we are trying to share the video of Ashok Kumar Varshney ji. Please wait for some time. I am sharing the screen. Hello, Rahul sir.
Yes.
Sir, it is showing that it is unsupported file format.
Okay.
Right now.
Go ahead. Then
So we will,
next.
so we will move further.
We will.
Now
Yes, Manoj sir.
Yeah, we will post it on YouTube. as a part of our seminar.
Yeah.
Okay, sir. Okay. Thank you. Now I request respected to Dr. Tanuja Manoj Nesri, Madam, Director, All India Institute of Ayurveda, Delhi, to guide us and to announce the official inaugural of this seminar. Over to you, Tanuja, ma'am.
Am I audible?
Yes, madam. Yes.
Okay.
Yes, madam.
Okay. At the outset, I would like to congratulate the organizers of today's seminar, Ayurveda Teachers Association, and which is accredited by Maharashtra University of Health Sciences, Nashik. And it's really proud moment to congratulate and inform that it is a fourth consecutive national conference. And now this year, the Teachers Association have chosen the topic as evidence-based Ayurveda, which is very relevant, demanded, and in the need of a time. So once again, I congratulate all the organizers, especially Dr. Rahul Suryavamshi as a president, Dr. Nitin Chandurkar as the vice president, Secretary Dr. Manoj Chaudhary, whose constant pursuit made me today to join, Dr. Anand Madgudi as a treasurer, and Dr. Arvind Dudmal as a working president. And my colleagues who have joined here in this inaugural ceremony, colleague and friend Dr. Srikant Deshmukh, he is the Dean Faculty of Ayurveda. Namaskar, Srikantji. Dr. Ashok Vaisneyaji, whose video we could not listen, but I'm sure, as mentioned by Dr. Manoj Chaudhary, it would be uploaded and everyone could see it, listen it to it. Dr. Hemalata Jalgaonkar, and I'm happy to know that now you are heading and looking after as a principal Ashtang Ayurved Mahavidyalaya,
Thank you,
now
madam.
very prestigious institution which has given lot of scholarly leaders in the sector of Ayurveda. All the national executives, organizing committee, and all the teachers. And I was told that there are 1,500 teachers and faculties, those who will witness these 3 days, 2 days online, and the 16th is the offline. And very important, the discussions would be on of important topics, which is a strength of Ayurveda, and need to understand what are the success stories and how we create the evidences. Like it is on uveitis, it is Dr. Baviskar, urology, Shahane, pediatrics, Dornala. And I was told that on the Panchakarma, Dr. Anantram Sharma from All India Institute of Ayurveda, and many other stalwarts from across India will share their views of how they create the success stories, how to create the evidences, and evidence-based Ayurveda. This is to practice-based evidences. So I congratulate, I wish you all the best for the successful organization, as I know that in many of your conferences once I physically also attended, and the various relevant topics you have chosen, how to create, what are the different agencies for the research, what are the different areas. So it is always classical yet contemporary, and what are the relevant topics which faculty should know and to progress further in the career and for the system as well. So my all best wishes and compliments to association in particular and organizer in specific for this conference. And as mentioned my colleague, I also extend all my heartfelt greetings from myself and from All India Institute of Ayurveda for this Azadi Ka Amrut Mahotsav, 75th Independence celebration. That's the national festival we are going to celebrate. And I'm sure everyone would hold this, do this service with the national flag and have the selfie and upload on social media and get the certificate as a proud citizen of India. So with this, I just pray and all them attribute to all those who have given us this opportunity to live in the we live it happy and happily and peacefully in this after post independence day, and we are really happy, and I must share that we are now living in the golden era which is for Ayurveda, because starting from the prime minister to the ministry to the governments and to all the bureaucrats technicals, it is all हम ये कह सकते हैं आज अच्छे दिन आ गए हैं. I think we have to take the opportunity that because when there is a Lokashraya and Rajashraya, I think अच्छे दिन आ गए हैं ऐसा हम कह सकते हैं. So as we are witnessing the sectoral growth, if we can see that earlier pre-COVID, it was 5% growth in the market size. And the review suggests that post-COVID, there is a 23% rise in the Ayurveda market. So that itself says that the users of the Ayurveda have been increased tremendously. So COVID, it was the COVID pandemic that was the disguise for the humanity, for the Ayurveda and for the Ayurveda entire physicians and the fraternity. It is a blessing in disguise, because as mentioned even by Dr. Srikant Deshmukh, that the immunity is the buzzword, and even what we have understood during COVID time, that my health is my responsibility. Like those who really lived Ayurveda as a healthy, the knowledge system of healthy and happy life, with the diet, good lifestyle, following dinacharya, rutucharya, following achara rasayan, following the rasayan therapy as a immunomodulation, strengthening their immune system, they could prevent themselves from the COVID. And if at all, as we know that in this India, no one has been spared. So if at all COVID infection was there, but there was no severity and less mortality, so that immunity, our rasayan chikitsa, and the living the healthy and happy way is the way that the message all Ayurveda fraternity has given and has to communicate, spread in the community, in the public health and across the globe, because that's the soft power of India and the greatest gift to the humanity, as we say. So when we say that the evidence-based Ayurveda, it is not only the treatment, but also in the prevention and in the promotion, we have to create evidence, because the strength of Ayurveda is in the prevention, strength of Ayurveda is in the promotion and the maintenance. So that strength we have to capture, because when we say that what is the integration? Integration is a patient-centric integration. It is our role is to complement, not competition, complement with our counterpart. So earlier we used to say that what is the strength of Ayurveda? It's from taking illness to wellness, but other systems do illness to wellness, but our strength is leading to happiness also. So the journey starts from illness to wellness to happiness. In this sense, ऐसे माननीय प्रधानमंत्री जी जो कहते हैं 125 करोड़ देशवासी, so why we should say it is only patient centric integration? We should say that this system is a people centric integration, because promotion prevention is a people centric, and 125 करोड़ देशवासी ये तो भारतवर्ष के हो गए. Consider each and every living being, including the animals, including the plants, including the environment. यत पिंडे तद ब्रह्मांडे. क्योंकि हमने environment का one health का concept है, वो हमने ignore किया. We could not really establish harmony with the outside environment to the within ourselves, disturb the imbalance with the biological clock and universal clock, disturb the entire ecosystem. The result was pandemic. As we know that it is the Dushita Jal, Vayu, Desh and Kal, and it is the adharma that leads to the pandemic situation like COVID. And COVID has not gone. We have to learn. We are living still with the COVID. COVID still is on. Third wave, fourth wave, and now we have to learn how to live with the COVID-like situation, and that's the only immune system that will really help us in combating with such situations and preventing such situation and going to the next severity. So this opportunity, if we ask what is the opportunity, what we have, the ocean is the opportunity and sky is the limit for us. Those who consider it is a people centric, the science is a people centric for the prevention, for the promotion of the living being. And if we exploit each and every opportunity, not only for the human beings, for the animals, for the plant, there is a Bruksha Ayurveda, there is Ashwa Ayurveda. And for the environment, there are Desha, Kala, living in harmony with the nature, living in harmony, sustainable harmony, close to the nature. That's the message. What Ayurveda says that Yat Pinde Tad Brahmande, and Samanya Vises Siddhant tells us about that. Does not tell us about taking care of ourselves, like it take care of our environment, nature. That also it tells about us. So I think the spectrum is the broad. As GCTM, Global Center for Traditional Medicine, is established in India at Jamnagar, it is not only one pathy, that is Ayurveda, but 170 countries member state of the WHO, they has the similar traditional system, and it is all harmony, creating the synthesis of the evidence within each traditional system. And bottom line, like in computer, it is 0 and 1, which is the same, and the applications to the different sector of the life in the ministry, that computer IT applications are different in everywhere. Similar is the traditional medicine. Even though 170 countries has a different expression and application, down the line it is the same. It is a good diet, good lifestyle, thought process, rasayana, panchakarma, biopurification, and all ashtanga, that is from cancer to common cold, and then COVID to various conditions, communicable diseases and non-communicable diseases, the solution we have. So now what is the need? Because as we know that the strength is a tremendous, it is not only for prevention, promotion, but also complete therapeutic regimen. As we know that it is not only one medicine, as we know that the health is not the thing which can be brought from the pharmacist shop. Like the pharmacists, they were trying to get anti-COVID treatment, but it could be no one, now also no one has sure shot anti-COVID treatment, antiviral treatment. It is the holistic and integrated solution. So the holistic in the sense that it is the Panchakarma diet, lifestyle, Ayurveda medications, yoga, meditation. So it is a mind, body, and soul. So all the measures which includes physical, mental, spiritual, and social health is the one which we really have to take care. Yes. Yes, doctor. I'm just concluding within 2 minutes. I just would like to say that these, for the holistic and integrated solution, if we try to create evidence, that's the way we have to understand or just discuss. Everyone is discussing about one condition and how to create the evidence. But as we understand the strength of Ayurveda, is creating evidence in all these aspects. That's I just wanted to highlight. The second is our strength is clinical strength. So we have to move from practice-based evidence to the evidence-based practices. So we have 750 Ayurveda institutions. We have 7 lakh Ayurveda practitioners. We have the OPD. So why not to create ERP, electronic medical record? Try to create documentation, case history. That itself is become the evidences. We have IU care, all India, and that is UGC care now. So the clinical cases, peer reviewed and having the well documented data with the conventional outcome measure is also one level of evidence that we have to really start documenting practice-based evidence. If 1 case, 2 case, 10 case, 100 case, document, analyze, and present. So the publication is also very important. Starting from practice-based evidence, then we have to go to evidence-based practices, a double-blind goal control standard, and then meta-analysis and the synthesis of the evidence, scoping review, all these aspects we have to take care. But my sincere appeal to each and everyone, please start and have that habit of inculcating documentation and well structured documented case record from very well structured, and all the outcome measures should be the conventional which entire world understand, then that should have will have the translational value. During COVID time we had 150 clinical studies which are CTRI registered. We did public health initiative as Ayu Raksha, but that we did with public health research initiative with the Ayu Raksha as a combo pack, and that has been published in Frontiers of Public Health, which has an impact factor of 6.1. So whatever we do, just distributing kadha does not help. Whatever we do in the community, in the public health, whatever distribution we do, just create a Google form, just capture the feedback, and that itself becomes the evidence. The Sanjeevani app, Ministry of Ayush developed only Google form, distributed the kadha and captured the evidence, and 87% people said that they got the relief. That is the evidence. So the evidence and synthesis of evidence is in a good documentation which has a reproducibility and using the conventional outcome measures. At All India Institute we have 30 specialty unit. What we do, like in diabetes, 41,000 cases where HbA1c and all the outcome measures have been understood, but in between we do holistic Ayurveda principle theory and application practices, Tattva Shastra Vyavhar. We do Panchakarma diet lifestyle as a black box, one approach, as a systems approach, but only thing we do just outcome measures capture. So don't deviate from our own Ayurveda. There is no need to do just follow of others, follow our own science, intuition, the practices, but outcome measure should be as per what world understand. That is what is the evidence-based Ayurveda. To all my teacher colleagues, whatever facility you have in your institution, because you have teaching hospital, please document case record form, well documented case record form, well analyzed, well presented. That itself gives you a true evidence. So my all best wishes to each and everyone. I'm sure that the future is bright if we really consider this evidence-based Ayurveda, from practice-based Ayurveda to the evidence-based Ayurveda, I think is the way of the future. Thank you one and all. Thank you Manoj Chavdari for giving me this opportunity. Namaste.
Thank you very much, ma'am.
Thank you, Tanuja Nesri Madam, for your valuable words, blessings, and best wishes. And thanks for giving such a detailed, important upgradation in our Ayurvedic field and upcoming opportunities, and encouraging all our delegates for the further extended work in our Ayurvedic field. So moving further, now I request Dr. Rahul Suryavanshi sir, who is National President of the Ayurveda Teachers Association, for the presidential address. Over to you, Dr. Rahul sir.
Am I audible, sir?
Yes, sir, you are audible.
Very good morning to all. First, I want to wish in advance our Azadi Ka Amrut Mahotsav ki sabhi ko shubhkamnaएं. Very good.
Oh,
Wish you very happy 25th
yes.
Independence Day.
कुठलं?
Hello.
नेत्रायू हॉस्पिटल.
Hello.
नाही मी डायरेक्ट हे जॉईन होईल ना, मला येतंय पूर्ण.
Chairpersons,
It is totally okay.
session coordination.
Please mute the mic.
And our chief guest.
Continue, sir. Continue, sir.
Distinguished participants, speakers, chairpersons, co-chairpersons, session coordinators, and our beloved chief guest, Dr. Tanuja Nesri ma'am, Director of All India Institute of Ayurveda, New Delhi, who already participated in our second national conference, Research in Ayurveda. She was chief guest and also speaker of that conference. She always support us. Our another chief guest, Dr. Srikanth Deshmukh sir, who is my teacher, where I did my PG, who always support us from university side and from his personally. He also always give us compliments regarding our activities of Ayurveda Teachers Association. Another one chief guest, Ashokji Varsne sir, due to some technical error because of mobile range and all the net range, he sent his video. We will play it when the technical problem solved. But he give us very good vishesh. I think 10 to 12-minute video was that. I already heard that. And he take all brief regarding our Ayurveda development and Ayurveda education. And he also उन्होंने कुछ टीचर्स के बारे में बहुत अच्छी बातें की और टीचर्स के सम एक्सपेक्टेशंस उन्होंने हमें दिए, वो हम अपलोड करने जा रहे हैं. और अनदर वन चीफ गेस्ट डॉक्टर हेमलता जलगांवकर मैम, who is our observer from MUHS, Maharashtra Institute of Health Science, Nashik. She is also principal of Ashtanga Ayurveda College, Pune. I am extreme, and Dr. Rajesh Pawar sir, who is my mentor and who is always guiding us for this conference since last first conference. Dr. Hemlata Jalgaonkar ma'am, I am extremely happy to welcome you in this inauguration cinema of evidence-based Ayurveda. In last 3 years, uh, since last 5 years, we are working for the welfare of Ayurveda education and welfare of all Ayurveda fraternity, teachers, students, practitioners. In the journey, with the demands of the teachers, students, and practitioners, we also want to enhance the Ayurveda education and enhance the knowledge. For that, this is the part of the conference to enhance the knowledge throughout. In first conference, we took the subject of teachers demands, teachers expectations. In second conference, we improve that. Second conference take on the subject that is research in Ayurveda, in which teachers, students, and practitioners are participate. Around 1,000 delegates are there. In third conference, again we improved. That conference is update on Ayurveda. That conference was held for 2 days, and around 3,500 delegates participated from all over India. Now this is the fourth national conference which has evidence-based Ayurveda. Our dean, Dr. Srikanth Deshmukh, told us that अगर आपको रिसर्च करना है तो एविडेंस आपको सामने रखना चाहिए. तो हमने सेकंड कॉन्फ्रेंस में रिसर्च इन आयुर्वेदा टॉपिक लिया था. थर्ड कॉन्फ्रेंस में हमने अपडेट इन आयुर्वेदा एक टॉपिक लिया था. और अभी ये फोर्थ कॉन्फ्रेंस है, उसमें हम एविडेंस रखने जा रहे हैं. तो सीरियली वी आर अपडेटिंग आवर कॉन्फ्रेंस, अपडेटिंग आवर delegates knowledge serially with the theme. I believe that by participating in this webinar, we are in the right place and the right time together. Let us accelerate the exchange of ideas and scaling up of good practices in Ayurveda. अभी नेसर मैम ने भी हमें बताया, this is the golden era of Ayurveda since Ayush Ministry is formed by our Prime Minister Mr. Narendra Modi. सच में वही बात. अभी अगर एजुकेशन के बारे में भी देखा जाए और ओवरऑल फील्ड ऑफ द आयुर्वेदा, दिस इज सच में दिस इज द गोल्डन एयर ऑफ द आयुर्वेदा. तो हम सभी को एज अ पार्ट ऑफ दिस आयुर्वेदा इस चीज का फायदा उठाना चाहिए कि आयुर्वेद को अभी इंटरनेशनल लेवल पे है, लेकिन ग्रास रूट लेवल तक आयुर्वेद को कैसे लिया जाए. और उससे पहले जो भी हम वी आर द पार्ट ऑफ दिस आयुर्वेदा, सभी को एक कॉन्फिडेंस आयुर्वेद में आना चाहिए और हमें वो कॉन्फिडेंस देना है थ्रू दिस नॉलेज. फॉर दैट पर्पज वी आर ऑर्गेनाइजिंग दिस कॉन्फ्रेंसेस. आई एम वेरी कॉन्फिडेंट दैट you will find new ideas, fresh energy, and novel partnerships to sustain your efforts for Ayurveda. I wish you all a very successful conference for this all speakers. अगर हमें आयुर्वेद का डेवलपमेंट करना चाहिए तो उसमें हमें माइक्रो लेवल पे जाना चाहिए. माइक्रो लेवल पे जाना चाहिए यानी मीन्स that is we have to go for the specialties. अगर हम मॉडर्न में जाते हैं, एक पेडियाट्रिक सब्जेक्ट लेते हैं, तो पेडियाट्रिक सब्जेक्ट में पेडियाट्रिक सर्जन अलग है, नियोनाटोलॉजिस्ट अलग है, पेडियाट्रिक ऑर्थोलॉजिस्ट अलग है, यानी ओनली इन पेडियाट्रिक ब्रांच देर आर 4 to 5 सुपर स्पेशलिस्ट, पेडियाट्रिक ऑप्थेल्मोलॉजिस्ट अलग है। और अपने आयुर्वेदा में अभी भी हम शाला के सब्जेक्ट देखें तो उसमें हम ऑप्थेल्म ईएनटी एक साथ में लेके बैठे। इफ यू वांट टू डेवलप दैट कंसर्न ब्रांचेस वी हैव टू गो फॉर द सुपर स्पेशलिटी। तो उसी हिसाब से हमारे इस कॉन्फ्रेंस में अराउंड 15 स्पीकर से 15 टॉपिक्स हमने
Rahul sir.
all 15 topics are covered for the super specialty. I think it's raining outside, but for this 3-day journey, also the shower of knowledge will be to all our delegates from our speakers. From my side, thank you to all our guests and all our participants to participate in this. Thank you. Jai Ayurved, Jai.
Thank you.
Amar sir, over to you. Dr. Amar Kamble sir.
Amar, you are not audible.
Okay, sir. Dr. Nitin Kamdhuskar, say vote of thanks for this.
Hello, sir.
Ah.
Now moving further, I request Dr. Nitin Chandurkar, sir, our National Vice President of Ayurveda Teachers Association, for the vote of thanks. Over to you, Chandurkar, sir.
Okay, thank you, Amar. I, Dr. Nitin Chandurkar, National Vice President of ATA, on behalf of entire ATA team, thanks to our chief guest, Dr. Tanuja Nesri Madam, Director, All India Institute of Ayurveda, New Delhi, for sharing their valuable thoughts for the delegates of today's conference. I also thanks to Dr. Shrikant Deshmukh sir, Faculty Dean of Ayurveda, Maharashtra University of Health Science, Nashik, for their sharing their thoughts. I also very much thanks to Dr. Ashok Kumar Vasniye ji, Rashtriya Sangathan Secretary Sachiv Arogya Bharati, for sending his best wishes for the seminar. I also very much thanks to Dr. Hemlata Jalgaonkar Madam, observer for the conference and principal of Ashtang Ayurveda College, for sharing her thoughts. I also thanks to Maharashtra University of Health Science, Nashik, for the accredited this conference. I also thanks to all speakers, chairman, co-chairman, session coordinator. I also thanks to, I express my gratitude, Dr. Rahul Suryavanshi sir, National President, Dr. Manoj Chaudhary sir, National Secretary, Dr. Anand Madgundi, National Treasurer, and entire team of Ayurveda Teachers Association for contributing the organizing team. I also thanks Dr. Amar Kamble sir, Dr. Sonia Dhat for successfully coordinating the event of inauguration ceremony. And I also thank to digital platform for providing the technical support. Last but not least, I thanks from my bottom of the heart to all the delegates present for the ceremony, and thanks to all. Thank you. Over to Amar sir.
Thank you, Dr. Nitin Chandurkar, sir, for this vote of thanks. Now, we are coming to the end of this inaugural ceremony. Here, I declare that our inaugural session of the seminar is executed successfully and it is completed. And lastly, I again thank to all the respected chief guests, Dr. Tanuja Nesri ma'am, Director All India Institute of Ayurveda Delhi, Dr. Shrikant Deshmukh sir, Dean Faculty of Ayurveda MUHS Nashik, Dr. Ashokji Varshney from Arogya Bharati, and Dr. Jalgaonkar madam, Principal Ashtanga Ayurveda College Pune, for giving us the valuable time for inauguration of this seminar. And I also thank from the bottom of my heart to all the dignitaries, National President, National Vice President, National Secretary, and National Executive of Ayurveda Teachers Association for giving us the opportunity for the coordination of this opening ceremony. And lastly, I thank all the delegates and all the panelist resource persons for attending this opening ceremony of the national seminar, fourth national seminar on the evidence-based Ayurveda. Thank you one and all. Thanks a lot. And now further, we are going to start the sessions of the first day. Thank you all.
Thank you.
Thank you, sir. Thank you. Thank you.
Thank you,
Sir,
madam.
good morning.
Thank
morning.
you.
How are you, sir?
Thank you, madam.
Fine,
Thank
fine,
you.
and
Everyone,
congratulations.
thank you,
Thank you.
everyone.
Thank you, madam.
Thank you, sir.
Thank
See you again. See you.
Thank you, Shrikant Deshmukh
Yes.
sir.
Thank you. Bye. Yes. Thank you. Bye.
Thank you, Jalgaonkar madam.
Thank you, sir. Thank you, sir.
दे आता नाश्ता पाणी आला.
Amar sir, please continue for our session.
Okay, okay, sir. Okay.
First session.
Now we are moving further to the sessions of the first day. I request all the others to keep your mic mute so that we can easily conduct the sessions of the first day.
Dr. Tandurkar sir, please mute. Please, Dr. Tandurkar sir, please mute your mic.
Okay, okay.
So we are starting with the first session. The session coordinators for the first session are Dr. Milind Gore sir and Dr. Sharamali Pause ma'am. First, I will introduce Dr. Milind Gore sir. I will give the brief introduction of Dr. Milind Gore sir. Sir is working as a associate professor and HOD at Kamla Devi Gauridatta Mittal Ayurveda College and Hospital, Charni Road, Mumbai. He has total experience of 17 years in the teaching field. He has received the Young Scientist Award, late Srimati Pramila Tai Kanade Young Scientist Award by the hands of Honorable Director of Ayurveda, Dr. Kuldeep Raj Kohli sir in 2015 in the National Seminar of Update Shalakya 2014. He has presented almost 4 international and 1 national research papers. He is indulged into the ongoing research projects like Ayurvedic therapy in macular degeneration, Ayurvedic therapy in Adimanta, that is glaucoma, and therapy of the phacoemulsification cataract surgery from Narayangao district, Pune. Then for the introduction of Shalmali Pause ma'am, I request to Dr. Sonia ma'am. Sonia madam, over to you for the introduction of Shalmali Pause madam. Hello, Sonia madam. Our next session coordinator is Dr. Shalmali Pause Madam, which has completed, who has completed MA Shalakya Tantra from the Tilak Ayurved Mahavidyalaya, Pune. She is working as an assistant professor, Sumatibai Shah Ayurved Mahavidyalaya, Hadapsar, Pune. She has the experience as a clinician and surgeon in Netra Rog since 4 years. She has teaching experience of 2 years. And she has worked as a coordinator in various national and international conferences organized by the Association of Shalaki. So over to you, Dr. Milind Gore sir and Dr. Shalmali Pause ma'am for the conduction of session first. You can start the session, Dr. Milind Gore sir and Dr. Shalmali Pause ma'am.
I welcome all the delegates who are participating in this conference. I also welcome today's speaker, Dr. Hemant Bhaviskar sir, Chairman Dr. Rajesh Pawar sir, Co-Chairman Dr. Nilakshi Pradhan ma'am, and Dr. Jayavant Karat sir. I will hand over this online dais to Shalmali Pause for further conduction.
Thank you so much, sir. Myself, Dr. Shamli Pause. I welcome you all for the first session of day 1 of 4th National Conference of Ayurveda Teachers Association on Evidence-Based Ayurveda. The topic for the first session is uveitis and Ayurvedic overview. To chair this session, I welcome Honorable Dr. Rajesh Pawar sir. Dr. Rajesh Pawar sir is a very well-known ophthalmic consultant and surgeon in Pune. Sir is practicing since last 40 years and sir has performed more than 70,000 surgeries. Sir is honorary eye surgeon at Sani Gurji Arogya Kendra Hadapsar. Sir is nominated as a member of MCIM by Government of Maharashtra. Pawar sir was Honorable Secretary for Pune Ophthalmological Society. Sir has been invited for various camps, seminar, conferences, not only in India but abroad too. Sir is a very active member in Netra Seva Pratishthan, and sir has been awarded with various awards like Karya Bhushan Award, Sahib Rao Satyavati Madan Award in Community Ophthalmology, Dr. Madhusudan Zawar Award for Community Ophthalmology, and Legion Shalaki Award by the Association of Shalaki, and many more. Sir has various records in Limca Book of Records. A very warm welcome to you, sir. Then co-chairperson of this session is Honorable Dr. Nilakshi Pradhan Madam. Dr. Pradhan Madam is Professor and HOD at Shalakya Tantra Department of Sumatibai Shah Ayurved Mahavidyalaya, Hadapsar. Madam has teaching experience of 20 years and Madam is also former principal at Hadapsar Ayurved College for about 6 years. Madam has conducted various eye camps, few of which were mentioned at Limca Book of Records. Madam was invited for various national and international seminars as a keynote speaker, resource person, and chairperson. Madam is editor-in-chief at various national and international journals. Madam is also a Senate member at MUHS and also worked in various committees at MUHS. Madam has received various awards like Ayush Kamal Bhushan Award, Jnana Vignan Award, Savitribai Phule Award, and Karya Bhushan Award by RSM. A very warm welcome to you, Madam. Our second co-chairperson for this session is Honorable Dr. Jayavant Karat sir. Sir is Associate Professor and PG Coordinator at Anna Saheb Dange Ayurved College, Ashta, Sangli. Sir has 8 years of teaching experience. Sir has worked as a hospital administrator, COVID center in charge, and various committees at Anna Saheb Dange Ayurved College. Sir has also worked in various committees in MUHS and MCIM. Sir has attended various national and international seminars as a speaker as well as training. I welcome you, sir. I welcome you all. Now I request Dr. Pradhan Madam to welcome and introduce our eminent speaker of the session. Over to you, Madam.
Good morning, everyone. Thank you so much, Dr. Shamli, for your kind words. At the beginning, I would like to congratulate all the organizers for this noble attempt. And along with that, I would like to express and extend my wishes on Azadi Ka Amrut Mahotsav. सभी को शुभकामनाएं. इसी के साथ I'll begin with introduction of our guest speaker. Dr. Hemant Bhaviskar sir is a very well-known personality in Ayurveda, especially in the field of Shalakya Tantra. I don't think he needs any different introduction, but still, I'll be introducing him. I'll try to introduce him in a short way. So, sir is a recipient of many awards. He has received Vaidya Khadiwale Award. Along with that, he has received Karya Bhushan Award. He is a director of Nimi Eye Care and Research Ayurved Netra since 2006. He's giving benefit of his treatment to the patients from Jalgaon, Pune, even at Mumbai. Except for surgeries, sir has a specialty to treat all the maximum of the chronic diseases by his Ayurvedic treatment. So without wasting any moment, I would like to request Dr. Bhaviskar sir to begin with his speech. Thank you so much.
Thank you, Nilakshi ma'am, introducing for me for this session today. I am also thank you to all the organizers or teachers associations of Ayurveda in this 4th national conference as evidence-based Ayurveda. Also, I am thankful to my especially Guru Varyas, led Dr. Paras Shah sir, and here is also the chairperson Dr. Rajesh Pawar, who is here as a chairperson. Thankful to all and giving me this opportunity. And Dr. Sabir Jamadagni sir, where I learned my Ayurvedic principles and all the Ayurvedic expertise from there from last 25 years. So with this seminar, we are going to present the one topic which is very important as a vision threatening problem in the society. One of the vision threatening problem, as you know, how much this problem is at their level in society, that many more institutions having the special departments for this uveitis, because the patients are more in the society with the disease, and it is very complicated as for the diagnosis. And as we see, it's types of uveitis. It's a challenging treatments. Many of requires the steroid dependency and monitor for the lifelong. So to start with this, first principle of Ayurveda is that when we have a good vision, then this world will okay for us. When anyone can have a problem with his vision in his routine life, that patient is very threatened, or that person is very threatened, that how this occurs and what the problems. When you go to the normal ophthalmologist, there are many more diseases as a vision threatening in the modern point of view. There are various names, and they are going the changing the principles. As we see the glaucoma, previously it was only pressure dependent, but now it is a whole entity of the eyeball. And also they are just searching for it's a whole entity of the body, that the response from the body to the eye. Okay, so these are the changing principles, and the what are the researchers are going on at the name changes and the area of the diseases of the changes in this. So Acharya says, चक्षुरक्षाम सर्वकालम मनुष्य यत्नो कर्तव्यो जीवित यावच्चा. जब तक विजन है तब तक ये लोक अच्छा लगता है. जब विजन में कुछ प्रॉब्लम आता है, वन शुड हैव टू केयर फॉर हिज विजन until he wish to live. No meaning if blind person may have a good abundant money with him and also he feels day and night are the same. So going towards the facts of uveitis. Uveitis is an ophthalmic emergency. Keep in mind, because here are not only the ophthalmologists who are hearing, the professors of Ayurveda colleges and the principals and male dignitaries. So in short, we are going to discuss by the modern point of view as what the uveitis is. Uveitis, keep in mind, the uveitis is an ophthalmic emergency like a glaucoma. But after uveitis, the chronic uveitis, the patient may land into the glaucoma, because that is the next step. Pressure is the next step of uveitis if not treated properly. So it's a urgent treatment is required for that. So there are types of uveitis, many more. We will go ahead and we will see. The treatment usually involves the use of systemic and local steroids. When patient came with you in your OPD, that patient says that I am putting these drops so long period, from the 5 years, from the 4 years, and having the systemic steroids also, which is not going to stop the, I will visit the doctor, then they show that the treatment should be continued for another 3 months or another 6 months. Like that, patient from the 3 months up to the 20 years, 20, 30 years or the lifelong, they are using the steroids. There are many more side effects of the steroid they are facing, especially in the adult one. They are facing the very dangerous, the glaucoma problems and the cataract problems in early age 20-25 to have this steroid side effects. So there is comes in a role of Ayurveda. So first of all, I am telling that what is the role of Ayurveda in the uveitis. Looking this scenario, we are trying for the patient to reduce these steroids first, steroid dependency first, and then we are giving the patient or having a good control on the disease by Ayurvedic point of view. So as uveitis, how you going to diagnose the uveitis in Ayurvedic point of view? There are many more conflicts that uveitis is the Sashopakshipak, Ashopakshipak, or the Akshipakatte, or Shushkakshipak. No, because there is no any vision threatening symptom in that. In Sashopakshipak, if corneal means we will call it the dry eyes, you have some lacerations, or in next stage you have a corneal involvement. At that time you can get the diminish of vision, not the vision lost for the lifelong. But in uveitis, it's going to have only the adimantha, which is the vision threatening problems. Once many more patients present with the pressure, or other patients present with the inflammatory conditions, not the pressure. So there are the Vataj, Pittaj, Kafaj and Raktaj types of entities in Ayurveda, but you say the diagnosis of Ayurveda. So the brief, this is the explanation of uveitis and the Ayurveda. The complications when you are not treating properly is a uveitic glaucoma, retinal detachment, optic nerve damage, cataracts, and permanent loss of vision if not treated properly. Still 10 to 20% of cases of blindness treated properly means there is a exact standard line of treatment. Still patient have the blindness in 10 to 20% of cases, which is not also controlled by the local steroid and the immunosuppressive agents. The uveitis is association with genetic factors, autoimmune disease, infections, and the incidence is 1 in the 4,500 people. Most commonly between the ages of 20 and the 60. You see this mostly common between the age period. This comes under the Pittaja Avastha. See, Balya Avastha is the Kafaj. second adult is the Pitta, and the old one is the Vata Javastha. So you see the age process as he required the Rakta Mokshana and the Pittagna Chikitsa, means Virechana for the Pitta and the Rakta Mokshana for the Pitta. So most of these patients, when you are going to see, it's this category. So you should not think many more, go for the Virechana and the Rakta Mokshana. So uveitis is the inflammation of uvea. The pigment, what is the uvea? As in anatomically, lies between the retina and the sclera and the cornea. In between, you can see in the image the brownish layer behind the white layer of sclera, that is a choroid. So uvea consists of vascular structure, that is abundant blood in this area of the eye, and it includes from the anterior, it's the iris, ciliary body, and the choroid, where the uveitis is lies in between. The uveitis, as per modern science, it is divided into two types. It's the autoimmune disease and the infective disease. So the autoimmune disease is treated by the steroids and the immunosuppressive drugs. And patient having a list of total group of investigations for infective diseases, as when the patient having a proper diagnosis like a cytomegalovirus, reactive arthritis, shingles, syphilis, and toxoplasmosis, then there is a specific treatment for that, that antiviral also. So there are patients having a good relief with the uveitis, but many more patients when come to your OPD that are only by the autoimmune diseases. According to the modern, there are 4 types of uveitis: anterior, intermediate, posterior, and the panuveitis. The anterior uveitis lies in between the anterior part of eye, that is iris, and the anterior chamber, that is anterior cyclitis, and the iridocyclitis we are calling. The intermediate, it is in the vitreous, means paras plana, posterior cyclitis, and the highlightis, and the inner layer of the retina and the vitreous, it is called as intermediate, and the posterior, it is involved the retina and the choroid, where the focal, multifocal, diffuse choroiditis are occurred. Chorioretinitis, retinochoroiditis, retinitis, and the neuroretinitis. These are the parts where the disease we will going to see. And the panuveitis, where the anterior chamber, vitreous, and retina or choroid, these all the eyeball structure are involved in that, and that is when not going to treat very early, the patient may going to the blind. Going towards the symptoms, see, for the anterior chamber, you can see the redness, pain, photophobia, and diminished vision is the typical symptoms of the anterior uveitis. So if patient is present with the intermediate and the posterior, you can see these 2 symptoms. These are the common types. There is a painless flutters, you can see on the right image, and the left side is a blurred vision. But in this anterior chamber, patient does not feel there is a diminished vision the first in episodes, but later chronic stage he may also have the problems. So here is no pain, nothing, painless diminish of the vision. It's a intermediate and the posterior uveitis. And what are the signs? When we see by the ophthalmologist, there is a irregular on the slit lamp. You see the irregular pupil, dilated ciliary vessels from the sclera part, flare in the anterior chamber. They are floating in the anterior aqueous. Keratic precipitations. In the second image, you can see the arrows. They are showing the keratic precipitations. They are the iris pigments inside the corneal layer, and the anterior synechia means there is iris, it adhere to the anterior capsule of the lens. So this is the typical anterior uveitis when pain, photophobia, and all emergencies problems are there. But patient does not have any symptoms, only flutters and the blood vision. It's an intermediate or the posterior uveitis. So at the last one, you can see there is a hypopure. In the last image, there is a example of the panuveitis. So this is brief idea of evite by the modern point of view, going towards the Ayurvedic Nidana. So, Shira Anusaribir Doshir Vigune Ruddhomagati, Jayanti Netra Bhageshu Roga Ha Paramadharana. You can highlight this Jayanti Netra Bhageshu Roga Paramadharana. Ama Shegat Viguno Dosha, Sira Anusarena, Vurdhvagati, Netra Roga will occur, and that is Paramadharuna. You can hear this word, or you can see this word. The Paramadharuna means it is not very easy to treat. It is very daruna. It's going towards the yapya or means asadhya. Where we are going to see this uveitis in the netra as per mandala. In Sarvashraya Roga, Sarva Netragata Roga, and the Drushti Mandala. In Sarvashraya Netra Roga, the Abhishanda means conjunctivitis, and the other one is Adimantha, where we are calling the glaucoma in today's tongue, that compared with that pressure, it is Adimantha. Not only that, but it is a Sarvasraya, it's denoting that it's the anterior uveitis. And in Drushti Mandala, there is no pain inside the patala. Drushti Mandala is the inside the patala. Means Pratham, Dvitiya, Tritiya, and Chaturtha patala. Means Susruta said that in Drushti Mandala, there is a Kach, Timira, and the Lingala. There are the vision threatening problems, which are the Yapya in nature or Asadhya in nature, except the Kapaj Linganas. All the Linganas are Asadhya in nature. This is the Drushti Gata Netra Roga, which is lie in the Sarvasraya and the Drushti Mandala. You can see this shloka, it is very, very basic. Prayana Seronayana Mastu, Bhavante Abhishanda Nimitta Mula, Tasmad Abhishandam Udiryamanam, Upachared Ashu Hitaya Dhimana. See, it is a very simple conjunctivitis. We are comparing that. Means Araktata Shrav Kandu, Shotha, and the Vedana and the Prakashankta. When you have only foreign body sensation, you are very upset and go towards for the consult the ophthalmologist and remove that. But for the redness, photophobia, and everything, all the symptoms, when the patient is an emergency to go to see the ophthalmologist and take the drops and clear it out. So what Vagbhata says, Acharya Vagbhata says, Upachared Ashu Hitaya Dhimana. Upachared Ashu means uski चिकित्सा बहुत जल्दी से जल्दी करना चाहिए. हिताय means बुद्धिमान जो है वो रुग्ण के हित के लिए जल्दी से जल्दी उसका चिकित्सा करे. Means that Abhishanda is also an emergency. Okay, you should not treat it. You may go in the corneal involvement and the inner patalgata involvement and having a Drushtinasha. If you are not treating the Abhishanda properly, if not treated, Akriyavatam, Akriyashil, then Vruddha dosha converted into the Abhishanda, into the Adimantha with severe eye pain. This is the main symptom. This is a severe eye pain. So according to the modern science, the pain is the factor in the anterior uveitis. So we can compare this Adimantha to compare this and with a diminish of the vision. So it is not only the glaucoma, but it is the part of uveitis also. Ruddhiratir abhishandar naranam kriyavatam tavanta Adimantha sur nayono tivra vedanaha. If abhishanda is not treated properly, then it converted into the Adimantha, means anterior uveitis. You can compare this as you see this over here. Thrombing, cutting pain in the eyes, deep redness, piercing pain, dryness and watering, foreign body sensation, and Vagbhata includes, Acharya Vagbhata includes the pain around the eyeball and frontal headache. Means this is a typical anterior uveitis as shown in the Adimantha with a diminish of the vision. This is the main consult with this anterior uveitis. So anterior uveitis and posterior uveitis and the intermediate uveitis. So our Acharyas also known that there is a difference of the treatment in the painless vision loss and with pain vision loss. So you can see the sign and symptoms on the left side. In middle there is a Kacha Vadhi, which is Yapya in nature. So here I am showing this as in color. When the orange color appears, that is Yapya in nature, and green color showed it is a Sadhya in nature. Dhumadarshi, we are seeing the serous retinopathy, CSR or CSCR. It is also come in the Kacha category, but it is a Drushti Mandalagat Vyadhi, but it is Sadhya in nature. but kacha is the yappe in nature, what the acharya said. But on the right hand side, you see the sarvagata roga and the adimantha, where pain is there. You can see the last 2 points. Diminish of vision present in the both, and headache may present in the dhumadarshi and kach, may present in complicated cases. So you can see there is no pain, redness, watering, foreign body sensation in kach and dhumadarshi, but in adimantha you can get all these symptoms with the same problems in the anterior. If it is not treated, the Kacha Adimantha takes years to have the vision problem. But in Sarvagata and Adimantha, in uveitis also, if not treated properly with the steroids and the local drops, patient may going towards the blind very early, days and in months. So it is not a Kacha Vedi. In the anterior uveitis, it is a Adimantha Vedi. What is the types of anterior uveitis? It is a Vatas, Pittas, Kaphas. As per that, you can see in Vata, Arni Mantanavat pain, foreign body sensation. In Pitta, severe redness and burning. You can see the comparison between the Vata as in anterior uveitis, if not treated, going towards the blind within 6 days. And in Pittaja, if not treated properly with severe redness and burning, it's a immediate. It is a flushing type of anterior uveitis. If not treated, it going to like a pan uveitis or angle closure glaucoma, we call it as a hatadimantme. So it's an immediate vision loss. And in Kaphaj, netra shofa and edema, it may take 7 days and the anterior chamber obstruction only. And in Raktaja, severe redness and the tenderness of the eyeball. These are the specular symptoms in the Raktaja. That is intermediate uveitis. It may occur in the intermediate and the blindness may be in the 4 days. So what Adimantha, if not treated, when patient do not treat Adimantha in early stages, patient may go blind within like this 7, 6, 5 days, and the immediately at the left side you can see the doshas. As Susruta in 620 we have seen, and going toward the inside the eyeball where the kach and the parimlai as per Susruta, the Vadi is lie in the patala, means Pratham, Dvitiya and Tritiya patala. Patient feel partial vision loss, doctor sees the signs, but patient only feel the vision loss and the floaters. These are the 2 typical things in the inside eyeball. Central peripheral or both areas means all chorioretinopathy comes in this Kach Vedi. So at the end, doshas are in dhatus with a sthira guna, sthana dushti, then it is a kashta sadhya and yappe in the nature. It is in orange color, so it is in appe in the nature. This is very simple. Dhumadarshi, CSCR, means Hetu, Shoka Jora, Shrama and Shirobhitapa. Patient sees only foggy, smoky vision. And patient, if you can see the OCT image with that, you are seeing there is a elevation of the macula and the serous fluid back the macula. But patient having the vision of 6/9 or 6/6. It's only a foggy vision. You can see the objects from the fog or the smoky. If doshas is at macula, the central vision will diminish. If recurrence, then partial permanent vision loss may be there by the RP deformation. Here is the important role of Ayurveda due to its root cause of treatment. Okay, in the recurrence, there is a role of Ayurveda. It is self-recovered, as modern science says in Ayurveda also. It will recover. It is a Sadhya Vedi. But in according to the modern, it will automatically heal. But if recurrence is there, there is the involvement of treatment in modern also in Ayurveda, but it is completely Sadhya. So in the Sadhya Sadhyatva and the plus Chikitsa Sutra, what will be the Chikitsa by the Ayurvedic point of view? You can see in the Sadhya list, the conjunctivitis, glaucoma, anterior uveitis. It is a Vedya Vedi. As per the differentiation, Chedya, Lekhya, Bhedya, Vedya, as these all types of anterior uveitis, glaucoma and conjunctivitis, it should be Vedya in nature. Means Siraved or Jalauka Ucharan, you should do the treatment. And it is Sadhya in nature, as is denoting by the green color. Okay. But all the retinopathies, means Kach, refractive error and the Pashmapopa, these are all the Yappe in nature. All the absolute glaucoma, end ophthalmitis, Akshipa, Katte, Linganash, these are the Asadhya. two agantuj vyadis, these are also agatya. The internal intermediate post uveitis, dhumadarshi, it is sadhya, and intermediate post uveitis, kacha, yapya, and the kashta sadhya in nature. Going towards the directly chikitsa, you know where the anterior uveitis and posterior uveitis as per adimantha and the patalgata rogas. Sankshepada kriyayogo nidanam parivarjanam nidan vatadinam pratigatam prokto vistartapuna means nidan parivarjan pratyaghat and the shaman shodhan and the kriya kalpa. So as per the granthas chikitsa sutra in vataj pittaj kafaj and the raktaj, in vataj we should give the purana gruta pana svedana and the siramoksha. After that you can give the virechana and snehabasti as niruha and tarpanadi kriya kalpa. If not treated, it will going towards the blind in the 6 days. It is very important. You should do this standard line of treatment as per vata, purana grutapana, svedana, and the siramoksha. In pittaja, siramoksha virechana, kafaja, siramoksha, svedana, avapidanasa. See the difference. Here is a kafa, so svedana and avapidanasa is told by the acharyas. But in pittaja, siramoksha and virechana, it is ashukari because it is a vision threatening. It is immediate vision loss. So you should do the siramoksha first to have the doshas removed from there and have a normal means is the doshas. In virechana, you have the total koshta shodhana. Due to that, after the episodes of this adhimantha or the uveitis may not occur. In raktaja, it is a typical treatment kumbhagrutapana, manasarasa, and the siramoksha. If you not go by this standard line of treatments, the patient will die, diminish vision after 5 days. Kacha parimlai chikitsa sutra, bhavanti yapya khalu shadamaya. So modern treatment also said that steroid should be continued lifelong in immunosuppressive for a long time. So what is the basic line of treatment in the posterior uveitis? It is yapya in nature. Siramoksha, purana gruta, and nitya virechana should be the line of treatment as per Susruta. So this is a tilvaka grut you can use in that. Bark is used. The best virechak dravya. It is a grut also and plus virechana also. This is purgative in nature. Sandhaniya, healing effect of the wound. In the interior intermediate uveitis and the posterior uveitis, you can see there is a inflammatory process going on continuously. And there is a vrana. Vrana means there is an inflammation. After that, the vrana is there. So Sandhaniya, as a healing effect of wound, we can heal the vision also. We can have the good vision also after that. Shonistapanaganat, hemostatic, when vitreous hemorrhage is there, by the neovascularization, you can stop that with this gruta. Charaka mentioned this in Vata Vyadhi, in Charak Chikitsa. So it can use in the Vata Vyadhi also. And in Vidradi, means Vidradi, the all pan uveitis, the patient may have the sudden vision loss. That is like a abscess. So you can give this treatment. So now I am presenting these 3 cases today. That is evidence-based cases. This is a Kacha Parimlai as a diagnosis. This is the posterior uveitis case. 26 years male is a young adult patient having a complete of multiple joint pain in March 2028, diagnosed with rheumatoid arthritis. See the March 2018. In April 2018, patient had a sudden DOV, right eye, and the flutters. Nothing, any symptoms, only DOV and flutters. He was diagnosed at a uveitis and treatment with intraocular injection Avastin. Systemic steroids, patient gets temporary relief for 1 month. After that, he has recurrent episodes. This is main important. What I am highlighted here, this is the recurrent episode. If there is no recurrent episode, patient not come to the Ayurveda. Doctor advised him to continue the systemic steroids daily 10 milligrams. If he reduce this 10 milligram, the symptoms will occur. Many more flutters and the diminished vision were there. As a maintenance dose, he gets relief from the uveitis as well as multiple joint sprains after the steroid treatment. Patient gets regular episodes of uveitis on tapering of the systemic steroids. When the systemic steroids are in taper or to be end, Then the another episode of uveitis was there. Patient has undergone both eyes cataract effects due to the steroid induced cataract in August 19 and 20. See, at this age of 26 years, patient having the steroid due to the steroid, the patient has a cataract and then surgery was there. Since April 2018 to January 2021, he gets 7 to 8 episodes. And the systemic steroid were started and tapered. And like that, the local topical local drops also was there, which having a steroid drops. After January 2021, patient was shifted to the Ayurvedic treatment in Netraya Hospital at our in Jalgaon. On shifting to the Ayurveda treatment at start, patient suffering from a steroid withdrawal symptoms, getting multiple joint pains and due to the rheumatoid arthritis. Since 2020, on Ayurveda treatment, patient had only one episode of uveitis on 10th June 2020. You can see the date, January 2021. Okay, and in June there is only patient on only the 10 milligram of uveitis, 10 milligram of steroid. Then patient had a one episode. You can see the vision, that is the date-wise vision chart after Ayurveda treatment. You can see the red color. In the June 21, patient had a 690 vision, means cannot see the big letter also for his right eye. In between 28 to 31, you can see in orange color dates in the vision chart. Patient avoid to follow up at the hospital due to the COVID-19 and continue the treatment at home. But okay, now you can see that patient, that 10, 6, 21, 690, this is the progression of OCT macula. That is the retina difference. You can see the red arrows in the chart, the patient having a 690 vision, and simultaneously in the graph, you can see in the 10, 629, there is a hyperfluorescence of the optical rays reflection in the white and the red color. You can see. Okay, there is a huge edema in that below in black color. You can see the elevated macula, and the lower part you can see there is a small chart below all these things. 10, 6, 21, there is a 444 central edema. But after the treatment at 9, 8, 2022, patient having a normal vision. You can see the vision chart after the Ayurveda treatment, after the standard procedures of Ayurveda we are giving. After that, patient having a 6/9 vision. This is the latest follow-up, yesterday's 9, 8, 2022. So patient have the regular with basti, patient having a regular Koshtoshodhana, Virechana, and the Nasya and Bidalaka. Regularly patient having. You can see the difference between this red color arrow. There is a hyperfluorescence, that is white and red color. And the last, you can see there is no, absolutely no red and white color. Complete healing, that is a normal macula. This is the first evidence. And for the this is the right eye, and you can see the in retina deviation, the color changes. You can see with the blue arrow, there is a color changes from red towards the yellow. Green and yellow is the intermediate inflammation. Green is normal and red is there is inflammation at retina. You can see the color difference in between. So here is also see the for the left eye. This is the right one, and for the left eye, patient having in the January 2021, there is a retina difference, means there is a hyperfluorescence, red spots in the first image, right arrow, and the last arrow you can see there is a total absent of hyperfluorescence reflex of the optical evidence. In this image, the same you can see the NFL, GCL, IPL difference. There is a changes in the color from the first image and up to the last image. But there is in the last chart below, you can see there is no any more difference. Only difference is -6, -9, and -4. the vision is normal. Somewhat flutters was there, but as compared to right, left eye was normal. So this is the next case, end of first case. This is the exudative retinal detachment. We call it is a kaach in parimlai, called is in a posterior uveitis. 42 years female patient had a sudden diminished vision in 2016. Like this, is a chronic patient. Patient took treatment with the retina specialist, diagnosed VHK syndrome, both eyes choroiditis, with blisters in the retina, treated with injection methylprednisolone and oral steroids, immunosuppressant. This is the exudative retinal detachment. If you are not going to treat this, the patient may land in the complete vision loss, or land in a panuveitis. So for the MD medicine, patient was admitted and the methylprednisolone 3 injections was given, and with the immunosuppressant, patient had a vision come back to the 6/6 within 3 months or 2 months. Patient was on eye drop Predford tablet Azoran. This is an immunosuppressive tablet, and TDS, despite of treatment, didn't get relief. Patient having a multiple episodes of this exudative retinal detachment. Then patient shifted to Ayurveda treatment from 10th of 2017. As per case, patient having DOV, flutters and smoky yellowish vision. You can see over there. It's a sudden vision loss. Means yesterday night patient having a good vision, and in the morning patient can't see by 2 to 3 feet also. And the Sarvadehic patient have a constipation, chronic constipations and the acidity. As per the treatment, Panchakarma, Kostashodhana every 3 months by the Tilvagruta, Siraveda external jugular vein 60 to 80 ml for every month, Jalau Kavacharana, Apanga Bru or Lalat Pradesh every 15 days or in a month. In Shamana Chikisa, before that, Dipana Pachana, after that, we given the Tilvagruta 1 TSF BD, Anutel Nasya, Manjishtadi Kashayavati 1 BD, Tirut Avleha 1 TSF at night as Anulomana, and the Chandra Prabhavati 2 BD. There is no treatment since 10/7/21, no recurrence till today. Means history of 2000 in 2016, there is a multiple episodes treated by the methylprednisolone and local drops, but patient having a multiple episodes after this continuous Ayurveda treatment for the 2 years. Then after 2021, patient still today no any recurrence. There is no absolute Ayurveda treatment also. This is means totally eradication of the disease. You can see the patient, you can see with the arrow, they're defining that there is a hyperfluorescence in the 10th of 2017 and 7th of 2000, means there is a very long follow-up. You can see the dates from 2017 up to the 2021. And on the right side, patient vision improvement. When patient was present, there is a 615 vision for the right eye. This is the right eye we are going to see here. But in below chart, March 2018, there is a 1 episode after Ayurveda treatment also. Patient having only 8 feet vision. So on the right side, the Panchakarma, the Kostashodhana and the external jugular vein Raktamokshana we given at the same time. You can see the dates below that. The 12/3/2018, that is denoted in a blue color. Below that, 13/4/2018, within a 5 days after Kostashodhana and the external jugular vein and the inside the treatment, means Shamana Chikitsa, patient having a 6/9 vision for the right eye. This is very drastically. We are also in very, means हमने बोला कि क्या चमत्कार हो गया, ऐसे क्या कर दिया आयुर्वेद ने कि within a 5 days patient having a vision of 6/9, because patient was in back, patient was recovered by methylprednisolone. It takes around 2 months or 3 months. But when the doshas are eradicated completely, the patient having a very good vision in that. You can see the 2 dates. After that, in 12/2019, patient have some issue once again, but still today, from 2021, the vision is 6/9. And you can see the tomograph also that is a blackish color in the total presentation. There is a dome of tomograph. There is a dome of elevated retina, and the last one there is a good macula. And see this date 12/3 means denoted. This is the first means arrow. You can see the date. The totally elevated retina means exudative retinal detachment. You can see on the OCT of macula, that is the retinal thickness. On this date, the microns means above 1000 microns, patient have that inflammation and the serous fluid below the total retina, and the RP distortion also. You can see in the second image, there is a RP distortion at the what we call it, the black image. See the baseline, that image, it is curving. So it is totally inflamed retinal pigment epithelium. But retina was on the retinal pigment epithelium within a 5 days. You can see the dates 12/3/2018 and the image 17/3/2018. This is within, when we apply the Koshtashodhana and the Raktamokshana, you will get this drastically result. The same patient, left eye vision, you can see the first date for the left eye 6/15 vision, but still date it was 6/9 and the 7/21 in the vision chart. In this image, you can see the first date follow-up. You can see that there is a CSR, means central serous retinal fluid, and the last one but there is a hyperfluorescence in the choroid. You can see over there. There is inflammatory conditions in the choroid also. This is the second case, and the last case is the 66 years male patient. This is the complicated patients as he has multiple doses of steroids. So he also having the secondary glaucoma due to the steroids. So it is most difficult that patient having with the pressure may lost the vision suddenly, as when there is a pressure goes towards the acute in nature. So 66 years male patient having a history of patient diagnosed of cystoid macular edema CME and the vitritis both eyes. Patient has vitreous hemorrhage both eyes due to neovascularization of retina. Intravascular injection is given. Patient took treatment from many ophthalmologists and they later diagnosed both eyes as a uveitis. The diagnosis was wrong, only the cystoid macula. So they given the this intraocular anti-VEGF. But later on, the diagnosis is uveitis, and the whole scenario is changed. The predmet eye drops and the tapering doses of systemic steroids. Later having secondary steroid-induced glaucoma, so that also on anti-glaucoma drop. Patient is on the anti-glaucoma drop. After intravitreal injection, patient get temporary relief. In 2021, patient was shifted to the Ayurveda treatment. At the time of presentation, patient having a DOV, redness, photophobia, redness, pain on and off due to the fluctuation in the IOP. This is a typical peculiar symptoms. Means glaucoma means there is a complication of steroids and for the posterior uveitis as in the glaucoma. So glaucoma is the anterior chamber entity, Adhimantha. So there is a if there is no pain in posterior uveitis, but in complicated cases, glaucoma occurs and there is a fluctuation in the IOP and the pain is very severe. On examination, 660 partial both eyes vision. IOP was 17/19 left and right by applanation tonometry, and patient is under the Dorzox-T eye drops and the local steroid drop also. In the Sarvadehi, on first visit, patient has a Samajuva, Malavashtamba, and habit of late night dinner. So going towards the treatment, the same treatment, Koshtashodhana every 3 months with a Tilvagruta, Siraveda, Jalavkavacharana for each and every patients. In Shaman Chikitsa, some different according to the different Sarvadeik Lakshana. Laghu Manjashtadi and Mukha Pakarha Kada twice in a day for continuous for 1 month to the 6 months. Tilva Grutapana after the Dipana Pacham. It is Anuloma in nature. So Shatavari Ghrutanasya, 6 drops daily in the morning and the evening. Abhayadi Modaka, continuous Anuloman is given, half tablet or 1 SOS at night. Chandra Prabhavati 2 BD and the Bidalaka with the Shatavariyadi Ghruta to have a good pain relief with this Shatavari Ghruta is applying for the 2 times in a day. The patient having with the glaucoma symptoms, this Bidalaka is working very good. Seka is given with Jivaniyagana Siddha Dugdha. In emergency, when there is a rise in pressure or there is a very much pain, Seka is very well said or the given by the acharyas that if there is a pain, if Bidalaka does not work, you go to the Seka. Means somewhat Poshna Sheka you should give in the pain factor. So it is a 2 times in the SOS for the pain. This patient still on the treatment, and this patient is also having a cataract in both eyes due to the long steroid taken, systemic steroid taken. And I am saying here that this patient operated in our clinic after the Ayurveda treatment. Disease is totally controlled. There is no any episode for the anterior uveitis, anterior glaucomatic symptoms also, and the posterior uveitis. Okay, there is a less symptoms. After that, we operated this patient in our hospital, and patient not having a normal vision still, because patient having a history of, you see, from the 2014, you can see in this slide. Okay, from long-standing steroids, patient had the posterior means there is a loss of scotomatic vision. In the macula also, there is a inflammatory exudates. After that, patient having the scars at macula, so patient not having a normal vision. But a patient having around 624 to 6/18, both eyes post-operatively are good still today. You can see this evidence chart. Progression of left eye macula, that is the retina thickness. You can see the in the chart, red color on the left side, the January 21, and you can see on the right side, you can see the reduced macular edema. There is a March 2022. This is a long-term treatment, you can see. So it is yappe in nature. Still, treatment is going on for this patient after the operative also. So you can see the in the chart given below, in the there is a blue arrow. You can see the date-wise reduced edema from 2021 to the 2022, March 22. You can see the reduced edema. And in the chart, on the OCT image, at the tomograph, you can see there is a reduced edema from the first visit to the last visit. For the same eye, the other eye, there is no any change, you can see, because there is a scarred macula. After the operation, patient having the same vision, patient is unsatisfied after the operation also. So we convince them that there is no more vision come to with this, because there is a permanent loss of vision due to the long uveitis or the steroid induced problems. Okay, so you can see there is no any change in the edema. The right eye is more response given to the Ayurveda treatment, but left eye is scarred. There is no chance of any treatment to improve the vision in Ayurvedic point of also. So the same patient, yes, this is the one case. This positive effect I showed to you by this OCT tomographs, but this is the negative one for Ayurveda. This not for the Ayurveda. I am just, it is a false statement. But patient on, you can see the chart on that, from the January 2018 5th in the follow chart up to the December 2018, there is a one year treatment. After that, patient does not have the relief up to the 8-month treatment. Sorry, 31/8/2008. You can see there is a same edema in that after the Ayurveda treatment, after the Rakta Mokshana, after the Koshtoshodhana. So this is a young lady. I showed to you that age is only 22 or 23. relief due to ATT. You can see in the right side, there is a red arrow, and the given that relief is due to the ATD. I asked the patient to show the MD medicine once again and have the infective etiology, to search the infective etiology. But patient said that there is no any problem. I already taken the steroids and the intravitreal injections also for this macular edema. There is no relief, so I came to you. So I diagnosed this case once again as a catch, and then this treatment does not work after the 8 months. So I asked her to go the medicine and medicine doctor and have a proper laboratory investigations, and patient have done the gold test for the tuberculosis, and patient found that it is positive. But SOS we can give if there is a relief, we can continue the treatment. There is no any sarvadehic symptoms, means there are no any generalized symptoms. After the ATT, you can see these two follow-up, last two follow-ups, the dates you can see 31/8/2018 and in December 2018. There is a sudden difference. You can see the macular edema is totally gone for this right eye, totally gone. So this is ATT given by the MD medicine doctor, and patient is having a total relief. But what about the Ayurveda? Ayurveda is failed, not failed, because so we should diagnose all these cases. Patient does not have any symptoms in the body, not having a cough, not having any urinary problems, having a secondary infection in the eye. Everything we searched. So if we give the treatment of Raj eczema, Trirup or Shadrup or Ekadashi Rupa Raj eczema, then we will have the treatment of, we should have the treatment of 2 years or the 3 years. After that, this entity we also treated by the Ayurveda. So it is very important. So we are using these drugs in our OPD: Timir Anjana, Timir Ruta, Drushtinasya, and Netra Prasadana Vati. The etiopathogenesis comes in the last. The vitiation of Tridoshas, Vata, Pitta, and the Kapha. Most of the cases is chronic. Nimmamrutadi, Arogyavardhini, Deepan Pachana and Anulomana. Medicines Manjashtadi, Chandraprabha, Timira Ruta, Vasant Kusumakar, Balle, Rejuvenation Rasayana. Punarabhav was aimed to effect on neurosensory layer retina because vision matters. These all Dhumadarshi, you can see the 3D image of the OCT. You can see the elevated retina totally on the right and left. There is some relief, but treatment is still going on for this patient. Vision is 636 to 6/18. It is improved, but after that, patient having a long follow-up of 2 years, still there is a problem. In this case, for the Dhumadarshi, it is Sadhya in nature. Duration 8 months. Patient age is 36 years. Vision improved from 636 to 636. So this is the case of small exudative problem or choroiditis after macula. Thus, there is a leakage from RP, elevated macula. You can see the first visit and the last visit. You can see in the last image, there is a distortion of RP and the leakage from there. But this patient is on the systemic steroids. Patient had a relief within 1 to 2 months. After that, next year, patient have the same issues. Then he came for the Ayurveda. Then after 2 years, there is no any problem, no any recurrence. So this is also the treatment 2 months, 41 years, the same case, patient having a good vision. This is also the simple, some neovascular problem is there. You can see the retinal hemorrhages. These images are taken in our OPD, that patient having a vision, but having a raktasrav in the retina, not only the vitreous. You can see the very clear-cut disc and everything over there. We taken these photographs. As you see the reducing in nature. Same patient, we taken the OCT. You can see there is an elevation of retina. And the last one, patient having a good macula and the 6/6 vision, 6/9 vision from 4 feet up to the 6/9. There is a 3 months of treatment. Age is 48 years. So for the evidence-based ophthalmology treatment in Ayurveda, we have these all types of equipments in our OPD. In Pune, we have the research center our guru with Dr. Rajesh Pawarji sir, and same equipments are also there as a evidence-based Shalakya practice. This is the Netra research is inauguration. You can see the all members dignitaries over there, myself and Dr. Rajesh Pawar sir also, and Naik sir also inaugurating that. And thank to Adarniya, this presentation is समर्पित मैं इसको करता हूँ लेट परम आदरणीय गुरुवर्य श्री नाना जोशी sir, having operative in my clinic with him. Now he is not more. This all the presentation is मैं उनको समर्पित करता हूँ. So take home message in modern studies, 1 out of 3 having low vision. Most of diseases have symptomatic relief, chance of recurrence, no treatment to stop further vision loss. In Ayurveda, prevention is the balasthana of Ayurveda, cure from its root cause, hence no chance of reoccurrence. Stop further loss of vision. You see on the right side, vision drushti matters for independent life. You see, there is a very good laughing faces. Once of them having a vision problem, all the family will hampered because he needs the support from all other members. So vision drushti is important. For the conclusion, to maintain structural and functional properties of doshas should efficiently kept in balance. Acharya aptly conclude that the structural and the functional changes in the eye is nothing but the changes in the properties of sapta dhatus and tridoshas. This is the Sarvadehik Samprapti, where the Ayurveda concludes. But predominantly, Agni and Kapha should be okay. Okay, so you can use the Anjana also to keep your eye healthy, a constant threat to the eye. These are the references I have taken. This is my hospital view at Jalgaon. We are working with that. So thank you, all of you, to listening this uveitis as an evidence-based lecture. Thank you to all these teachers associations and Maharashtra University and my Guruvarya Dr. Pawar sir to having been giving me the chance of presenting over there. Thank you once for all.
Thank you, Dr. Hemant Boiskar sir, for enlightening the Ayurvedic as well as modern aspects on this critical disease uveitis. This lecture has cleared my concepts regarding uveitis and given me a new approach to treat uveitis. I can confidently say that everyone will appreciate that this session was evidence-based. Now I request Dr. Rajesh Pawar sir to give his expert opinion on this session. Over to Dr. Rajesh Pawar sir.
Thank you very much, Dr. Milind Gore sir. It was really a nice presentation as far as this evidence is concerned. And I must congratulate Ayurveda Teachers Association for selecting this very relevant topic nowadays, which is, I think, promote ourselves on a national level, not only on national level, but on the international level too. After seeing the presentation of Dr. Hemant Boiskar sir, you must have witnessed the wherever applicable, the basic principles are very much maintained. Nowhere basic principles are left out. You can compare the Ayurveda with the modern treatment. There is a lot of difference. That is the recurrence which we have witnessed in all these 3 presented cases. Lot of recurrence was there, but after starting the Ayurvedic treatment, no recurrence was there. So that is the basis of Ayurveda. I think that the treatment of Ayurveda reduced the dependency of steroids right in the beginning, and later on that avoided the recurrence too. The basic principle which I understood in this presentation, that is nurture the nature. If you maintain your lifestyle, if you maintain your swastha, I think lot many things are taken care of the disease, which is the main take-home message in this presentation. Also, Dr. Bhaviskar mentioned about the medications. You can see the intricacy of this presentation. That is at different stages of this uveitis. He was using different medications or even different netra karma also. So as an ophthalmologist in Ayurveda, I think this is the most important presentation as far as the detailing of the treatment and the consultancy for the patients of these eye diseases are concerned. I must congratulate Dr. Bhaviskar for successfully taking care of all these eye patients very confidently. I'm associated with him in Nimi Eye Care at Pune, and definitely I do come across with all these evidence-based cases with a lot of results and encouragement after seeing all the cured cases I can see. I at the at this at the outset I must thank Ayurveda Teachers Association, in particular Dr. Suryavanshi, Dr. Chaudhary, and all the organizers for giving me this opportunity to chair this session. Thank you very much.
Sir, sorry, you are not associated with me, but I am associated with you in a lifetime journey in the Netra. Okay. This is a Guru and Shishya, so it is not a
That's your modesty. That's your modesty, Dr. Hemant. I think you have started this concept as an Ayurvedic ophthalmologist long back, and I'm fortunate that that has now come to a very golden stage, as rightly mentioned by Dr. Nesri Madam in her presentation, that this is the golden era, and on the prior day of this 75th celebration of our independence, I must congratulate each and everyone for taking part in this conference. Thank you very much, sir.
Thank you, Dr. Rajesh Pawar, sir. Already we are lagging of time, so I request Dr. Jayant Kharat, sir, if there are any questions, you can conduct the question answer session. 1 or 2 questions can be included in this session.
Okay, thank you very much, sir. And there are a few questions in the chat box, which are going to ask to our guest speaker, Dr. Hemant Bhaviskar, sir. Which Rakta Prasadak Dravya are helpful to treat uveitis? Is the first question to Dr. Hemant Bhaviskar, sir.
Yes, thank you for this question. It's a nice question. So in the start, we can see this in uveitis, especially in the Patalagata Roga. So Sira, Moksha, and the Jalavukavacharana is very important in the initials. But at the same time, we should give the systemic medicines to should have the Shamana Chikitsa. So you can use this Lagu Manjishtadi Kachayavati or Lagu Manjishtadi Kada continuously. But you should observe that you should give the Ghrita in between them, because there is a Rukshata by the Kada or the what is. So patient may feel there is an increase in the Pitta if there is a some Pitta, if patients means this Lagu Manjishtadi and Manjishtadi having a Pitta effect, but at the same time the Bala will go down with this long term, means there is no any side effect, only side effect by the steroids, but when you give the long term Rakta Prasadana Dravya inside, you should give the Ghrita also in between that, or you should stop after the 3 months or the 1 month of these Rakta Prasadana Dravyas, and you should have the good Ghrutapana after that, after Dipana Pachana. Then once again you can start the long term Rakta Prasadana Dravyas in that. So Rakta Prasadana Gana is given in the Charaka, and Lagu Manjishtadi and the Manjishtadi Kashayavati is available in the market. I am using the Kerala pharmacies. They are well known and maintain their standard. So because this is a vision threatening problem, I should have that much potent drug with me to convince the patient to have the treatment via Ayurveda, or otherwise it may not. So we have a pharmacy also for the Siddha Grutas and the Nasya Bidalaka Dravyas. We are preparing the Anjana in our pharmacy. It's a private pharmacy. So you can practice like this. If you don't have the standard Dravyas, if you have a knowledge also, you doesn't work. So this should be there for the Rakta Prasadanta batch. Thank you.
Okay, thank you, sir. We will conclude this session here. I thanks our speaker, Dr. Hemant Bhaviskar, sir, Chairman, Dr. Rajesh Pawar, sir, uh, Co-Chairman, Dr. Nilakshi Pradhan, Madam, and Jai Kharat, sir. And I will hand over this dice to Dr. Amar Kamble for next session. Thank you all.
Thank you so much.
Thank you. Thank you so much.
Thank you.
Thank you. Am I audible?
Yes, sir.
Thank you, Dr. Milind Gore, sir, and Dr. Sharmali Pause, ma'am, for conducting this first session very successfully. And I thank from the bottom of my heart to Dr. Hemant Bhaviskar, sir, for such a detailed and beautiful case presentations. I also thank Chairperson Dr. Pawar, sir, Co-Chairperson Dr. Nilakshi, madam, and Dr. Jaivan Kharat, sir. So I hereby declare that our first session is completed. Thank you, all of you. Now, moving further to our second session, I request the session coordinators, Dr. Santosh Pathak, sir, and Dr. Reshma Kumbhar, ma'am, to conduct the session. Before that, I will give the short introduction of our first session coordinator, Dr. Santosh Pathak, sir. He is working as an associate professor in Shalyatantra department in Nashik Seva Sangha Ayurved College, Ganeshwadi, Nashik. He has participated as a resource person in clinical training of the Kshar Sutra in 2012. He has worked as he has been invited as an expert speaker in certificate course of the Kshar Sutra therapy. He has published total 15 research papers in peer-reviewed international journals. He is also indulged in various social activities like conducting the various opens, giving lectures, awareness lectures to the school childrens. He has also worked as a secretary of the Ayurved Vespit Nashik Shakha. So this was about Dr. Santosh Pathak, sir. Now I request Dr. Sonia, madam, to introduce Dr. Reshma Kumbhar, madam, which is our second session coordinator. Over to you, Dr. Sonia, madam.
Am I audible, sir?
Yes, sir. Yes, madam.
Yes. Good morning to all delegates. For our today's second session, we have our second session coordinator, Dr. Reshma Kumbhar, ma'am. Dr. Reshma Kumbhar, ma'am, is associate professor and HOD of Sahita Siddharth department at Ashokram Mane Ayurved Medical College and Hospital in Kolhapur. She has rich experience of more than 10 years in academic field, where she has associated with various colleges in Karnataka, Uttar Pradesh, and Maharashtra. She has also worked as an expert on www.noayurveda.org. So I request to our second session coordinator, both the second session coordinator, to continue the sessions. Please, sir and ma'am, you can continue the session.
Hello, am I audible? Hello,
Yes.
hello.
Yes, you are audible, sir. Santosh, sir.
Okay,
You can continue.
yes. So, namaskar and welcome to all in the second session of 4th National Conference Evidence-Based Ayurveda by Ayurveda Teachers Association. The topic of this session is Ayurvedic Urology, the most amazing and promising branch and evidence-based approach by Dr. Narayan Shahane, who is Professor, Department of Shalyatantra, Bhargava Ayurveda College, Anand. For this session, we have one chairperson and two co-chairpersons with us. So I will give you the brief introduction of our chairpersons. I will give you introduction of our chairperson of this session, Dr. A. Ramya. She is MD Panchakarma from Government Ayurveda College, Thiruvananthapuram, Kerala. She is currently Vice Principal and Head of the Department of Panchakarma, Ashtangam Ayurveda Vidyapit, Bhavanur. Presently, she is pursuing PhD in Kerala University. She has worked in the Department of Kaya Chikitsa, Sharirashna and Panchakarma.
She has worked as specialist consultant in Ayurvedic neurology and in neurocare and rehabilitation centers. She is co-author of a book, Principles and Practice of Snehana, and published Tridoshik Diary, a compilation in her name. She has various national peer-reviewed papers and articles publications in her name. She is an executive editor and faculty member of various e-journals like Impacto. Madam is running special OPD for neurodegenerative diseases. So I welcome Dr. A. Ramya as a chairperson of this station. Welcome, madam. Now I will give brief introduction of our co-chairperson, Dr. Podhade sir. He is associate professor and head of the Department of Shalyatantra in Sri Gurudev Ayurved College, Mosri. Sir has passed MD Shalyatantra from Amrati University in 2002 and currently he is pursuing PhD in Shalyatantra in MHS Nashik. He has total 18 to 20 years of academic experience with administrative experience. He has published more than 10 research papers in recognized national and international journals. He has presented research papers in national seminars also. Sir has worked as a resource person. He has been as a guest speaker and chairpersons in various continuous medical educations and seminars and webinars. He has been involved in various research projects and clinical trial also. Also, he has attended various ROTPs and CMEs with in his name. So I welcome Dr. Suresh Podhade sir as a co-chairperson of this session. Welcome, sir.
Thank you very much.
Now I will like to give introduction of our second co-chairperson, that is Dr. Akhilesh Srivastav. He is MD Ayurvedic. He is vice principal of and head of the Department of Prashastra Bhaishya Kalpana Department of Shubhadeep Ayurved College, Indore, Madhya Pradesh. He has about 10 years of teaching experience in postgraduate institute, working as superintendent and in charge of Subhadeep Ayurved Pharmacy, and also as a secretary of Institutional Ethical Committee. He has participated in various national workshops and CME training programs and national seminars. He has received award, that is Sanman Patra, from Sri Dhanvantari Herbals in 2011. He is life member of National Academy of Ayurveda, Vishwa Ayurved Parishad and Nasya. He is also working in editorial board of Journal of Ayurveda published by MPMSU. So I welcome our second co-chairperson, Dr. Akhilesh Srivastav, for this session. And I request Dr. Akhilesh Srivastav to please introduce our speaker, Dr. Narayan Shahani. Over to you, sir, Dr. Srivastav.
Thank you very much, sir. First of all, आजादी के अमृत महोत्सव के अंतर्गत ये जो 4th नेशनल कॉन्फ्रेंस MUHS और आयुर्वेद टीचर्स एसोसिएशन के द्वारा जो ऑर्गेनाइज किया गया है, पूरी टीम को मैं बहुत बहुत धन्यवाद देना चाहूँगा। और चूँकि आयुर्वेद टीचर्स एसोसिएशन से मैं काफ़ी समय से जुड़ा हुआ हूँ, तो ये इट्स अ प्रिविलेज टू मी टू शेयर दिस प्लेटफॉर्म, and it's also a privilege to me to give the brief introduction to our today's speaker, Dr. Narayan Sahane sir. As we all know about Dr. Narayan Sahane sir, is a first Ayurvedic urologist, and he established the world first only Ayurvedic urology center, and he's running Ayurvedic urology center. So I would like to welcome Dr. Narayan Sahane sir. Dr. Narayan Sahane sir, as a medical director, is working as a multi-specialty hospital research and academic center, Nadiyad, Gujarat. And it's a privilege to our Ayurveda fraternity that Dr. Narayan Sahane sir is working as a urologist, that too in Ayurvedic field, and that too with the holistic approach of the Ayurveda. It's a privilege to us, and it's an honor for all fraternity of the Ayurveda. डॉक्टर नारायण सहाने सर, अगर उनके एक्सपीरियंस अचीवमेंट्स की बात करें तो एज ए रिसोर्स पर्सन ही डिलीवर्ड मेनी मोर लेक्चर्स इन नेशनल लेवल, वो जामनगर में हो या अलग अलग इंस्टीट्यूशन में हो. अलॉन्ग विद दिस he also spread the Ayurveda and delivered a lot of lecture in other countries like USA, Japan, Russia, Malaysia, Canada. So in short, if we say, sir is internationally famous personality in urology, that too in Ayurvedic urology. इट्स अ वेरी अगर हम कहें कि अगर आज हम कोई ट्रीटमेंट प्लान करते हैं तो फर्स्ट एंड फॉरमोस्ट इफेक्ट जो उसका ज्यादा किडनी पर इफेक्ट होता है। और सर अगर विद द होलिस्टिक अप्रोच ऑफ द आयुर्वेद अगर किडनी पेशेंट्स को ट्रीटमेंट कर रहे हैं एज अ प्रोफाइल आई हैव रीड सर यूरिनरी ट्रैक्ट इन्फेक्शन दैट टू लोअर यूरिनरी ट्रैक्ट इन्फेक्शन में स्पेशलिस्ट हैं। तो इट्स अ privilege and it's a very good thing that we are here with Dr. Narayan Sahane sir in this platform. I again welcome Dr. Narayan Sahane sir, and over to you sir for your valuable speech.
थैंक यू श्रीवास्तव सर, थैंक यू फॉर अ वेरी नाइस इंट्रोडक्शन। सबसे पहले आप सभी को आजादी का जो अमृत महोत्सव चल रहा है उसकी बहुत बहुत हार्दिक शुभकामनाएं। और ये जो भी आयोजन किया गया है ये ATA कॉन का, ये बहुत ही सराहनीय है। ये बहुत ही अच्छा उपक्रम है जिससे सभी टीचर्स का एक नई तरह से उद्बोधन हो सकता है। थैंक यू। विदाउट वेस्टिंग मच ऑफ योर टाइम, लेट अस गो टू द टॉपिक। So welcome everybody, a very good morning. O Lord Dhanvantari, please shine something upon us so that we can reflect the world. So the topic which we are going to discuss today is Ayurvedic urology, the most amazing and promising branch and evidence-based approach. So all respected teachers, welcome to Brahma Ayurveda, world's first and only Ayurvedic urology center. So the most important tool in Ayurvedic urology which we have is this miraculous treatment Uttarbasti, a highly specialized Ayurvedic urological procedure. I'm not going to go into much details because everybody knows the theoretical part. It's just to conclude or to summarize, Uttarbasti is an Ayurvedic procedure in which we introduce specific oil-based medicine or decoction into urethra through urethral meatus, kind of cystourethral enemata. And for this, the important thing is no urethral catheterization is required. Uttarbasti is a non-invasive procedure with minimal or no pain, so no anesthesia is required. Procedure is carried out by an expert under strict aseptic precautions. Even the medicine is sterilized, and obviously the procedure is carried out with continuous vital monitoring. And being a daycare procedure, no hospitalization is required and patient can resume her or his daily routine immediately after the procedure. The medicines generally we use are classified or grouped in mainly these four groups. The first is Lekhan, in that these drugs we use. Second is Vranashodhana, Ropana. So these drugs are used. So basically we use oil-based medicines, Siddha Taila, then Mutra Doshar, Vastamantaka. Now Lekhan is mainly used for debridement. This is obviously Vranashodhana, Ropana we know well. Mutra Doshar mainly to address the inflammation into lower urinary passage, and Vastamantaka to strengthen the immunity, kind of immune buster, then to regenerate the urothelium, to improve the elasticity of the urinary tract. Along with that, sometimes we use Panchavalkal Quath, fresh prepared, the Nisha Nimbadi Quath also. So these are the drugs generally we use for Uttarbasti. Now, let us see the procedure, the way we perform the procedure. So basically, in this, no catheterization is required. We use simply that Foley's adapter. So only that Foley's adapter is introduced into the urethral meatus and the medicine is introduced. Generally, we introduce 60 ml of the medicine. The whole medicine goes to the bladder and from there it works. Now, the most important thing is the whole procedure has to be conducted under very rigid aseptic precaution. This is most important part. Even the medicine should be sterilized before its use. Then while introducing the medicine, it has to be very gradual, as gently as possible, because urethra is supposed to be the most sensitive part of the human body. So while performing Uttarbasti, the vasovagal events are very common. That's why while introducing the medicine, it has to be introduced very gently with gentle care. And while introducing the medicine, we ask the patient to go for deep breathing, because deep breathing enhances the secretions of endorphins from cerebral cortex, and these endorphins help to manage that discomfort or to prevent shock. The whole medicine obviously goes to the bladder. Generally, we introduce 60 ml of the medicine. The whole medicine goes to the bladder, and from there it works. After the introduction of the medicine, we apply that penile clamp. We keep it there for 5 to 10 minutes to maintain the maximum concentration of that medicine inside urethra. Now, like as we saw in case of males, in case of females also, we do the same way. Initially, I used to use this center nozzle glass syringe to introduce the medicine into urethra, but nowadays we are using the same Foley's adapter. Even in case of females, there is no need to introduce a catheter. So for Uttar Basti, basically, catheterization is not necessary at all. One should never use catheter to introduce the medicine into bladder. Now, in case of females, after introduction of the medicine, we ask that lady to keep her legs crossed for 5 to 10 minutes. Now, one more thing, especially in patients who are suffering with urethral stricture, we need to go for calibration of urethra. For that, like after introduction of the medicine, then we introduce the local anesthetic gel. Now, this is done to restore the caliber of urethra in case of patients who are suffering with urethral stricture or even benign prostatic hypertrophy. Now, in this, like generally we start the calibration of urethra from 10 French catheters. So generally we do Uttar Basti for initial 5 days. From 6th day onwards, we do start calibration of urethra. In that, on 6th day, we introduce catheters of 10 and 12 French size. Then 7th day only Uttar Basti. 8th day again we do the calibration using 12, 14. Then 10th day 14, 16, and 10th day 12th day 16, 18, and 20. Now this is the last calibration of this patient. Now here you can see there is a color code. This is 20 French catheter. The color code is very specific. 10 is black, 12 is white, 14 is green, 16 is orange, 18 is red, and 20 is yellow. So this is yellow. So it's very important that while introducing a catheter, it has to be very gentle. In fact, it is believed in urology till date that it is simply impossible to open up a stricture without surgical intervention. And yes, we are doing it without surgery. It's not only that introduction of the catheter, but while removing the catheter, it has to be really very gentle. And you can see this was a case of very tight stricture, and this is 20 French catheter, and there is not even a little blood stain on this. So this is the beauty of this treatment. The procedure is almost bloodless for, I can say definitely for more than 95% patients, it is bloodless. Now, when we are able to introduce 18 French catheter with ease, that means we have achieved the normal caliber of urethra. That is the normal caliber. We introduce just one extra size to make sure that no fibrosis is left untreated. Now, when the urologists do the surgery or dilatation, they open it up to at least 22 French size, routinely 24, sometimes 26, even 28 French size, because they know that very soon it is going to constrict. So this is regarding the treatment. Now, there are certain very important precautions while performing Uttar Basti. These are like proper assessment of the patient is really, really very important. Now, why this is important? Okay, let me just present let me tell you regarding a case. We had a patient, he was refusing to go for ascending urethrogram, and we insisted him that he should go for that. So when he did it, we found that the radiopaque contrast was completely absorbed into iliac vessels. Generally, we use oil-based medicine. So if we would have started the treatment without that ascending urethrogram, the whole oil-based medicine would have absorbed into the iliac vessels, ultimately into the systemic circulation, and that would have caused serious complications of fat embolism. That's why proper assessment is really very important. Well-informed and convinced patient and relatives. This is also a very important part, because this is absolutely a new thing for most of the patients and most of the doctors even. That's why we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied, we never start the treatment. Again, rigid aseptic precautions, sterilization of the medicine, expertise, very gradual introduction of the drug is very important, and all necessary things to manage vasovagal event, because vasovagal events while performing Uttarvasti are really very common. Now let us discuss regarding the most prominent disease of the lower urinary passage, urethral stricture disease. There is abnormal narrowing of urethra, as you can clearly appreciate in this ascending urethrogram film over here. So the etiological factors are many more. The common are UTI, unsafe sexual practices, trauma, urolithiasis, vegdharana. But this is the most important part of etiological factor is almost 50% cases of urethral stricture are iatrogenic, means resulted from instrumentation or surgeries on lower urinary passage. This is very unfortunate, but at the same time very true that most of the hospitals, like almost 50% cases of urethral stricture are generated by the hospitals. This is very unfortunate, but true at the same time. Now, to understand the nature of the disease, first of all, we need to understand the nature of urethra. Urethra is basically a collapsible pipe which remains closed for 24 hours. It opens only when a person passes urine. And as soon as urine is passed, it closes or collapses again. So being a collapsible pipe, it has got its two distinct qualities. One is elasticity with which it can open up and close. And the other one is caliber. Caliber means the maximum extent to which that pipe can open up is the caliber of urethra. Now, these two qualities are very important for the normal functioning of urethra. Now, as far as pathology is concerned, it is quite complex process. There is some kind of noxious stimulus, whether in form of bacterial, chemical, or physical, then that causes denuded epithelium, which turns to squamous metaplasia, then fissure development in epithelium, urine extravasation, development of fibrosis in corpus spongium, then fibrotic plaques coalesce, then thus the stricture is formed. So to simplify this, basically a stricture would never form without a wound or ulceration inside urethra. So whenever there is any wound on any epithelial lining of the body, eventually that wound heals, and when that wound heals, it leaves a scar which is really very small as compared to the actual size of the wound. So any wound contracts significantly. This is simply wound contraction of cicatrization of the wound. So in case of urethra, urethra is a very, very small tube. So in case of urethra, whenever there is a wound, that wound is also going to get constricted. When that wound constricts, obviously the whole pipe gets constricted with that. And this is how the whole pipe is getting constricted, and this is the beginning of stricture. Now, the second part. Whenever a wound heals, it heals from the base. Even in case of deeper wounds, it heals from the base and it heals by granulation. And when the granulation reaches the normal lining, generally the process of granulation stops over there only. Generally, it never overgrows the epithelial lining. Now, in case of urethra, urethra is a pipe which carries urine many times a day. Urine is acidic in nature. It contains many salts. Obviously, the salty acidic urine interferes the granulation. And as the granulation is interfered, that wound is unable to heal properly. Again, wound healing is a natural process. So when nature realizes that this particular wound is not healing properly, nature tries her best to heal that wound at any cost. And in that attempt, the rate of granulation increases significantly. And that's why the process of granulation, which should stop at the normal epithelial lining, unfortunately, there is overgrowth inside the lumen. Means already the passage is getting narrow and there is some little overgrowth inside the lumen. This is how the passage gets narrow. Here you can see a different kind of hypergranulation inside, like in the form of mucosal fold, iris constriction, or this kind of short segment or linear strictures. Now, this overgrown tissue or hypergranulation is initially soft, but later it turns into fibrosis, which is really rigid. So once it turns rigid, obviously the elasticity of urethra at that particular part is lost. And once the elasticity is lost, obviously the ability of that pipe to open up means caliber is lost. Two important qualities of urethra, elasticity and caliber, to maintain its physiology, are lost, and this is how a stricture is formed. So this is basically a urethral stricture disease. Now we know that the basically pathology starts with a wound. As far as the symptoms are concerned, they are called as lower urinary tract symptoms, LUTS. There are basically three different classes. Storage LUTS means while the bladder is getting filled, like frequency, urgency, nocturia, incontinences, and pelvic pain. The second group is voiding LUTs while voiding urine. These are incomplete emptying, episodes of near retention, voiding small volumes, spraying or double stream, hematuria, burning and dysuria, straining, hesitancy, poor flow, dribbling, intermittency. And there are some additional LUTs, and these are hemospermia, retrograde ejaculation, discharge from urethra, reduced ejaculation force, pain in the scrotum or testicles, dyspareunia, and fever with chills and rigors. The diagnosis is obviously confirmed with like proper history taking, thorough clinical examination, and special investigation. So retrograde or ascending urethrogram. Actually, retrograde or ascending urethrogram, in this, a radiopaque contrast is introduced into the urethra. And while introducing that radiopaque contrast, the X-ray snap is taken, and you can see a very clear picture of constricture at this level and at this level. The other one is micturating cystourethography, or MCUG or VCUG, voiding cystourethography. So in this, they introduce an infant feeding tube into the bladder. The bladder is filled with radiopaque contrast solution, and the patient is asked to void urine, and while voiding, this X-ray is taken. And this also clearly shows this. This is basically a two-dimensional investigation, but clearly shows the exact location, tightness, extent of the stricture. Now, as far as the female patients are concerned, most of the females, they are advised to go for, in fact, in radiology, there is a concept of only MCUG in case of females. Now, for a female to void urine, that to standing, that to in front of an X-ray technician in an X-ray room is quite embarrassing and difficult. So generally it fails. So we tried to perform ascending urethrogram in female patients. So we conducted many, like we have got data of significant amount of patients of female ascending urethrogram. And even in case of females, this clearly shows the tightness of the structure. Here you can clearly show there is one tightness at this level, then a thin line goes above this point. So this is tight structure in case of females. Now in case of males, when they perform the ascending urethrogram, most of the radiologists, they have an impression that unless and until they push the contrast with pressure, the whole length of urethra will not be visualized. So it's a tendency that generally they push it very hard, and that's why sometimes that causes bleeding, pain, burning to patients who undergo this ascending urethrogram. So we tried that also, introducing the contrast very gently, and even with gentle introduction, the whole length of urethra is visualized. So we discussed this thing with many radiologists, and now they are spreading the word that there is no need to introduce the contrast with force. One more investigation, this is uroflowmetry. In this, that patient has to make sure that the bladder is full, and then that patient has to be into a tub which is attached to a PC system which gives this graph. In this particular, there are certain points which are very important. This maximum flow rate. This should be at least 15 ml per second. Average flow rate should be around 10 ml per second. The graph of the uroflowmetry should be typically a bell in the temple, or at least a flat box type design, and the post-wide residue should be minimal. Now, few more investigations. There are cystourethroskopy, ultrasound sonography, and urine routine and microscopic culture sensitivity examination to rule out the infection. Now, as far as the treatment is concerned, the conservative treatment is only palliative, or either in the form of urinary diversion, in the form of suprapubic catheterization, or perineal erythrostomy. But these are temporary. This is not the permanent solution for stricture. Then this CIC, clean intermittent self-catheterization. This is generally advised after surgery to maintain the caliber of urethra. In that patient has to introduce catheter his or her own using an anesthetic gel. But this particular procedure has got significant complications involved with it. And like these are some of them: recurrent UTI. Obviously, the way a doctor does it in the hospital, a normal human being will not be able to perform it with that care back home. So there are chances that that person may introduce infection, injury, rupture urethra, even new scar formation, multiple strictures. And this is AUG of one of our patients. You can see a clear false passage, a very significant false passage in this direction over here from membranous urethra. This is the normal urethra going to the bladder. Now the option remains is of surgical treatment only. The first one is urethral dilatation. In this, either they use metal or Teflon dilators or balloon dilatation. This is done under anesthesia. So in this, they introduce small dilator first, small size dilator, then they introduce the bigger one, like they generally start with 6 or 8 French. They do it up to 22, 24, sometimes 26 French. Again, to introduce a dilator, that urologist has to force it in. Once he or she is forcing it in, that causes new injury. And once a new injury is caused, the pathology restarts. And that's why generally stricture recurs within 1 year of this particular dilatation. That's why this dilatation is posted generally near the birth date of that patient to remind him or her that he or she has to go for dilatation. As it is my birthday, now I have to go for the dilatation. So this is how it goes. Now, generally nowadays, no urologist in private sector does it. It is done only in government hospitals. So in private sector, the next option is ureterotomy, visual internal ureterotomy or direct visual internal ureterotomy using simple uretherotome or cold knife or different types of laser, including holmium, thulium laser. Again, in this, they introduce a scope. They have to cut that constricture to release it. When they cut it, a new wound is caused. If a new wound is caused, the pathology restarts. And that's why even after ureterotomy, generally stricture recurs within 1 year of the surgery. That's why most of the urologists, after this particular procedure, they advise that patient to go for that clean intermittent self-catheterization. Actually, the way it has to be in the CISC, generally it is advised to go for that CISC every day in the beginning. Then the frequency has to be reduced from daily to alternate day to twice a week to once a week to fortnightly to monthly. But as soon as patient starts reducing the frequency, it gets harder for him or her to introduce the catheter. Then again, either he or she has to resume the same frequency or need to reduce the size of the catheter. Again, ultimately, though that patient is performing the same CISC, still he or she has to go for next ureterotomy around 1 year. So even after this, the stricture recurs. Now this one, supposed to be the last resort for the management of urethral stricture, urethroplasty. There are different types like end-to-end urethroplasty for small strictures, pinpoint strictures, or this is called as anastomosis urethroplasty, and the other one is BMG, reconstructive urethroplasty, buccal mucosal graft reconstructive urethroplasty. In that, they excise the portion of urethra which is constricted, and they try to reconstruct that urethra part using the buccal mucosa, because both are same transitional epithelium. But again, in this is an open surgery, a bigger wound is caused, and that's why once a new wound is caused, pathology restarts, and that's why unfortunately even after urethroplasty, the disease recurs. In fact, for BMG urethroplasty, Dr. Sanjay Kulkarni from Pune is supposed to be the authority in India. In fact, the procedure is in his name, Kulkarni's procedure. And we have got many patients who have already been operated by Dr. Sanjay Kulkarni. They came to us for the treatment of urethral stricture after urethroplasty. This is the nature of the disease. So by now, we know that the results of conventional urological treatment are not really very promising, and the treatment of stricture remains a challenge despite of those much advancements in urology. In fact, it is believed in urology that once is a stricture, always is a stricture. And urethra is supposed to be the most egoistic part of human body, so one should never ever disrespect urethra by any means. So obviously, the more it is disrespected, it turns more complicated. So what we have to offer in Ayurveda, urology? Uttar Basti, we saw the video. Calibration of urethra, that also we saw. Oral medications, generally we use only Ayurvedic medicines. The Rakta Medopachakwa, there are only 9 drugs in this. Patol, Sariva, Musta, Patha, Katoki, Kiratiktam, Amruta, Chandanam, Vishuvejijam. So 9 drugs, Rakta Pachak plus Medopachakwa. And with this only we manage infections as well. Then the Ushiraso as systemic alkalizer and tablet Samshmani as an anti-inflammatory, at the same time antipyretic. In fact, in our routine practice, we use only Samshmani as an antipyretic, because whenever we use so-called allopathy antipyretic like acetaminophen, paracetamol, generally if you check the temperature, body temperature of that patient after 1 hour of the tablet given, the temperature goes subnormal. And if the temperature goes subnormal, that interferes the immune response, because for the multiplication of WBCs, this is basically rise in temperature or fever is an immune response. that rise in temperature is very important for the multiplication of WBCs. And if the temperature is going subnormal, that interferes that immune response. And whenever we use Samshmani, if you check the body temperature after maybe half an hour, yes, that hyperparesia is definitely addressed, but the body temperature remains between 99 and 100 only. So thus it never interferes that immune response of the body. This is how the immunomodulator action of Samshmani, that Guduchi, is well known. Now, I have already mentioned that the way we treat the patient, the methodology is like uroflowmetry in the beginning. Before commencement of the treatment, initial 5 settings, only Uttar Basti, in that we use that Lekhana Dravya Siddha Taila. From 6th day onwards up to 12th day, we do Uttar Basti and Uttar Basti along with calibration under local anesthesia on alternate day. Now, during these sessions, we add Vrana Shodhan Vrana Ropan Tailam and also the Mutra Dosha Tailam to address the inflammation. We do calibration of urethra from 10 French to 20 French. Then we repeat uroflowmetry on 14th day. Generally, patient observes improvement in the flow from 10th day onwards only, but it is evident on 14th day. From 13th day onwards up to 20th day, only Uttar Basti. In that we add the last one, the Vastamantaka Tailam. Now, the results of Uttar Basti are assessed clinically and by comparison between pre and post treatment investigations like urethography and uroflowmetry. The results of Uttar Basti are irrespective of the site, size, extent, and etiological factor of the structure. This is the beauty of the treatment. Now, let me present some cases. I would say the most challenging case of my career till date, this lady from USA was suffering with stricture since more than 12 years and has to undergo dilatations every 6 months. She suffered complete detention on 15th October 12 because of fulminating UTI. When she approached nearest emergency in California, when the doctors over there, they tried to introduce any catheter, even the urethra was not at all negotiable with infant feeding tube. So obviously they have to go for suprapubic catheterization as an emergency treatment. After a series of investigations, she was advised to go for vaginal flap urethroplasty on 17th December 12. When they actually posted the surgery on 23rd of January 13, when they tried to negotiate urethra with pediatric 10 French cystoscope, they could cannulate urethra for only 0.5 centimeter. Then they tried to introduce a guide wire, which is thin like the ball of a ball pen, but even with that guide wire, urethra was not at all negotiable. Then they tried to negotiate urethra using that suprapubic approach, using a flexible ureteroscope. They tried to introduce that guide wire, but even through that suprapubic approach, urethra was not at all negotiable. Obviously, they have to abort the procedure, and they explained that lady and her relatives that she has to lead rest of her life with that tube only. Then what next? Because for most of the people, when the doctors of USA say that there is no hope, that means there is no hope at all. Then her daughter searched on the net. She got our site. The name itself is cureurethral-stricture.com. There is an online consultation form. They communicated with us. It was a very long communication because it was very hard for them to believe that an Indian doctor, that an Ayurveda doctor says that it is curable. How come? And we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied, we never start the treatment. So ultimately they decided. She came to us. We started her treatment on 20th of April 13. Within 10 days, on 29th of April 13, we were able to remove her suprapubic tube with normal flow. A lady who was unable to pass even a single drop of urine, that lady passed urine with a max flow rate of 16.8 ml per second, an average flow rate of 12.4 ml per second, that too without straining. So this particular case proves the possibility of opening up of a stricture without surgical intervention. In fact, till today, it is believed in urology that it is simply impossible to open up a stricture without surgery. And this proves, yes, we can. Not only this, but after completion of the treatment in May 13, that lady went to USA. After 3.5 years of her treatment, in December 17, she came to Punjab for a wedding. From there, she especially came to see us. We performed her uroflowmetry, and after 3.5 years, her uroflow was absolutely normal. And it's been more than 9 years, April 13 22. That lady is leading absolutely normal life. So this particular case disproves the belief once is a stricture, always is a stricture. And not only this, but we have got many such cases. This guy from Maharashtra came to us with the same kind of suprapubic urethra, was not at all negotiable. You can see in the ascending uretrogram, a complete tie stricture at this level. When the radiologist tried to introduce the contrast with little pressure, you can see the extravasation, but still that didn't enter the bladder. It was that tight stricture, impassable stricture. We started his treatment. Now for all such cases, what we do, we introduce the medicine. We try to introduce the medicine through urethra very gently as much as possible. And rest of the medicine we introduce through the suprapubic tube into the bladder, because that medicine works from the bladder. Now look at this guy passing urine like this. Completely normal flow. Then we did his ascending uretrogram. This the previous. After treatment, you can see the dye entered up to the bladder with ease. And not only this, but if you compare these two things, here you can see the urethral lining is distorted. Here it is very smooth. So it addresses urethritis also. Then we removed the suprapubic tube, leading normal life. Look at this guy, a software engineer from Chennai. Again, he's a software engineer in USA, Chennai based. Underwent his first visual internal ureterotomy on November 11. Recurred within 1 year. Has to undergo second VIU in December 12. When he came to us after 1 year, December 13, uroflow was significantly compromised. It was 9.3 ml per second. We managed his condition and his flow was back to normal in December 13. He went to USA, came back after 4 years, December 13, December 17. For 4 years, flow was normal, and it's been almost again 9 years. He's leading absolutely normal life since then. So again, one more proof to disprove the belief once is a stricture, always is a stricture. This guy from Iraq, Kurdistan, a teacher by profession, underwent VIU. Within 20 days, flow decreased significantly with severe dysuria. When he came to us in February 14, you can see the flow was very badly compromised. You can see the graph near to the baseline. And after treatment, everything back to normal in significant PVRU, max flow 18.9, and since Feb 14, leading normal life. Look at this guy. How many surgeries? 1, 2, 3. Laser VIU, 1 urethroplasty. After urethroplasty, again 3 VIU, 1 simple VIU, 1 dilatation. And he was pursuing that CISC, clean intermittent self-catheterization, daily using 14 French catheter. And still his flow was that poor, 6 ml per second. After treatment, back to normal 16.5 ml per second. We managed him in May 16 and leading normal life since then. So basically, we have got number of patients, and I would say, like we have managed many so-called modern doctors as well who are suffering with this condition, many surgeons, physicians, pediatricians, gynecologists. And I would say the cherry on the top, one of our patients is a urologist from Mumbai who was suffering with this particular disease, and he came to us and we managed his urethral stricture 5 years back, and since then he is leading absolutely normal life. People like, especially modern doctors, surgeons, they come to us. It's not only because they do not have answer for this condition, but they come to us because they know that in Brahma Ayurveda, they are going to get very scientific and authentic treatment. Because as I mentioned earlier, that we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied, we never start the treatment. So we are open for any discussion with anybody at any point of time. This is our policy. So let me present some results. Now these results are based on the assessment or analysis of almost 244 patients. So here you can see the ascending outcome before treatment, after treatment. The mean Qmax or maximum flow rate before treatment was 6.3 ml per second. You can see the nature of the graph. And after treatment, the mean Qmax is 21.7 ml per second, which should be at least 15 ml per second. Also, like being a super specialist, so-called super specialist, we need to like present these things because it's quite necessary. So here, American Urological Association symptom index, I'm I'm not going to discuss this in detail later. Whenever we'll get the chance, we'll definitely discuss these things in detail. Just to summarize, the mean Qmax, sorry, the mean AUASIS mean score, if it is in between 0 to 7, 0 and 7, the symptoms are mild. If the score is in between 8 and 19, the symptoms are moderate. And if the score is in between 20 and 35, the symptoms are severe. So that you can see the before treatment, the score lies between the severity, and after treatment is very mild. So the quality of life, according to that, again, AOSIS, the quality of life before treatment was terrible and unhappy. Immediately after treatment, it was pleased and delighted. Then after 1 year, pleased and delighted, mostly satisfied. After 2 years, pleased and mostly satisfied. Now, it's not that each and every patient was doing absolutely well after our treatment. Here is the data of 244 patients, out of which 32 patients came back with relapse of symptoms, around 13%. Rest of the almost 87% patients are doing absolutely well after single set of treatment. Now, for all such patients who came with relapse of symptoms, we manage them again with 7 days of treatment, 7 settings of treatment. In that, we go for 3 days Uttar Basti, 4-day calibration, and again 3 Uttar Basti. Now, let me present such a case. Now, the patients who came back with relapse of symptoms were very specific. So we are maintaining that data also separately. So the patients who underwent multiple surgeries after multi-stage hypospadias repair, who were on regular CIC since long, patients with BXobalanitis, xerotica obliterans, post-buccal mucosal graft erythroplasty status, post-TRP status, and we have very hard stricture scar tissue. So all such patients, definitely, all these patients are very complicated, though they have to come back for additional 7 settings, and after they are doing very well, though they have to come back, but here is like, we are not going to perform any surgery for that. So let me present such a case for you. This guy underwent hypospadias repair in 89, and hypospadias repair is known to cause stricture. So he has to undergo VIU the same year. And after that, he has to undergo dilatations every 3 months. Second VIU in 98, after that, dilatation every 3 months. Third VIU in 2002, again, dilatations every 3 months. Fourth VIU in 2008, and the condition was so bad, as I mentioned, that urethra is supposed to be the most egoistic part of human body. So one should never ever disrespect urethra. Here you can see the way it was disrespected. The condition was so bad that he has to undergo dilatations every 15 to 20 days. And each time he used to suffer with severe bleeding, pain, burning, fever, chills, and rigors. And it used to take around 7 days to settle on everything. And again, after 7 days, he has to go for that. So his life was literally hell. He was very much frustrated and depressed. Now, when he came to us for the first time in June 15, you can see his flow was absolutely normal because he came to us immediately after the dilatation. We did his treatment, 20 days treatment, and you can see his flow lasted up to October 15 for 4 months. It started getting compromised in December 15. Here it is like getting compromised, 9.1 ml per second. So a person who has to undergo dilatation every 15 to 20 days, his flow lasted for almost 6 months. Again, we managed him with 7 settings of treatments in December 15. And from that December 15, his flow lasted December 15 to his flow lasted to December 16 for 1 year. After 1 year, his flow again was getting compromised. So we managed him December 16, 5th January 17, back to normal. So from 5th January 17, you can see December 17, flow normal after 1 year. 11th June 21, still his flow is normal. So a person who has to undergo dilatations every 15 to 20 days, now since January 17, his flow is absolutely normal. So this definitely we can offer in Ayurveda. Okay, let me, now this is regarding one more condition, post-urethral wall or bladder outlet obstruction. This guy, this is the last case I'm going to present. This is in fact a very challenging case. I would say the most challenging case of my career till date. This 9-year-old kid from Ahmedabad. This is a case of bladder outlet obstruction. He was having typical lower urinary tract symptoms, over distended bladder. Actually, his bladder was literally visible 2 inches above the umbilicus. It was that distended bladder with hesitancy, poor flow, incomplete emptying of the bladder overflow incontinence, and constipation, with a specific history of Vegadharana. This kid was having an impression in the mind that the washrooms in the schools are not really very clean. That's why he never ever used, he was using washroom in or avoiding urine in the school. So he usually was holding urine for almost like 7 to 8 hours daily since 2 to 3 years. Look at the MCU, micturitic cystocytoma of this kid, that distended bladder. So the radiological diagnosis for this condition, you can see that distended bladder, and this particular appearance, this whole appearance is called as spinning top appearance in radiology. And the spinning top appearance is a diagnostic feature of posterior urethral walls. But generally the posterior urethral walls are diagnosed at a very early age of maximum 1 year. Generally, they are diagnosed around 6 months of age of that kid. So to be a case of post-urethral wall, that too at the age of 9 years, was most unlikely. One more thing, here you can see the cut-off urethra, which is denoted with this red arrow. So this cut-off urethra shows a very tight structure, but actually this is the level of urogenital diaphragm. As that kid was holding urine very tightly, so the external urethral sphincter, the urogenital diaphragm, was so tight that it gave that kind of appearance of cut-off urethra. So radiological diagnosis was either post-urethral wall or a complete tight structure. Then according to the ultrasound, the sonological diagnosis was, you can see the pre-void urine was 1081 ml and the post-void was 836. So for a kid of 9-year-old, the bladder capacity is around only 300 to 350 max. And here it is thrice the normal capacity. So it was that over distended bladder. And you can see there were significant moderate hydronephrosis and hydroureter. Both ureters were dilated throughout their courses. So the sonological diagnosis was neurogenic bladder. Uroflow, you can see it was very poor, only 4.2 ml. That kid could provide only 40 ml of urine. So the differential diagnosis, either post-urethral wall, neurogenic bladder, or urethral stricture. But for me, it was a known case of bladder outlet obstruction or severe detrusor sphincter dyssynergia. So in this, normally look, when the bladder is full, we get the urge. And as soon as we enter the washroom, the bladder muscle detrusor, it contracts at the same time the urethral sphincter relaxes. So the contraction of the sphincter and relaxation of the contraction of the detrusor muscle and relaxation of the sphincter is called as detrusor sphincter synergia. So that kid, as he was holding it very tightly, so his sphincter was unable to open. That is called as detrusor sphincter dyssynergia or bladder outlet obstruction. He was advised to go for cystoscopy and post-urethral wall fulguration as an emergency treatment to preserve kidneys. Then he was referred to us by respected Vaidya Tapan sir. That patient approached him because his family was not at all ready to go for a surgery for such a small kid. Then that family went to Vaidya Tapan Kumar from Ahmedabad and he referred this case to me. We managed this case with Uttar Basti urethral calibration, Anuvasan, Niru and Kshir Basti for that kid, and double voiding. Double voiding is once that kid passes urine, within 10 minutes he or she has to again pass it to minimize the residue urine. Then we did Avagaha Swed, then oral medicines, and treatment started on 17th January 22. After 8 days of treatment on 25th of January, you can see the pre-void was 460. Previously it was 1081. The post-void was 123, which was 836 initially. And here the sonologist, the same sonologist has especially mentioned that as compared to the previous scan dated 10th of Jan, significant improvement noted in the form of regression in dilatation of PC system of both kidneys, regression in dilatation of ureters. So this kind of improvement within 8 days, 8 settings of the treatment, and even the flow improved to 12 ml per second, 11.5 ml per second from 4 ml per second, the max flow rate. And after 22 settings of Uttar Basti and 2 urethral calibrations, you can see the post-void residue is only 4 cc, insignificant, absolutely normal. And like there, the all back pressure changes on the kidneys, hydroureter and hydronephrosis, have completely resolved. So this is, I would say, definitely one of the most challenging cases of my career till date. And this kid is leading absolutely normal life since then. So it is believed in urology that pressure is important because pressure can do miracles. It's not that we manage only structure, but along with that, we also manage benign enlargement of prostate, post-urethral walls, post-TRP status. Though this TRP, transurethral resection of prostate, is supposed to be a gold standard in the management of benign prostatic hypertrophy, but unfortunately, the patient satisfaction is worse. The results are not really very promising. Surgeon satisfaction 100%, but patients suffer a lot, and in fact, we are managing hundreds of cases since last many years of known case of post-TRP stricture, because TRP is very much known to cause urethral stricture, and literally patients suffer a lot after TRP. Then we also manage bladder outlet obstruction, interstitial cystitis, which is supposed to be one of the most nasty conditions of this area. We also manage recurrent and multi-drug resistant UTI with Ayurvedic treatment only. We have many such cases because most of the patients who are suffering with stricture, they already consume a lot of antibiotics, and when they end up to come over here, they come to us, their infection is generally multi-drug resistant, and we manage such condition with only that Rakta Medo Pachakvat. Then hypotonic bladder, neurogenic bladder, and incontinence. I was invited to Japan for a workshop. Then a Japanese delegation came to our institute. This Japanese lady, she is Dr. Iko Azuma. She is a Japanese urologist. Many urologists from different countries have visited our institute. Dr. Gazio Nariman from Russia, Dr. This from Singapore, Dr. Salah from Egypt, Dr. Benimara Takfarinase from Algeria. They especially visited our institute to know what exactly Ayurvedic urology means and what exactly we do, and they really appreciated the work we are doing in this field. I was invited to Japan again for this 42nd General Conference of Ayurveda Society Japan, Osaka. Here is a small introduction of our institute.
Welcome to Brahma Ayurved, Gujarat's first ever multi-speciality Ayurvedic hospital with world-class standards. Founded by Doctors Jui and Narayan Shahane, we have multiple theaters well equipped for urology, proctology, Ayurveda, and Panchakarma. For patients staying over, there are multiple beds, ranging from common to VIP, with special facilities. Guests receive excellent, healthy food and access to an on-duty doctor around the clock. Here you can receive the best of modern healthcare combined with the age-old wisdom of Ayurvedic medicine. We receive many local and international patients for highly specialized procedures such as the Uttar Basti, an effective cure for urethral strictures, performed in our Ayurvedic Urology Center, the first and only in India. Brahma Ayurved. Follow the most authentic and updated science of life.
Thanks a lot for a patient hearing. I would like especially thank to the Ayurveda Teachers Association and the organizing committee of this 4th National Conference on Evidence-Based Medicine. This is really the need of the time, that we should present Ayurveda in this evidence-based form. Again, I would like to thank especially Suryavanshi sir for giving me this opportunity to present this branch of Ayurveda, Ayurvedic urology, in front of the teachers, respected teachers of Ayurveda. Then I would like to thank Chairperson Dr. Ramya ma'am, Co-Chairperson Dr. Suresh Podade sir, Dr. Akhilesh sir, and session coordinators Dr. Santosh Pathak sir and Dr. Reshma Kumar ma'am. Thank you. Thank you for giving me this opportunity. Thanks a lot.
Thank you, sir. Thank you for these interesting and thought-provoking facts about the Ayurvedic urology. Now I would like to request Dr. Ramya madam for her expert opinion. Over to you, madam.
Namaskaram. Am I audible?
Yeah, madam.
Yes, ma'am. Okay. So, Shri Gurubhyo Namaha. Namaskaram to one and all. Primarily, let me thank the organization for the opportunity. And once again, a special thanks to have an opportunity to listen to an expert clinician like Narayan sir. So, directly going through the session, I was a great listener when sir was unfurling his clinical experience and expertise. So whenever I, as a student, when I was learning Ayurveda, the basic thing that always haunted me, one question was always like, when Mutravaha Srotas Moolam was mentioned, Acharya Charaka mentions Vasti Moolam Vangshanam Cha, Acharya Susruta mentions Vasti Moolam Metram Cha. He never mentions Vrikka over there. And Vrikka comes in the spectrum of Medo Vahanam Srotasa Moolam, Vrikka Moolam Vapa Vahanam Cha, or Kati Moolam Vrikka by Susruta. So I used to think why Acharya had missed this Vrikka when he had opened the body. Definitely this connection he would have seen. No, why did he miss this Vrikka when speaking about Mutravaha Srotas, and how this Vrikka and Medas gets connected? So as we practice and try to observe things in a clinical way and more functional way, when I could see nephrotic syndrome kids with high triglycerides and all, I would definitely understood the clinical link between Medas and Vrikka when it was more functional. And when I was listening to Narayan sir, this sense of Mutravaha Srotas Moolam being Vasti Moolam Medram, I was visualizing it more and more, because that was becoming clear, like as a functional system, how Vasti and Medram comes together, and how an issue with respect to Vasti and the urethra and through Medram, we can correct by using one of the important Kriya Krama, Uttaravasti, which has been specifically mentioned about Mutra Krichradishu Uttaravasti. And the most beautiful part, I think, of Narayan sir's presentation was when he was mentioning the clinical symptoms of different perspectives of urethral stricture. We could again visualize the Mutravaha Sroto Dushti Lakshanas that has been mentioned, Ati Srishtam, Ati Baddham, so Ati Baddham, and Prakupitam, Alpalpam, Abhikshanam Va Bahalam, Sashulam Mutrayanto, Mutravahani Srotamsi Pradushtani. So that whatever he was mentioning about the different clinical presentations of urethral stricture, we could directly link it to Mutravaha Srotas, Mutravaha Srotas Dushti, and it's linked to Vasti and Metra and the role of Uttravasti over there. And when he mentioned again about Raktamedo Pachaka Khvatam over there as an internal medicine, again this link of Medas as a functional aspect and the whole relation of urinary system, Vasti, Medram, Vrikka as a whole was more evident. So I think the highlight of using Rakto Medo Pachaka Khvata internally in all the spectrum of medicine was definitely a highlight. And when sir was telling about retrograde ascending urethrogram, and then cysto-urethrogram, uroflowmetry, etc., etc. The surgical specifications, I think as Ayurvedic physicians, even as a GP, we all are supposed to be aware of these aspects. And the way he presented the cases with so much of confidence after experience is definitely an inspiration and example to all of us. And how, as a practitioner, once we concentrate on one particular thing, go deeper and deeper into it, we can become specialist and super specialist and help many. And Ayurveda as a science has got any number of opportunities, because our every Srota Dushti gives us an opportunity for that. So I think Narayan sir's whole, what you call it, as an institution, as an entrepreneur, as a clinician, he is definitely an inspiration, is definitely a role model for, I think, the new generation of Ayurvedic physicians to copy and take it forward in the life. So I think may God bless you, sir, with all what you call it as, with all things. My only request towards, I mean, when the discussion comes is when specifically says about this Dvistri Asthapana Shuddhebhyoho Vidadyat Uttaravasti. So how you are planning Uttaravasti without the Kashayavasti, or is the Kashayavasti a part of your procedure whenever you are performing Uttaravasti? And I think the procedure when you had mentioned about Uttaravasti without catheterization and the role, that is also a highlight, I mean, which can be simulated by many others. So if you could explain only that part, thank you all. That's all. Thank you. Namaste.
Thank you, madam, for your enlightening expert view. Now I would like to request Dr. Podhane sir to conduct the question answer session. Over to you, sir.
Thank you, madam. Thank you very much. Basically, when such an esteemed and very knowledgeable session, there is always two chances. Either everyone has been understood everything, and I think for Dr. Shahane sir's lecture, it is the only one possibility that we have understood everything. Otherwise, this was the branch which was always having a thought in our mind that it is always too many questions and too many doubts in our mind. But as I am seeing in question answer session also and in chat box also, there is no questions at all, or there is no doubts at all. So I think there is nothing to say for this. Just to I'm sharing this, there are many conditions which are still having benefits and benefit of doubt. Urethral stricture is amongst that. Urethral stricture is almost those. One stricture is always stricture. So everyone, including neurosurgeons, used to comment, I will try my level best and skills, but if patient's fortune is good, there will be he will be cured. But Dr. Narayan Shahane showed Ayurveda and Dr. Shahane can put some positive codes, and which is you will be cured. So thank you, Dr. Shahane sir. And I think there is nothing. Over to you, ma'am.
Thank you, sir. And namaste, everyone. I feel honored to propose this vote of thanks on the behalf of Ayurveda Teachers Association and my own behalf. I want to thank our eminent speaker, Dr. Narayan Shahane sir, to take out time from his busy schedule to grace this session and the event. Dear sir, you have truly made this session full of knowledge. And I thank you for your deep and intellectual way of imparting the evidence-based approach towards the Ayurvedic urology. I also want to express my deep gratitude towards Dr. Ramya Madam for her expert opinion as a chairperson for this session. And I would also thank Dr. Podhane sir and Dr. Akhilesh sir for their participation in this event as a co-chairperson. Thank you, sir. Thank you, madam. And over to Dr. Amar Kamble sir for the next session.
Thank you, madam.
Thank you.
Thank you, everyone.
Thank you.
Sonia, madam.
Yes, sir.
Are you there?
Yes,
Yes.
sir. I'm
Continue,
here.
madam. Continue,
Yes,
madam.
sir. Really, it was wonderful and very informative section. Thank you so much, Dr. Santosh Pathak sir and Dr. Reshma Kumbhar ma'am for conducting session nicely. I would like to thank from bottom of my heart to our speaker, Dr. Narayan Shahane sir, for giving us deep knowledge on UVRTs and sharing your valuable experience. I also like to thank Dr. Ramya ma'am, Dr. Suresh Podhade sir, and Dr. Akhilesh Shri sir. With this, we conclude the second session of this conference.
Sonia, madam.
Yes, sir.
Dr. Ramya, madam, has asked one question to Narayan Shahane, sir. How he is thinking about the Uttar Basti in stricture. Ramya, madam.
Sorry,
Sorry,
I had
I
just
didn't
asked
get
about,
that. I
yeah,
think the voice was not clear.
Ramya, madam can ask.
Please, ma'am.
Yes. No, sir. When before Uttaravasti, always Dvitri Asthapana Shuddhebhyoho Vidadyat Uttaravasti, it has been told, no, sir. So before Uttaravasti, usually Asthapanavasti has to be given. We practice only in that way, sir. So how do you do that? That's my only
In our
question.
practice for the patients who are suffering with stricture, generally we don't go for that.
Okay.
We do Uttar Basti only. Yes, for patients who are suffering with that bladder outlet obstruction, then neurogenic bladder, hypotonic bladder. So that is basically bladder outlet obstruction is a functional obstruction, kind of Udavat. So for that kid, I presented one case.
Yes,
It was suffering with the bladder outlet obstruction, which is a functional obstruction, kind of Udavarta. So for all such cases, definitely we go for Yoga Basti and Uttar Basti.
Okay. So strictures, no Kashayavastis are done before. Directly Uttaravastis.
Yes, directly Uttaravasti, ma'am.
Okay, sir. Thank you.
Thank you. I wish a grand
Thank you,
success to
sir.
this conference. Thank you. Thank you very much.
Thank you, ma'am. Thank you, sir.
Thank you.
Here we conclude the second session. Let's proceed to the third session. For today's third session, today's third session, Dr. Ajit Metke sir and Dr. Manisha Jagtap ma'am will be our session coordinator. I request Dr. Amar sir, please introduce Dr. Ajit Metke sir. Dr. Amar sir, please.
Yes, okay, madam. For our next session, that is third session, we have Dr. Ajit Metke sir, the first session coordinator. Dr. Ajit Metke sir has the experience of 8 years of the working in academics. Recently, he is working as an associate professor in the Department of Rog Nidan in SGMAMC Mahagav, Gadhinglas, Kolhapur Ayurved College. For the introduction of the second session coordinator, I request the Sonia madam. Over to you, madam.
Yes, sir. For our second session coordinator, third session coordinator is Dr. Manisha Jagtap ma'am. Dr. Manisha Jagtap ma'am is assistant professor in Kaumarvritta department at Smriti Bai Shaha Ayurved College, Hadapsar, Pune. Ma'am has more than 6+ years of experience in clinical and teaching experiences. Now I request both our session coordinator, please, you can continue the session.
Am I audible?
Yes, sir.
Yes, you are audible, sir.
Okay, thank you. First of all, welcome to all delegates. Our speaker, Dr. Snehalata Donala madam, Chairman Dr. Kamath madam, Co-Chairman Dr. Raut sir and Dr. Vitlani sir. This session's topic is common pediatric problems and their Ayurvedic management, issues and challenges. We have a very commanding authority to enlighten us about the topic. Firstly, I would like to introduce the chairman of this session, Dr. Kamath madam. Dr. Mrs. Anjali Dinesh Kamath madam. She is one of the very old BMS graduates. Ma'am have done advanced diploma in nutritional and dietetics. Ma'am is working as a yoga shikshak from many years. Ma'am have done diploma in naturopathy. She has more than 36 years of experience in academics. She is presently working as Professor HOD of Kaumarvritta Department at Anna Saheb Dange Ayurved Medical College, Ashta, Sangli, Maharashtra. She is also an approved PG teacher and guide. She have worked on various committees in Shivaji University, Kolhapur, and also in MUHS Nashik. So today we got such a seasoned personality as our chairman. Now I would like to introduce our co-chairman of this session, Dr. Lalit Kumar Vitlani sir. He is working as an associate professor and HOD of Department of Kriya Sharir, BS Ayurved College, Savantwadi. He has more than 15 years of teaching experience. Sir have completed BMS in 2002 from MUHS Nashik and MD in Sharir Kriya in 2007 from RSTM University, Nagpur. He is doing PhD in MUHS at Anna Saheb Dange Ayurved College, Ashta, Sangli. Sir have published more than 20 publications in various national and international journals. He is a member of editorial board in various renowned journals. Such a brilliant stalwart Am I audible?
Yes, you are audible, sir. Please continue.
Okay. Okay. Now I would like to introduce our second co-chairman, Dr. Mohan Raut sir. Presently, he is working as an associate professor, Komar Bhrutya Department, Datta Meghe Ayurved Medical College, Nagpur. He have completed BMS from Jupiter Ayurved Medical College, Nagpur. He have completed MD from Yashwant Ayurved College, Kodoli. He have completed BA from YCMOU, Nashik. He is doing his PhD at Mahatma Gandhi Ayurved Medical College, Salod, Wardha. He have published more than 10 articles in international journals. He published a textbook on Komar Bhrutya, which is also approved by MUHS as a reference textbook. Now, I would like to invite Dr. Mohan Raut sir to introduce our speaker. Over to you, Dr. Mohan Raut sir.
Hello, am I audible, sir? Hello, am I audible, sir?
Yes, sir.
Thank you. Thank you, Irish Teachers Association. Give me a chance. Good afternoon, all of you. It's a great pleasure for me to introduce our eminent speaker today, Professor Dr. Snehalata Dornala ma'am. She is BMS MD Komar Bhrutya, also did PhD in Ayurvedic Pediatrics. She is a member of IYCF, that is Infant and Young Child Feeding of UNICEF. She has a certificate in Health Research Fundamentals, that is CHRF, and postgraduate diploma in Child Rights Law, that is PGD-CRL from ICMR. Now she is working in a VYDS Ayurved Mahavidyalaya, Khurja, Uttar Pradesh, as a professor and HOD in the PG department of Komar Bhrutya, where she is also guide for many PG students. She is a good practitioner and deals with problems related to lactating mothers, newborn babies, young children, and adolescents. She authored many books and articles. She is visiting professor at MERU, that is MERU, that Maharishi European Research University, Netherlands and Switzerland. She is a curriculum committee member in developing various courses in National Institute of Open Schooling. She is a super specialist in dealing with the childhood disabilities like cerebral palsy, mental retardation, autistic children, ADHD, learning disabilities, epilepsy, and in children, etc. With having 19 years of clinical experience, her area of interest are nutrition and preventive medicine. Now, I am requesting Honorable Dr. Snehalata Dornala ma'am to share her views over our topic today's topic, common pediatric problems and their Ayurvedic management issues and challenges. Please, ma'am.
Thank you so much, sir. Namaskar to all of you and respected Chairman, Madam, Dr. Anjali Kamath ma'am, and Co-Chairman, Dr. Raut Mohan sir, and all the stalwarts of Komar Bhrutya. I'm so happy to share my knowledge. Of course, you are better than what today's lecture. I'm going to share my clinical experiences related to very common pediatric problems. And let me first congratulate the ATA, that is Ayurveda Teachers Association team, for successfully conducted the three conferences, and now this is the fourth national conference. And also I wish you all the 75th Independence Day tomorrow. We are going to celebrate, that is Azadi Ka Amrit Mahotsav already celebrate karte hui aa rahe hain. And on the same occasion, I also feel that the 75 years में हमें जो freedom जो मिल रही है, जो जोश हमें मिल रहा था, same type of feeling is there with the Ayurvedic fraternity who are exploring many ways. Previous those speakers को देख के मुझे इतना अच्छा लगा कि we are earlier it was like Ayurvedic doctor means nobody knows. But then again the specialities came, and as you all know that Komar Bhrutya pediatrician, अच्छा पीडियाट्रिशियन में भी मतलब आयुर्वेद में भी पीडियाट्रिक्स होते हैं, हमें तो पता नहीं, इस तरह से हुआ करता था. बट नाउ दे आर मूविंग टुवर्ड्स सुपर स्पेशलिटी, एंड इट इज रियली आजादी हमें सच में आया है, एंड आई होप इट कंटिन्यूज फॉर एवर. सो कमिंग टू द टॉपिक, आई जस्ट वांट टू प्लीज गिव मी अ मिनट, आई वांट टू शेयर माय पीपीटी. Is it visible? Please, anybody response?
Yes, madam.
Yes, madam, it is visible.
I'm trying to make it for full screen. Is it clear, sir?
Yes, madam.
Yeah. Let me also please tell me whether the slides are changing.
Yes, madam.
Thank you. So, common pediatric problems and their Ayurvedic management, issues and challenges. See, whenever we speak about the children and their problems, initially, who are children? The child, whether the child is a newborn child, we call it, or the children who are under 5 years of age, or the school going, or the adults, and to whom we call it as children. So this is a perspective from doctors, but what is the perspective of society? What they are thinking? कब उनको लगता है कि pediatrician के पास लेके जाना है? तो usually what happens, it is very early phase only, they think that children specialist के पास लेके जाना है. Otherwise, they go for their family doctor. And coming to what are the common pediatric problems now we are facing in the children in day-to-day practice is like they are something different from what we learned in our PGs. When I was a PG student, they us time mein used the children used to come with like sardi, khansi, jukam and all. But for that also they go for the allopathic doctor, and they come for like any bedwetting cases, or any disability type of case, or chronic cases, or skin infections. In that cases they used to come, otherwise not. And honestly speaking, I came from a National Institute of Jaipur, where we don't have much OPD at that time. So we don't have that much of exposure, and we used to be very worried about कि हम PG complete करने के बाद हमें करना क्या है आगे जाके, what we do. So क्या हम exclusive pediatric practice करने से we get the clients, or we have to shift to general practice or like that. So many doubts were there at that time. So we used to do joke भी हम create करते थे कि MD in pediatrics मतलब just हमें measurements and documentation, M यानी measurements, D यानी documentation हमें करना है. बच्चा आया, just weight किया, फिर उसको document करो, height किया, anthropometrical measurement, इसी में हम करते थे. इसके आगे हम कुछ कर पाएंगे नहीं कर पाएंगे ऐसा लगता था. But now एक बार जैसे ही बूम आ गया, आयुर्वेद की बूम आ गया, now the OPDs are filled with each and everything, even the infectious cases where the antibiotic dependent cases also there, where the cases only responds to antibiotics, those cases are also coming with the trust. And definitely if they come with the trust, we do better and we try to be better, and the outcome will also be good. But जैसे जैसे हम अगर देखते हैं कि our generation is there, and coming to the next generation, it must be better qualities than we. Suppose parents हैं, parents दोनों को gray hair 40 साल में आया है. If they are suffering with gray hair at the age of 40 years, then what the medicine or the technology used to do, the children are supposed to get at 50 or 60 years. We need to postpone. This is called as technology or generation. But what is happening reality is it is completely reversing. कि gray hair जो है 20 साल में या 22 साल में या 25 साल में भी आने लगा. It means we are not giving a better quality of life to our children. So why? What may be the reason? If we look at on कि क्या कारण हो सकते हैं, this gray hair is just an example, but all the qualities in all the areas of development, if we speak, they are getting more and more problems currently, and different kinds of problems because of different nutrition and different lifestyle. Somehow the children have been deviating or unattaching to the nature. They're not playing with the nature, they're not eating the nature food and all. That is something mismatching them and creating more and more different kind of pediatric problems in this current era. And maybe because of polluted air, polluted land and all these things. Where I used to stay in Delhi NCR, there I cannot explain you the pollution, the level of pollution with respect to sound or with respect to air or anything. So definitely different kinds of pediatric problems are coming. So how the issues and challenges, let's see. So as I told you कि child means somebody thinks that 5 साल के अंदर ही हमें बच्चे को लेके जाना होगा, and some think 12 years and some our as per Ayurveda, you know, Acharya Kashyap and everybody is told कि 16 साल and plus में तक comorbid में रखना है. But the child as per the definition, जो definition होती है child की WHO ने जो कहा है उसके according अगर हम देखते हैं तो 18 साल तक का होगा. So it means which to be followed. Being we are legally bonded and we are in the society, so some common rules that we have to adopt. So accordingly, we have to take into consideration and we have to educate each and every parent that no, सिर्फ 5 साल तक नहीं, हमें आगे तक भी आपको हमारे पास लेकर आना होगा. एक जोक में बताऊंगी, हमारे हॉस्पिटल में इन केस अगर कोई ईयर इन्फेक्शन से कान में दर्द के साथ अगर somebody came at the age of 9 years, at the age of 9 or 12 years, suppose 12 years का female अगर कान की दर्द के साथ आते हैं, then we used to fight. Pediatrician कहेगा हमारा केस है, and स्त्री रोग वाले भी कहते हैं कि 12 साल के बाद जैसे मेंसेस हो गए तो हमारे पास भेजते रहो, and ENT वाले कहेंगे कि हमारे पास. So this is also I think is there in all the other institutions as well. So we need to clear cut बताना होगा कि हम लोगों का कौन सा है क्या नहीं है. Accordingly we have to treat. And then the importance of treating children. See, as we all know that children are very, very important in building the society. And we also know that children are not the, young adults. And we also know that how important is the Garbha Sanskar. क्योंकि जितना भी हम गर्भ संस्कार में जो करते हैं, the exposure, the intrauterine environment, the child exposing during, and what kind of food and the lifestyle the mother is, the would-be mother is, adopting, all according to that only all the systems, organs and the organ systems are developing. And if that is in a proper way, then definitely the fetal induced childhood diseases as well as early childhood onset of adult diseases, ये सब हम prevent कर सकते हैं. So that is the reason very, very important to treat the children whenever a very mild condition occurs, then that has to be treated very immediately with very immediate effect. And then there are a lot of issues and challenges we come across while practicing the children. So what I experienced, I try to put on a slide. So I'll discuss in the coming slides. And during this early development of the children, usually we have to take care of the head, shiras, as it is an uttamanga. We need to be, very much care about that, because almost all the sense organs are present on the head, as well as the brain, the nervous system, the connectivity to all the parts of the body, rest part of the body, and the messages which sends everything. The important organ is present in the, that is in the shadang mein. Head is the major organ. So whatever the problem the child comes, whether it may be rhinitis or the cold and cough or the digestive issues or any urinary or anything, nervous system, we need to prescribe a head oil, what I experienced in my practice with the better results. Classification of age is also much, much important, as you all know that it is baby who is newly born is newborn, and in the simultaneously we call it as the infant until 1 year, and the toddler 1 to 3 years, preschool, school age, and adolescent. Why it is very important? Because each and every age group, we do have different kinds of dietary pattern and the lifestyle, and according to the dietary and lifestyle pattern, the diseases occurs. And in the initial first 1000 days of life is very, very important to protect the child with all together, which include the family members and the family pediatrician and all, so that the rest of the life of that baby will be move in a smoother way. These are the new challenges, new issues we used to see in the children. if we are speaking about the preventive aspect, who are the child who is watching the tab or the mobile with this position of slight bending the head flexion like this, neck flexion, then definitely at a period of after the 4 to 5 years, the pain starts, whether it may be in the back, upper back, or the hands, arms, or anything else. So as a preventive aspect, we need to apply something on the head as well as, and something to be taken about the abnormal posture to be corrected by, because we cannot avoid the online classes, because the growing children before COVID and after COVID, the drastic change has been occurred. So because of that, we need to change the posture and then have to do. And sometimes we used to, there may be chance to give the Griva Vasti and all, Sarvangadara and all. And the picture which you can see here, the burn case, these are the cases I am seeing at least 1 in 2 months since the post-COVID, because the COVID has trained a lot about health and health benefits regarding with respect to the steam inhalation. So when the parents are giving the steam to the younger children or the toddlers or the preschoolers, what happening is ubla hua pani mein steam dalte hain, not with the steamer in particular. So what happened, jab steam laga ke usko cover karte hain, cover karne ke baad, because of the accident, that boiled water suddenly they fall on their thighs. So this is the 6th case I was seeing with the same causative factor. So these are the new issues and new challenges. Whenever we used to advise the children, advise the parents कि इसको steam दे दो, before that it's very particular to say कि आप steamer में ही देना है. And then spending more screening time. This is also like, what happens if the screen time increases? Everybody knows there are very, very bad effects are there, like it affects the brain activity, academic performance, academic malpractice, sleep disturbances and all. I think everybody, those who are having kids in your family, of course, you might have been facing these problems. So for that, we need to do some preventive aspects like nourishing all the sense organs, like, putting the eye drops or, doing the Pratimarshanasya and the Kaval and Gandusha, and then, putting the oil on the head, everything are helpful in helpful the children in these current days. And indoor games and outdoor games, outdoor games are definitely very, very good for overall development of the child, with particularly to the cognitive as well as social development and language development. But nowadays it's very I can say it is it's one day it may lead to disaster, when if we are keep on continuing the indoor games or increasing the screen time, a lot more complications are ready to come up. So we must be ready to take up all these newer problems and newer challenges. And see, these are all the conditions where we can have issues and challenges in the pediatric practice. Why there are much issues in the pediatric population? Because of the unique vulnerability. As you know that there is a doshic inequilibrium always, because of the continuous growth and development and the demand of the metabolism, and then demand for the much more vitamins and minerals for that, as well as the immature tissues, because of they are not grown fully maturity, and also because of low digestive fire and low bala strength and low immunity, and because all the organ systems are not modified in that maturity level, they are directly wide and spread, wide and broad in terms. And that is the reason why most of the time respiratory infections and digestive infections are very, very common with a little exposure to the nidana. Because of this unique vulnerability, it is very challenging for a pediatrician to even to contract with the common pediatric problems. And again, the palatability also is very important. It means not that all the children will love to take either the sugar mixed syrup or honey like that. No. Aaj ke time mein I could able to experience mera ki ये बच्चे शहद मिलाने के बाद भी नहीं खा रहे हैं, ना तो चीनी देने से भी, मीठा पसंद ही नहीं करते हैं, नमकीन दे आर वेरी गुड इन इट, समोसा में मिक्स करके दे दो तो आई थिंक दे वुड हैव, बट आचार्य चरक ने या और आचार्यों ने क्या कहा, मधुर के साथ देने के लिए कहा। मधुर इसलिए नहीं पसंद आ रहा है क्योंकि उनकी चाइल्डहुड वेरी अर्ली एजेस से ही उनको वो मधु नहीं चटाया जा रहा है, जो जातकर्म से ही शुरू करना चाहिए था, स्वर्ण में मधु और घी के साथ वो टेस्ट पैलेटेबिलिटी तभी से इंट्रोड्यूस करना चाहिए था ताकि वो एडॉप्टेशन अच्छी रहे। बट after 5 years also, if a child has not taken the honey, then how that honey is good, they accept that honey. So these days palatability become a very difficult. So we need to think in a different way to how to give the mixtures and all. Then suitability. एक केस मेरे पास अभी आया था, उसमें क्या है, भूख नहीं लग रही थी, just I have given the चित्रकादी बट्टी half a tablet with buttermilk, but even that half a tablet for after 2 days she started getting that burpings and all, and because she is not adopted to that taste, that उसमें जो taste मिलती है, जो smell आती है, उस smell को देखते ही उसको vomiting वाला smell आ जाती है. Even though sometimes what happens is the medicine is good but the smell is not adaptability, then it won't suit, that we call it as that is not suiting to her. फिर हृदय के medicines हमें ढूंढना पड़ेगा and all. So whatever the best medicines, we have to ask कि कौन सा foods इसको अच्छा लगता है, उसके according फिर हमें अनुपान ढूंढना होगा. Then if you are giving a medicine for longer period, like for 1 month or 2 months, for example, for any cases like nephrotic syndrome or like that, then there are chances of adverse effects. So we need to see that also कि adverse effects ना आए और अपना जो रोग है उसको भी काउंटर करे, तो बीच में कितनी गैप हमें रखते हुए चलना होगा, that also is a challenging for us. Then add-on issues. लाइक एक रोग था, उसके साथ में हमने कुछ मेडिसिन हमने स्टार्ट किया, लेकिन मेडिसिन डाइजेस्ट होने में उसकी अग्नि इतनी कम है कि मेडिसिन ही डाइजेस्ट नहीं हो पा रही, तो ऑलरेडी जो रोग था उस रोग में एड ऑन हो गया दूसरा रोग. देन व्हाट दे डू इज, नहीं इस डॉक्टर से ठीक नहीं हो रहा है, तो देन वी शिफ्ट टू दैट. So in those conditions, what we have to do is first give Deepan and Pachan Aushadhis. Don't give the Roga Vyadhi Pratyanika Dravya there. Just give the Deepan and Pachan. Once that appetite gets increased, then add in a low dose. Unavailability of different dosage forms, the another issue. Unavailability, because we want in adult practice we have different dosage forms, like more than 25 doses. Either pills are there are kashayas are there, the syrups are there, asavarist are there, and other varieties are also there. But when it comes to the pediatric practice, we have very limitation, and if somebody is practicing in a very remote area or the rural area, then it becomes very difficult for them to get all those medicines. So completely we can't depend on the readily available medicines, and not we can completely, we don't have that much of time to prepare also. So that is also one of the major challenging for that. And then discontinuation of medicines. If if we are telling them to take for 15 days, but they are not doing like that, and once after getting relief after 5 days only, they just drop them. So again, it will occur. So we have to give awareness and educate the caretaker, paricharak, whoever it is, whether it may be informant, maybe caretaker, maybe the mother or the dadi or nani or papa. We have to educate them not to do like that. And fixing of the dose is also very, very important. We cannot fix in a single set. You have to take 1 tablet twice a day. Close follow-ups is very, very essential in the pediatric practice. How to identify a child with a healthy? See, you can take a pic of this or like that. There is a beautiful quotation by Acharya Kashyapa which says that Annabilasho bhuktasya paripakah sukena cha shrishta vinmutra vatatvam shariram chalagva. So that sloka, I made it into the acronym called healthy. In that only it fits into that. So this healthy acronym, we can educate the parents क्योंकि बहुत बार ऐसा होता है कि पेरेंट्स को लगता है कि क्या मेरा बच्चा हेल्दी है या अनहेल्दी है, ये एज अप्रोप्रिएट है या नहीं है, क्या ये इसकी एज के अकॉर्डिंग सारे माइलस्टोन्स हो रहा है कि नहीं। तो उसमें हम इस हेल्दी को फिट कर देंगे तो दे कैन स्क्रीन इजीली, एंड इफ दे गेट कुछ भी गड़बड़ होगा तो देन दे विल रश टू द डॉक्टर. Factors influencing the body, then any change in the food. If there is a fixed schedule of a 2-year baby, like सुबह जो है दूध पिएगा, उसके बाद दाल और हल्की आधी रोटी खाएगा, देन शाम को इस तरह, अगर ये फिक्स्ड शेड्यूल को हम हल्का सा उसमें अपना कोई दूसरे घर गए हैं या उनके रिलेटिव पे घर गए हैं, वहां पे कुछ चेंज हो गया, तुरंत द चाइल्ड की अडेप्टेबिलिटी डिस्टर्ब हो जाती है, एंड देन अग्निमांद्य, इंडाइजेशन, आर्म एंड अजीर्ण रिलेटेड डिसीजेस हो सकते हैं, या चर्दी भी होगा या अतिसार हो सकता है. तो व्हाट आई मीन टू से इज फैक्टर्स तुरंत इन्फ्लुएंस कर देते हैं. तो वी हैव टू इन अवर डेली प्रैक्टिस हैव टू ऐड वन क्वेश्चन कि इन दिनों में आपने कुछ चेंज तो नहीं किया, कहीं गए तो नहीं हो, वाटर का चेंज तो नहीं हुआ, सीजन चेंज हुआ, कहीं घूमने गए हो. सो वी नीड टू ऐड दीज क्वेश्चंस इनटू दैट. एंड role of Swarnaprashana. As these days, Swarnaprashana, just like how the immunity become a buzzword for the Ayurvedic pediatrics or the other comorbidity subject, this Swarnaprashana's word become a buzzword. Even recently, the Dr. Lakshmikant ji Bajpayee ji राज्य सभा में भी इस चीज के लिए Swarnaprashana के benefits को लेके वहां बताए हैं. तो this is our really a very good strength. So I wish each and every practitioner who is practicing practicing with the children, so you take the advantage of this Swarnaprashan. But whenever you do the Swarnaprashan, you also, because 5 साल के अंदर के बच्चों को अगर Swarnaprashan हम देते हैं, उस समय में इम्यूनिटी या इम्यूनाइजेशन को लेके हम कोई क्वेश्चन नहीं पूछते. अधिकतर जो सिर्फ बीएमएस करके जो प्रैक्टिस करते हैं वो ये सब नहीं देखते हैं, जस्ट डायरेक्टली दे कीप ऑन गिविंग Swarnaprashana. उस समय में अगर उसी दिन उनका अगर होता है कोई भी वायरल, सपोज एमएमआर है उनका, तो उस दिन ना देके उससे पहले दिन देना है Swarnaprashana को, एंड देन उसके बाद 1 वीक तक ना देके उसके बाद फिर दोबारा कंटिन्यू करना है. Coming to mal practice of food intake, as you all know that children are allowed to eat chocolates, cold drinks, ice creams. These are all too cold items, and they also allowed to take kurkure, chips, uncle chips, taka and all. These are too dry foods. एक सिंगल एग्जाम्पल मैं बताती हूँ. ड्राई फ्रूट्स लेने से, अति रूक्ष आहार सेवन करने से श्वास रोग संबंधी व्याधि उत्पन्न होते हैं. अगर हमारे पास कोई ब्रोंकियल अस्थमा का कोई केस आ रहा है, एंड इफ यू आर नॉट आस्किंग दैट उसने अधिकतर क्या खाता है एंड नहीं पता होगा, तो वी कैन नॉट रूल आउट द निदाना, एंड वी कीप ऑन ब्रोंकोडायलेटर्स हम देंगे, फिर म्यूकोलाइटिक वाले हम देते रहेंगे, है ना, फिर ये सब देंगे तो कुछ नहीं होगा. सो निदान इज वेरी वेरी इंपॉर्टेंट टू रूल आउट. देन टू ऑयली नहीं देनी चाहिए, एंड लाइक दैट. एंड one more example I want to quote here: milk and misconception. Usually most of the mothers, even though whether they are literate or illiterate, what they think is milk is good for their children. अगर मिल्क गुड है तो वो कीप ऑन गिविंग. 1 साल तक तो मिल्क अच्छा ही है, उसके बाद सप्लीमेंट्री फीडिंग देना चाहिए, एंड देन सॉलिड्स पे आना चाहिए, एंड मिल्क को हमें सिर्फ सुबह और शाम को रखना चाहिए. नो, दे कीप ऑन गिविंग. 1 से 1.5 लीटर तक उसको देते रहेंगे. देन दे कम टू अस सेइंग दैट कि इसको अस्थमा हो रही है, या इसको खांसी नहीं जा रही है, या ठीक से खाता नहीं है. इफ वी टेक द हिस्ट्री ऑफ दैट, देन हमें उसमें पता चल जाता है कि वो 1 से 1.5 लीटर रोज पीता है. जैसे ही वी कट ऑफ दैट मिल्क, देन अगेन उसकी एपेटाइट इंक्रीज होने लगती है उसको, और अगर कोई स्किन मैनिफेस्टेशंस होते हैं तो वो भी ठीक हो जाता है. तो वो मिसकंसेप्शंस को हमें दूर रखना होगा. एंड आई हैव वन मोर केस. उसमें क्या था, उसकी मदर, उसको अर्टिकेरिया था, उस चाइल्ड को अर्टिकेरिया था फॉर since 2 years. The child is just 5 year old, and 2 years को उसको सिवियर अर्टिकेरिया, एंड ही इज ऑन एंटी एलर्जिक, कभी सेट्रिजिन लिया, कभी एलेग्रा लिया, एंड ऑल लाइक दैट. दे केम टू मी एंड आई कीप ऑन आस्किंग द केस. तो उसमें मुझे पता चला उसकी मदर सुबह सुबह वो उठने से पहले ही उसको 5 बजे बिना ब्रश करवाए, मुंह मतलब ओरल हाइजीन ना मेंटेन करते हुए उसको 1 ग्लास दूध पिलाती थी और उसके बाद उसको सुला के, बिकॉज शी इज अ टीचर, शी गो टू हर स्कूल। स्कूल थोड़ा ज्यादा दूर था उसको, तो उसको 1 घंटा पहले निकलना था, तो उसको दूध पिला के सोती थी। मैंने कहा क्यों ऐसा? तो कहती कि नींद में ये अच्छा पी लेता है, अगर ये उठने के बाद उसको ब्रश करने के बाद दूध देते हैं तो वो बहुत सताता है। And I thought that is the major reason for her skin, manifestation. The moment I told her कि आप बंद कर दो, then उसके बाद मैंने रक्त प्रसादक और स्किन वाला दिया तो इतना अच्छा रिस्पॉन्स आया, उसके बाद उसको इतनी दिक्कत नहीं आई थी और 1 महीने के बाद उसको सारे मेडिसिन छूट गया था। So this is how we need to do our approach. कॉमन पीडियाट्रिक प्रॉब्लम्स, बिकॉज दिस इज अ वेरी ब्रॉडर टॉपिक। कौन सा टॉपिक लेना है नहीं लेना है मुझे नहीं समझ आया, तो मैं जो ट्रीटमेंट्स रिलेटेड प्रॉब्लम्स आएंगे उसके अकॉर्डिंग फिर मैं बताती रहूंगी। सो पीडियाट्रिक्स में 2 तरह के होते हैं, एक इन्फेक्शियस एंड दूसरा नॉन इन्फेक्शियस। सो इन्फेक्शन में यूजुअली द ज्वरा इज वन ऑफ द मेन प्रॉब्लम। फीवर आते ही द पेरेंट्स विल गेट पैनिक एंड देन कुछ नहीं खा रहा है, अरुचि। So these two are, the major problem issues. हमें इनको देखना होगा. And the more स्रोतस involved, the common more स्रोतस involved are either the digestive system or the respiratory system. तो इसमें अतिसार, चर्दी, विबंध ये सब usually पहले भी हुआ करते थे, अभी भी हो रहे थे. Nowadays constipation become a major problem. Constipation इसलिए, see, what I feel is there are only 2 kind of roga present in the children. One is Santarpanajanya Vyadhi, other is Apatarpanajanya Vyadhi. Earlier it was, when we are reading 20 years back like that, diarrhea, pneumonia and malnutrition were the major mortality rate in the children. They both, the 3 are main because of the Apatarpanajanya Vyadhi. But now the diseases are more of Santarpanajanya Vyadhi. अग्नि कम है, ज्यादा खिला रहे हैं, दूध भी अच्छा है तो भी ले रहे हो, ड्राई फ्रूट्स अच्छे हैं तो भी दे रहे हैं, चॉकलेट्स ऊपर से जा रहा है और उसका लाइफस्टाइल बिल्कुल नील है, आउटडोर गेम्स बिल्कुल नील है। तो व्हाट इज हैपनिंग? ऑल दे आर एक्यूमुलेटिंग एंड ऑटोइम्यून डिसीजेस, ऑल आर संतर्पणजन्य व्याधिस एंड इन्फेक्शंस आर आल्सो, आई फील लाइक संतर्पणजन्य व्याधिस ओनली। सो इसमें हमें विबंध और आम्ल पित्त, जो एसिड रिफ्लेक्स वाले केसेस भी जो छोटे बच्चों में नहीं होना चाहिए, एक पर्टिकुलर एज आने के बाद आना चाहिए, पित्त काल में आना चाहिए, यानी कि पित्त एज में, यंग एज के बाद आता है पित्त एज। कफ एज जो है चाइल्डहुड फेज है, इवन देन कफ एज में भी इतना खिला रहे हैं कि उसका मंद अग्नि बन के आम्लपित्त हो रहा है, GRD, राइट। एंड ग्रहणी, ऑल दिस केसेस आर दिस टाइम और इंक्रीजिंग डे बाय डे. Respiratory is there and list is more. Even in earlier days we used to take one syndrome, either the Downs or others are Turner syndrome or any other syndrome, once in 6 months, like when we are studying, उस तरह से हमें देखते थे, उस केस को लेके फिर इतना रिसर्च हम करते थे। परंतु अब के टाइम में ऐसे ऐसे नया सिंड्रोम, उसको जैसे हमारे पास आता है तो उसको हमें गूगलिंग करके पूरा हमें पढ़ना पड़ता है, उसको टेक्स्ट बुक्स खोल के पढ़ना पड़ता है कि ये अच्छा, ये भी एक नया सिंड्रोम आ गया, अच्छा ये भी नया। सो दीज डेज सिंड्रोम्स बिकम वेरी कॉमन। सो हमें, और न्यूरो बिहेवियरल डेवलपमेंटल डिसऑर्डर्स भी बहुत कॉमन हो गया, तो आ जाते हैं ऐसी, ऑटिस्टिक बहुत नॉर्मल हो गया, ADHD भी नॉर्मल हो गया। रीजन वॉट एवर इट मे बी इट इज बिकॉज ऑफ एल्डरली मैरिज और लेट प्लानिंग फॉर कंसेप्शन और नॉट प्लानिंग विथ प्रॉपर गर्भ संस्कार करके नहीं करते हैं, या एनी स्ट्रेस लेवल इंड्यूस्ड, वॉट एवर मे बी, बट हमारे पास ये केसेस बहुत इंक्रीज हो रहे हैं। एंड कमिंग टू Nindita Ashana, you can take the pick of this. This is like, Anashana, not taking any food or habitual intake of very small quantities of food, or excessively taking of food before the previous meal is not digested. All these are the major causative factors for the Santarpanajanya Vyadhis. Disorders of GI system. There may be the structural disorders like congenital deformities, which we have to look into. They will come only in the early phases only. And then motility disorders like sluggish motility in the intestine because of poor gut microbiome or because of santarpana, over feeding, leads to sluggish motility and then leads to constipation and all. And parasitic infections may be there associated with the liver, fatty liver. This become very very common in the children, whether the child is obese or not. Earlier it was like childhood obese हो जाता है तो ही जो है हमें fatty liver देखने को मिलता था. And see, my observation is the allopathic medicine has increased to that much in a very big technology that it is more keen in diagnosing the disease with giving a newer terminology to the newer diseases. But our strength of Ayurveda is not the diagnosing the name of the disease, but rather the diagnosis of the causative factor, so that the Chikitsa principle of Nidana Parivarjana, Samshodhana and Samshamana, Nidana Parivarjana comes first. And what I believe is the strength of Ayurveda is prevention, not the prescription. And then coming to constipation. So constipation के लिए एक छोटा सा example मैंने देना चाह रही हूँ कि these days, earlier it was like huggies या mammy poco pants जो है सिर्फ उन्हीं बच्चों में देते हैं जो lying position में रहते थे, बेड में ही रहते, तो बेड खराब ना हो इसलिए दिया करते थे. But now what happened is, even you see triple XL वाला जो आता है, that suits up to 35 kgs of weight. It means almost 8-9 years तक के लिए वो बनाने की कोशिश करते, मतलब उन बच्चों के लिए है. So इस तरह से if somebody is keep on putting this huggies to their children, what happens, the child will think that मुझे urination तभी करना है जब मेरा huggy है, नहीं है तो मुझे नहीं. He don't know the bathroom or the नल या बाहर जाना है या कहीं और ये कुछ नहीं पता, उसका अर्ज भी नहीं आता है. Just अगर huggy हो तो वो जाएगा, नहीं तो नहीं. It means we are misusing our senses, our memory. Each and every cell has its own memory कि अर्ज bladder full हो गया तो अर्ज of nutrition वाला urge of micturition वाला cell हमें initiate करता है. But if we are suppressing them by putting the huggies like that, then what happens? Our memory lost, and the children they don't behave in a normal way. Then again the constipation occurs. This is a simple one. Here all very medicines are there. Trivrit Lehyam is there, Aragvada is there, and Trifla is there. Even with Hrudya Virechana Aushadhi is there. Very very medicines are there. Even simple any Rechan, Deepan, Pachan with Jaggery also, that will cause. But apart from that, Amalaka Arishtam, this is particularly has been told for Balaka Vibhaddham. So this is also a good medicine. Easily palatability is also good. Bala Shodhini Tail, this is also very good if you want, somebody wants to very pellets type of severe constipation is there. So once you do Rechana, followed by if you give the Matra Vasti with this Bala Shodhini for weekly twice or day after day, alternative days also, that will be very beneficial for the child. Krimi Roga, what my approach is, whatever the krimi it may be, whether it may be roundworm or pinworm or hookworm or anything, the easiest method is deworming the child. So deworming एक albendazole और mebendazole कुछ भी देते हैं तो वो उसे दे दो, लेकिन जब लगातार हो रहे हैं या उसकी सिस्ट भी है हमारे पास एंड उसकी साइकिल को बंद रखना है, तो फर्स्ट थिंग इज निदान परिवर्जना. सो मिट्टी भी खाता है या चौक या whatever it is, hair whatever it is, first we have to stop that one. क्यों, कैसे हम स्टॉप कर सकते हैं? एक तो हम उसको वैसे साइकोथेरेपी करते हुए हम करेंगे, और दूसरा Hrudya Aushadhis. My principle of giving Hrudya medicines in this Paika is because the Hruday is having some properties like, Icha, Dvesh and all. So that Icha, the desire to eat something, so we have to cut off that one by giving some Hrudya medicines like, simple Amalaki or the Arjuna or, mixed with the Praval and all. That will definitely help the child to get rid of this one. And Virechan to be done, and regular Virechana or Virechana is in the in the small children, especially below 2 years, we cannot give because the gut microbiome will be flushed out. So where we can plan a vasti like that, and then Sroto Shodhana type of Shamana medicines also be given. and followed by, once they get rid of, then only how to try for Brahman and Balyan. So Brahman and Balya, so think from the Rasadhatu level first, not directly going into Astidhatu. So Rasadhatu, then Raktadhatu, Mamsadhatu. So keep on doing like that. So it will give. So in this, you can also add, some laddus also can be prepared and all. Pediatric respiratory diseases. So pediatric respiratory diseases, the moment one say that the baby is crying means the life has started. If the baby is not cried or delayed cried means, definitely we all know that, because we are pediatricians, we know that the complications and the consequence of that, it may leads to, HIE, or may leads to, PVL, periventricular leukomalacia, or, atrophy of a particular this thing, or bleeding, and anything occurs. So RONA is very, very important, and that is a sign for the life. So pediatric respiratory diseases, the major causes which we see in the school-going children and the adult are Vega Sandharana as well as Ruksha Padartha Sevana. The children, the school-going children, suppose they know that there is an urge for the urination, but in the school, because of the bad unhygienic condition of that bathrooms, they don't go. They just keep on holding that one. And at one particular day, they lead with, hiccups as well as the dry cough, and then followed by that respiratory system gets compromised. Once that gets compromised, even with a slight exposure to any pathogen, leads to infections. So in this way it happens. So what are the lakshana for this? Either the ati srishtam, over, matlab tachypnea, ati baddham, it may come up, down, alpa alpam, kupitam, abhikshnam, sashabdam with sounds, sashulam with pain. So these, either the breath is very much or very low, or with pain, or with sounds, with abnormal sounds like wheezing, crepitations, etc. So we have to treat as per the lakshana, as per the causative factor. There are a lot many formulations. Single herbs are there, like Bhrungaraja. It is a very, very widely used. It is useful for Panchavidakas and Panchavidashwas. External application of many oils like Karpuradi Tel or Tekaraja Tail and all. And there are also bronchodilators. We can also give Vasavalehi or Vyagri Haritaki, or there are many Yashti Madhu, simple Yashti Madhu, if it is there with the Chardi and all. Sroto Shodhan, we can take the help of the Vacha, Musta also, right? And this is Pranava Stroto Vikruti. If there is a Sangam, Atipravrutti, Vimarga Gamanam and Siragrandhi. If it is like that, then how our approach will be? Siragrandhi, suppose for example, tonsillitis, Tundikeri or peritonsillar, this is a Grandhi is there. In this Grandhi we need to do Lekana and Chedana. Same for the adenoids also. And whatever the respiratory system disorder may be, application of oil in the nostrils, on the chest and pana as well as on the head is very, very important. Very, very important. And one can go for Deepana Pachana Aushadhis, Kasahara, Shwasahara, Chedana, Bedana, Anuloman, Jwarahar, Chardihar, Trutya, Vyavahi, Vikasi. Simple. And if Pratishaya is one of the most common problem, rhinitis, सिंपल इज कदिरादी वटी मुंह में डालना है और हर 2 घंटे में एक बार ऐसे करें तो 1-2 दिन में ही रनिंग नोज स्टॉप हो जाएगा. नो नीड टू गिव फॉर 5 days or 7 days और लाइक दैट. दैट्स इट. अपर रेस्पिरेटरी ट्रैक इन्फेक्शंस को हम टारगेट करेंगे, कट ऑफ करेंगे तो एकदम से वो लोअर रेस्पिरेटरी तक नहीं पहुंचेगा. फीवर इज वन ऑफ द मेजर and common symptom for the children with any infection. तो उसमें हमें करना क्या है? ऑलरेडी फीवर आया और उष्ण औषधियां देना क्या सही है? तो तुरंत उस समय में नहीं देना चाहिए. एंड फीवर को हमें देखना है कि ये 2 दिन की है, ये 5 दिन का है, 7 दिन का है या 14 दिन का, कितने दिन की क्रॉनिसिटी होती है वो हमें देखना होगा. एंड देन जितने षडंग पानी, वेदर द 6 ड्रग्स आर अवेलेबल देन इट्स ओके. नहीं, सिंपल चंदन, मुस्ता, परपाटा क्या आपको मिल रहा है, यू जस्ट गिव ऑन, पान करवाते रहना चाहिए. एंड आमाशय ऑक्युपाइड विथ दोषा, तो उसको हम आमाशय के पास हम लेप लगा सकते हैं. एंड देन फोरहेड के ऊपर भी हम चंदनादि लेप या कोई लेप हम लगा सकते हैं. एंड सी पंचगंध चूर्ण, पंचगंधादि चूर्ण उसको हम हेड पे लगा सकते हैं. इट्स अ वेरी वेरी गुड रिजल्ट्स विद दिस पंचगंधादि चूर्ण. एंड आल्सो यू नो पोस्ट फीवर डेबिलिटेशन, लाइक अगर कोविड हो गया बच्चों में, या कुछ टाइफॉइड हो गया, या यू नो जस्ट लाइक कुछ ऐसी डिसीज हुआ जिसकी 2 वीक्स का उनको फीवर हुई थी, तो उसमें हमें ब्राह्मी वटी शुड बी टेकन. ज्वरोत्तरा उसमें हमें ये ब्राह्मी वटी बताया गया है, तो उसको हम नेक्स्ट 15 डेज तक के लिए हमें देना होगा. द साइंस बिहाइंड दिस इज, सी ईच एंड एवरी सेल, व्हेनेवर द इन्फेक्शन अकर्स, द पैथोजेंस विल डोमिनेट आवर बॉडी. वो हमारे बच्चों के शरीर में राज्य करते रहेंगे. तो ईच एंड एवरी सेल इज लॉस्ट इट्स ओन मेमोरी. सो वंस वो फीवर डोमिनेशन खत्म हो जाती है, उसको माइल्ड विरेचना देकर, जरमुक्ते विरेचनम, माइल्ड विरेचन देने के बाद यू हैव टू गिव ब्राह्मी वटी इन ऑर्डर टू रिकैप्चर द लॉस्ट मेमोरी ऑफ ईच एंड एवरी सेल. उसके साथ साथ में आप ब्रूमहन बल्य वाले दे सकते हैं. Coming to bleedings, simple bleedings, adogata raktapitta and all, you all know that shatavari for adogata, and urdhvagata में आप आमल की यष्ट मधु ले सकते हैं. Nose bleedings and goat milk अगर मिल जाती है तो stop all the milk and you can give in a very small quantity goat milk दे सकते हैं. And then delayed speech, if we are speaking about neuro behavioral developmental disorders, उसमें से जो very common we used to come across is delayed speech or stuttering speech or inability to complete a phrase or sentences even after attaining 2 years of age, like that. So उसमें हमें rule out the structural deformities. And I in my college, regularly I have one PG scholar is doing a Swarna Prashna, with the different एरियाज को लेके करते हैं. तो उसमें डिलेड स्पीच में मैंने एक बार करवाया था, तो इतना अच्छा रिजल्ट हमें मिला विथ वेरी सिंपल. दैट सुश्रुत की कोटेशन है, उसमें सिर्फ वचा है और कुष्टा है एंड देन कनक है, दैट्स इट. उसके साथ हमें मिला था. तो वन कैन गो फॉर दैट. Adolescent problems, you all know, psychological problems, addictions, peer pressure is there, social media influence is there, sleep problem, menstrual disturbances may be there, and study related, particularly when they are appearing for the board exams like in the 10th, 11th, 12th, like that. So we need to do like that. So every adolescent child, I recommend Shirodhara for them in every 6 months. This is as a prevention for anything else. Pandu is also one of the very common. And एक केस मेरे पास आया था, referred, that child is 7-year-old female. उसको पाल्पिटेशंस होती है, घबराहट होती है, जैसे कुछ चीजें लेती है या उसकी पोजीशन चेंज होती है, ऑल ऑफ अ सडन अगर वो भागती है, ऐसा कुछ होता है, तो उसको पाल्पिटेशंस था. उस केस को मेरे पास लेकर आए थे एंड उससे पहले उनको एक जनरल फिजिशियन के पास लेके गए थे पाल्पिटेशन. तो दैट जनरल फिजिशियन हैज रिफर्ड हिम टू a neurologist, एंड न्यूरोलॉजिस्ट उनको देके एक कोई मेडिसिन उनको रखा है, एंड देन ही रिफर्ड टू साइकोलॉजिस्ट की शायद स्कूल में कोई दिक्कत हो सकती है. स्कूल का फिर उनके टीचर्स के साथ मिले, ये सब हुआ. उसके बाद साइकोलॉजिस्ट की एक मेडिसिन, न्यूरोलॉजिस्ट की एक मेडिसिन को लेते हुए मेरे पास आए कि लेट अस ट्राई फॉर एन आयुर्वेदिक आल्सो. सो मैंने उसको देखा, देखने के बाद मुझे ऐसा कुछ लगा कि पूरा एग्जामिन करने के बाद उसको रसधातु क्षय भी लक्षण लग रहे थे और रक्त धातु क्षय के भी लक्षण लग रहे थे. मैंने सिंपल सीबीपी करवाया. सीबीपी करवाने के बाद उसको आया 6.5 ग्राम्स. एंड आई वाज शॉक्ड कि आप इतने सारे डॉक्टर्स के पास गए, आपको कोई हीमोग्लोबिन नहीं करवाया? नहीं, हमने प्रॉब्लम बताया, फिर सारा उन्होंने पूछा, फिर देन उनको मेडिसिन दिया. तो मैं धीरे धीरे उनकी 1 हफ्ते में उनको टैपरिंग करके उस मेडिसिन को स्टॉप करवाया. एंड देन आई स्टार्टेड सिंपल विद दात्री लोह, नॉट विथ वेरी वेरी मेजर. दात्री लोह मैंने दिया, देन भृंगराज आसव दिया. एंड उसके बाद उसका आप यू कैन नॉट बिलीव दैट 40 डेज के बाद जो है उसका वो चीजें मतलब सारे बंद हो गए थे. दिस इज हाउ सिंपल. कभी कभार ऐसा लगता है कि दिस आर नॉट अ बिगर इश्यू, बट हमें लगता है ऐसा. हेलो, मैं बाद में करती हूँ, सॉरी. एंड नेक्स्ट डेंटिशन प्रॉब्लम्स. सो डेंटिशन प्रॉब्लम्स लाइक you all know, उसमें डेंटिशन में दंतोद्भेदक दांतक रस देते हैं. एंड इसके अलावा पिप्पली आसव, पिप्पली हम सिंपल पिप्पली भी आप दे सकते हो. इलायची को पाउडर करके शहद के साथ चटा के गम्स में आप लगा सकते हैं टू ईज एंड रिलीव पेन. तो कपूर इज वेरी वेरी इफेक्टिव इन एज ए पेन किलर। हम डायरेक्ट ना देके उसकी माला बना के उसकी माला को जो है हम गले में टांग दे तो वो भी इफेक्टिव रहेगा। नहीं तो कपूर तेल तो है ही है, लवंगादी तेल आती है ना, तो गार्गलिंग भी हम करवा सकते हैं अगर वो बच्चे 5 इयर्स के ऊपर हैं या 4 साल के ऊपर हो तो। नहीं होगा, छोटे बच्चे हो तो सिर्फ हमें अप्लाई करना होगा। शूल इज ऑल्सो अगेन वेरी बिग टॉपिक। इट इज जस्ट वी हैव टू सी कि क्या ये पित्तज शूल है कि बहुत मतलब इंफ्लेमेटरी टाइप है कि टच भी नहीं कर पा रहे, देन वी हैव टू रिफर दैट। अदरवाइज वी कैन मैनेज दैट ऑल्सो। समटाइम्स मे बी अपेंडिसाइटिस हो सकता है अगर लोकलाइज्ड पेन है और ट्रिगर हो रहा है। पेन कहाँ है, साइट वगैरह देखते हुए हमें देखना होगा, वरना इन शूल में लेप डू वंडर्स। अच्छी लेप्स, अगर हम कफज है तो थोड़ा थिक लेप लगाना है, वातज होगा तो थोड़ा पतला विथ कोई ऑयल के साथ मिक्स करके हम लगाएं, और पित्तज होगा तो कोई कषाय वाला अगर साथ में हम लगाते हैं और साथ साथ में हम इन्फेक्शन और इमरजेंसी को रूल आउट करें तो इट डू वंडर्स। प्लानिंग द ट्रीटमेंट, एज यू नो दैट कुछ भी हम प्लान करेंगे तो दीपन पाचन औषधियों से शुरू करते हैं। अगर कोई ऑब्स्ट्रक्शन है वॉट एवर इट इज मे बी, तो उसको हम स्रोतोशोधन देंगे, देन ओनली गिव फॉर ब्रह्मणा। नॉट कि एवरी चाइल्ड इज कमिंग वीक अगर हो गया तो मल्टीविटामिन डोंट स्टार्ट इन द फर्स्ट विजिट। आप मल्टीविटामिन नहीं स्टार्ट करना है। वंस यू हैव टू गिव दीपन पाचन, देन स्रोतोशोधन, देन फॉलोड बाय रसायन एंड ब्रह्मण। And single herbs are very very essential when it comes to young children. जहां न्यूनेट्स हैं, जहां मंथली बेबीज हैं, वहां मैं कहती हूँ कि एक जाति फल रख लो, आप हरितकी रख लो। इस तरह से सिंगल हर्ब्स को मैं बताती हूँ, हल्दी, कच्ची हल्दी रख, तो इस तरह से उनको घिस के बस देते रहना चाहिए। एंड सौंफ का पानी, these all do wonders. These are the rasayana drugs specific to the specific tissues, so we can pick whatever as per their adaptability, as per their taste of taste palatability. We can choose anything of that. And age wise suitable rasayana herbs are there. These I have been taken from the Arogya Raksha Kalpadruma. It's an exclusive book for the pediatric practice. It's a very good book, so one can give this as a preventive medicine. Now it comes like when to give panchakarma, when we have to give panchakarma. So panchakarma when the problem is chronic, बहुत लंबा समय तक मेडिसिन ले लेके बच्चा थक गया है, वहां that is an indication for panchakarma. And if the problem is suppressing and again after 15 or 1 month or after 2 months if it is recurrency में हमें देना होगा, not responding to any pathy, whether it is allopathy, homeopathy, ayurveda, anything. If it is not responding, go for panchakarma. And if we can't give medicines for longer time also, there we have to go for panchakarma. So panchakarma means not only the classical panchakarma, there are many sub procedures and miscellaneous procedures are there which are very very much helpful for the children. And during the panchakarma, there are quite challenges which we used to come across. One thing is, if we tell them कि हमें अगर हृदवस्ती करनी है, कि कंजेनिटल हार्ट डिसीज है, वहां पे हम साथ में हृदवस्ती करना है, तो we need to counsel them more कि हमें पहले उनको आश्वासन देना होगा। वो फिर कहेंगे 100% ठीक हो जाएगा। Then I'll ask them कि आप जितने भी डॉक्टर्स के पास गए होंगे पहले, तो क्या उस डॉक्टर से यही बात आपने पूछा है 100% ठीक होगा? Why फिर asking the Ayurvedic doctor with high expectations? Then skills to encounter the adverse reactions is very very important. कि अचानक अगर कोई वस्ती हमने दिया, उसको इतना वस्ती के साथ साथ में वस्ती द्रव्य के साथ साथ इतनी वाटर लॉस हुआ, ऑल ऑफ ए सडन वो इट्स गोइंग इनटू सेमी कॉन्शियस उसमें जाएगा, तो हमें उस चीज को काउंटर करने की स्किल्स आते हैं कि नहीं, दैट वी नीड टू। सो व्यापत्त को हमें अच्छे से पढ़ना है और उसकी रिलेटेड वाले सारे हम रखना है अपने पास, देन ओनली हैव टू गिव। फर्स्ट एड टेक्निक्स आर वेरी वेरी इंपॉर्टेंट। वन नीड टू नो हाउ टू रिससिटेट, वन नीड टू नो हाउ टू, अगर बर्न्स है तो कैसे करना है, तो अगर फ्रैक्चर हो रही तो कैसे, इन चीजों को भी हमें साथ में लेके तभी पंचकर्मा हमें करना होगा। आस्क फॉर मेनी इंपॉर्टेंट थिंग, आस्क फॉर एलर्जीज। इवन दो द यष्टिमधु इज वेरी शीत and very congenial, but sometimes I have seen a very rare case where even the slight application of the yashtimadhu also causing rashes, skin rashes. So we cannot think that it is a very safe. Patch test is very very important before applying any lepa. This and I could not able to collect more. I have many cases with pre and post, but I could not able to. This is a case with, severe bronchial asthma case. Every month used to affect, and you see the changes related to the deviation in the, chest, this pectoral girdle and all. So there we given, Tekaraja Thail and Karpura Thail mixed Urovasti for 15 days continuously. And that recurrency has decreased a lot. And after that, we are given other therapies, Sarvangadara and all. This is a case of Erb's palsy, where the child is, delivered normally, but it is with the help of forceps. At that time, on the same day, they have not recognized, and they get discharged in the second day. And after coming to the home, they have seen that they are not, the child is not using the one of our this left hand. So immediately, because they are the known, for me, so they have sent me the pic of this. After seeing only, I told that you just bring it to me. Then after, I have started giving some, oils, and also I've started Swarnaprashan, and it told some exercises related to that and the Abhyanga techniques and all. So in between the treatment, only after 15 days, the hand, could able to abduct a few. And this is after 2 months, the child could able to, fully move her shoulder joint. And now the she is of 4 months. Her grip is slightly less. Otherwise, we cannot say that she's suffered with Erb's palsy. Shiropichu is also much important. Until and unless the anterior fontanelle is not closed, daily regular Shiropichu I advised for the children according to their prakriti and the need of for that. So conclusion, I hope I have taken much time. Sorry for that. Conclusion is identify the health risk behavior in childhood, and prevent the formation of risk factor. Right drug, right dose, right time, and right anupana will hit the pathogenesis, and it will give right results. So Sukham Dukkam hi balanam lehet kanakam shishum. So Swarnaprashan, please do follow that with regular, not only that one single day, but daily regular practice is very important. Thank you so much for patient hearing.
Thank you so much, ma'am, for such an informative lecture. I would like to request Pritlani sir, please conduct the question answer session.
Yes, good afternoon, everyone. Thanks to the Ayurveda Teachers Association office bearers, especially our friend Dr. Mundal Chaudhary sir, for giving me this opportunity to be a part of this academic fest. Dr. Snehalata madam has precisely covered most of the common problems, pediatric problems and their Ayurvedic management. She has also covered the new problems of the children, that is the screen time, increased screen time, and attention deficit hyperactivity disorders. There is one question from Dr. Amar Kamble sir. Madam, he wants to know your views regarding Ayurvedic management of malnutrition.
Thank you, sir. Thank you, Lalit sir. Ayurvedic management of malnutrition, again, the plan for this treatment again depends on the age, mainly the age. At what age the malnutrition occurred? Suppose in the 1 year or 2 years only the malnutrition is there, means malnutrition means what? Age inappropriate with all the anthropometrical measurements. So we cannot tag exactly if we know that the reason is because of malnutrition, then only we can tag it as a malnutrition. Otherwise, with all the low anthropometrical measurements, we cannot tag it as a malnutrition. Maybe sometime malabsorption may be one of the symptom, or santarpana janya vyadhi, overnutrition also may leads to malnutrition and all. But if we know that it is because of malnutrition, the simple thing is we have to rectify the proper nutrition. That's it. If the age is 2 years, according to the age 2 years, what has to be taken, that we have to give. how much of the quantity of what food to be taken, like usual preparations can be taken, and all the protein related, herbal protein related diet can be taken, and vastis can also be planned once the agni gets enhanced. And then think for the rasa dhatu, rakta dhatu, then like that, all the dhatus to be taken into consideration and be nourished according to their agni, bala and ojas.
Thank you, madam. Madam, in the starting of the lecture, you have emphasized on application of the head oil, and in the end of the lecture, you have also told about the Shiro Pichu and its importance. We want to know in which type of Prakriti person, that is Vata Pradhan, Pitta Pradhan, and Kapha Pradhana, which oil is best to use?
Sir, see, I before answering your question, I just want to share one of my case also.
Yes,
as
sir.
we see in the newborn babies or in the neonates, we see the physiological jaundice or sometimes pathological jaundice where the bilirubin levels goes higher levels. So at that time, just after crossing of this 15 gram per dl, they shift to phototherapy and all like that. So what I used to do is, before starting that physiological, as we know that 60% of the patients, they used to have that. So initially, once in the second day or the third day only, if I could able to see the changes in the yellowish discoloration and all like that, then the clean, hygienely prepared Brungaraj Swarasa Pichu will be applied on that, on the Shiros. I have done it in many cases where there was not any necessary for the children to keep in the phototherapy. By that, the child's that consequences related to that extra over use of this phototherapy also gets decreased. And in the same way, Balatela Pichu already Acharyas has told. So Balatela Pichu can be taken for the children. And if Pitta Pitta Prakriti is there, Himasagara Taila is there. So hundreds of tailas are there with different combinations. Brahmi taila is there, Brahmi Lakshadi taila is there, Lakshadi Kera tailam is there. There are different combinations, like, one tail is prepared with the base of Kera tailam, that is coconut, and the other is prepared with the sesame tail. If coconut tail preparations are taken, then they are very congenial to the children. So Eladi Kera tailam or Lakshadi Kera tailam, Himasagara tailam, all these will helpful in children in a very good way. Okay. Manjishtadi tailam can also be taken when the children are suffering with some what you say, pratishaya and all these things. Vatahara, Kafahara, Aushadis can also be taken into consideration, where in which the tailas are there, the Dashamula taila is there, Rasana is there, so that can also be taken. Panchasneham can be taken, sir, in the malnutrition cases also. Panchasneham tail is there. It is a mixture of all the tails. Even in the rickets or in the delayed anterior fontanelle closure, there also it acts. Mahamasha tail is there. Masha Saindavadi tail is also there, where if you want Stroto Shodhan if you want, then Masha Saindavadi tail can also be taken. And Neeli Brungamala Kyadi tail. This is also when you want to nourish the sense organs, especially in the autistic children or ADHD, there Brungamala Kyadi Kera tailam. It can be taken. And there is a Dasha Pushpa tail. That tail is prepared with all the 10 flowers. This is not easily available everywhere, so that is also is very good in all these neurobehavioral developmental diseases. And sometimes not only the tail, we can blend the tail with the ghee. So I have introduced research Grita Shirodhara earlier in 15 years back only, for the cerebral palsy and the neurobehavioral developmental disorders, where I used to give only exclusive Gruta Dhara, Shirodhara. So we can do Shiro Pichu with Taila and Gruta also. Brahmi tail is there, Ashwagandha tail is there, ghee is there. Sorry, in ghee. Mahakalyanak is very, very good in this. It depends on the condition one can give.
Thank you, madam. As someone has precisely said, education is nothing but the facilitated process of conditioning the mind. And ATA is sincerely doing this in a precise way by guiding the new generation of Ayurvedic teachers, that is teachers, a nation builder, Madam, moving towards the next question is from Dr. Ajit Metke, sir. He wants to know the Ayurvedic approach for multi-drug resistance pneumonia.
So
Multi-drug resistance pneumonia. Nowadays, a very common problem in the pediatric field.
Yes, sir. If a case is coming with multiple resistant pneumonia, so it means that already had taken multiple antibiotics at a previous time. So already low immunity. First thing we have to check whether the birth history tells us a premature baby or low birth weight baby. If they are with, then we have to educate the children. There is something, these are the problems, struggling problems which occurs. Urodhara with different angles, like prone positions, side positions, and the back positions and all, followed by urovasti, because we cannot give again the medicines here. If you want, we can give the medicines which are having, Swarna, Abhrak, Loha, Gopi Chindanadi Gulika, and combination with the Swarnaprashan, like that, only single medicines, that's it. And Karpura Tail, Tekaraj Tail, ब्रोंकोडायलेटर्स वाले कुछ ऑयल्स के साथ हम उरोधारा हमें करना हो, नॉट इन द एक्यूट कंडीशन टाइम में, उस टाइम में नहीं करना है। जैसे ही एक्यूट कंडीशन ठीक होके जब वो, उसके बाद फिर हमें देना होगा। उसके बाद हम लेप लगा सकते हैं सर, थिक लेप हम लगाए, बिकॉज द सबक्यूटेनियस द स्किन ऑफ बेबी इज very thinner when compared to the adults and the absorption is more. So उस समय में हमें लेप लगाना है ताकि नीचे की जो लोअर रेस्पिरेटरी ट्रैक्ट तक हमें पहुंचने के लिए एज सच आयुर्वेद में कुछ नहीं है, तो द बेस्ट रूट इज सबक्यूटेनियस रूट। सो उस रूट को लेके हमें तेल और वो लेना होगा।
Thank you, madam. As we all know that data is the new currency in the field of technology. Similarly, the evidence is the currency in the field of science. And I sincerely hope that through this presentation and discussion afterwards, all of us will get benefited for our practice. It looks like we are running out of time. So I guess I have to finish here. For further proceedings, I hand over my mic to the Dr. Manisha madam. Thank you.
Thank you, sir. I would like to request Dr. Kamath ma'am. Ma'am, please give your expert opinion on this session.
Good afternoon, everyone. First of all, I must thank ATA for giving me the opportunity to chair this session. It was a very fruitful session. Dr. Dornala madam elaborately presented all the issues and problems which are faced by pediatricians nowadays. The topic is so vast that I think she was in paucity of time actually, but she tried to cover a lot of problems and issues which are faced by the pediatricians. So I would just like to comment slightly that nowadays the issues faced by the pediatricians are of two types. Essentially that the causes, the diseases which are seen in the pediatric age group are generally of two types: excess and where there is lack of nutrition. This is a very common problem nowadays because of lack of movement, especially within the last 2 years due to corona and other such things. Children are sitting around in the house doing nothing, and the first 3-4 slides madam had shown the postural changes which are occurring earlier in the children because of excessive use of gadgets. That is very commonly seen, and because we have to, whether we like it or not, as parents, we have to provide the gadgets because of the schools. So if we have to do such things, then the most important thing which I feel is the parents should be taken into trust when we treat the children. That is a very important thing as pediatricians, that first the parents should be able to trust the pediatrician, and that is a very big issue because nowadays parents are well educated, they are Googling all sorts of things, and that's why they have to be taken into trust first, and then only we can tell them about whatever treatment we can do. Like excessive diseases of excesses, that is many times we are seeing now that the children are obese in affluent families. That is because they are getting all things as soon as they ask for it. And this is going to happen. We have to face it. But then whatever, like one case I can remember, just an example without taking much time. That is a patient had come and she said that my child does not eat anything unless and until I give her a 5 rupee noodle packet.
अभी मेरा वो खत्म हो रहा
5
है
rupee noodle packet. So how in the
ठीक है,
first
आप अगर चले जाना है तो आप
get
चले जाना,
addicted to that noodle packet because the mother used to give it to her because it was very
बाहर से
easy to
ऐसे
prepare.
बाहर से रख
So
दो
when
ऐसे
we tell
रख
the
दो।
parents not to give them oily food
हाँ,
or
ऐसे
any
बोलो,
other such
5 बजे
things,
आ
we
जाओगे
have
ना?
to also provide them with alternatives. That is,
अगर
if
यहाँ
they
रहना है
don't
तो
have
यहाँ
to
रह
give
सकते हो, जाना है तो जा सकते हो, कोई दिक्कत नहीं।
chips or any other such
ठीक,
things,
हाँ।
then what they can give otherwise, that is also very important as far as prevention and nutrition is concerned. Like for a simple example is many patients of mine remember me because I tell them usually that if you want to give a quick fix to the child like noodles, instead of that you can always give the child a peanut laddu, which with things that are easily available around the house. That is what is needed is only peanut jaggery and ghee. So that is easily available in the house. So such alternatives are needed to be provided to the parents when you tell them not to give whatever oily food and all such things. And children should be encouraged to play outside. That is very important, which or play, that is physically play, which is likely to reduce many ailments which are seen in the children nowadays. Now, without taking much more time, because there is a lot one can speak on these issues, still, since we are in lack of time, one thing I would like to add that when I was introduced, thank you for the introduction, sir, Raut sir. The only grudge is that he made me feel old. So anyway, so as a senior person, I just added some few things from my experience, like peanut laddu and so on. So thank you, sir. And thank you, ATA, for giving me this opportunity to speak at this session. Thank you very much.
Thank you, ma'am. I deem it a great honor and privilege to propose the vote of thanks on behalf of the organizing committee of ATACON 4th National Conference 2022. We are extremely thankful to Dr. Professor Snehalata Dornala ma'am for giving an excellent coverage to pediatric problem and their solutions. I like to express my sincere thanks to Dr. Anjali Kamath ma'am. Thank you, ma'am, for giving your valuable time to us. We are extremely happy with our co-chairman, Dr. Mohan Raut sir and Dr. Vitlani sir. So thank you so much for joining us. I would like to put on record our healthy thanks to Dr. Sonia ma'am and Dr. Amar Kavre sir for the perfect support and guidance. Finally, I also extend my thanks to all the participants and back office team. Now I conclude that the session is over. I hand over the commands to Dr. Sonia ma'am and Dr. Kamre sir. Thank you, all of you.
Thank you, Manisha madam.
Thank you.
Thank you, madam.
First of all, thank you, Dr. Snehalata Dornala madam. She has put the light on various Hetu Sevan, that is Ahitkar Ahar Vihar Sevan, which is seen frequently in this modern era and which is giving rise to the various diseases, various unnamed diseases, rather to say, in children's. And thanks, madam, for your very experienced and knowledge lecture on various pediatric diseases. We will be definitely get benefited with that. And also thank for giving various references which go unrecognized while reading the Samhitas. I thank to Dr. Anjali Kamath madam, chairperson, for giving her opinion. I also thank Dr. Mohan Raut sir for conducting the session very nicely. I also thank Dr. Vitalani sir for conducting the question and answer session very nicely. And at the end, I thank Dr. Ajit Medke sir and Dr. Dr. Manisha Jagtap madam for successfully conducting this session. And thanks to one and all. So we are ending the session here. So moving further to the next session, which is fourth session, I would like to introduce our session coordinator, Dr. Madhulika Tiwari Madam. She is the session coordinator for the fourth session. Madhulika Tiwari Madam is working as an associate professor in a department of the Rachna Sharir in Datta Meghe Ayurvedic Medical College and Hospital, Nagpur. She is pursuing PhD in Rachna Sharir subject. She has presented 4 papers in international peer-reviewed journals. She is being indulged in the various research activities. She has 5 granted copyrights and she has 4 papers presented and overall 19 research articles published in the international journal. Among them, 5 are published in the Scopus Index journals. So I request Dr. Madhulika Tiwari Madam to conduct this session. Dr. Madhulika Madam, over to you.
Good afternoon, sir. Thank you, Amar sir, for inviting me for this session. And I welcome you all in today's Ayurveda Teachers Association organized 4th National Conference on Evidence-Based Ayurveda. I welcome you all for this session, and I would like to introduce, we have very eminent speaker among us. We have eminent chairperson, co-chair for this session. I would like to introduce them to you. I welcome you. We have amongst us very renowned proficient researcher, Dr. K.M. Pratap Shankar sir from Thrissur for today's session as a speaker. We have chairperson, Dr. Sudhir Kandekar sir for today's session of research trends and prospects of Marma Chikitsa. Also, we have amongst us as a co-chairperson, Dr. Sachin Khedikar sir, who will be heading the co-chair today. First, I would like to just give a brief introduction of our today's chairperson, Dr. Sudhir Kandekar sir. It is my pleasure to introduce today's chairperson, Dr. Sudhir Kandekar sir. He is a BMS MD in Rachna Sharir. Sir is presently working as a professor and head of department at Radhakrishnan Doshniwal Ayurved Mahavidyalaya, Akola. Sir has formerly held the post of head of department at MGAC, SRC, MGAC Salod Vardha, SRC Ayurved College Chikhli. Sir has also held the post of Vice Dean at MGAC Salod Vardha, and he has been an officiating principal at SRC Ayurved College Chikhli. Looking at his research profile, sir has a very good profile. Sir has completed more than 12 research projects. He is having currently 5 research projects in hand and also published more than 15 articles in peer-reviewed international journals. Sir is a founder. I'm very proud to say that Sir is founder of spine and Marma remediation techniques. He has been applying Marma Chikitsa since last 15 years, and he has established a result-oriented methodology to overcome ailments affecting to the sufferers. And thousands of patients, not only from our country, but abroad have been benefited with Sir's treatment. Sir is a proud recipient of Best Teachers Awards consecutively in 2010, 11 and 12. Sir has held various university responsibilities as a member of Board of Management at DMIMS in 2011 and 12. He has been member of Academic Council at DMIMS DU in 2012 to 2014. Sir has been member of Board of Studies Preclinical Board from 2006 to 2014. Sir has also been a member of Examination Cell at DMIMS DU in 2006 to 2014. This way, Sir has held various responsibilities at various posts, and he has been working in the field of Marma Chikitsa since long, and it is a pleasure to have him amongst us. Thank you, and I welcome you, sir.
Thank you, madam. Thank you.
We have the co-chairperson for our today's session, I welcome Dr. Sachin Khedikar, sir, for today's session. I'll give a brief introduction of sir. We already know sir is a great personality in the field of Ayurveda. Sir is BMS MD in the subject of Rachna Sharir. Sir is presently a PhD scholar at MGSC Salod Vadha. Sir is currently working as a Dean Academics, Professor and Head of Department Rachna Sharir at Sri Sai Institute of Ayurveda Research Medicine, Bhopal. Sir has previously held the post of Principal at Sri O.H. Nazar Ayurveda College, Surat. Sir has a vast teaching experience of 14 years, which includes 7 years of PG teaching experience. Dr. Khedikar sir has published 2 patents in the field of Ayurveda. He has published more than 30 research papers in international peer-reviewed journals. Sir is also proud recipient of more than 10 awards till date. He has presented more than 30 research papers in international and national and international seminars and conferences. I'm proud to say that sir has graced various national and international conferences as chairperson. He has also been a resource person as at an ROTP for Rachna Sharir. Sir has contributed around 3 chapters in proceedings in the conferences. Also currently, one of the book on research methodology is in the way of publication. And I welcome, this is a very short biodata of sir. I know we can add a lot to this. I welcome you, sir. Dr. Sachin Khedikar, sir, welcome to this conference.
Thank you, ma'am.
Thank you, sir. I would request sir to kindly introduce our today's speaker, Dr. K.M. Pratap Shankar, sir. Over to you, Sachin, sir.
Thank you, madam. Today's eminent speaker is Dr. K.M. Pratap Shankar, sir. He has completed his BMS from Dharma Ayurveda Medical College, Tamil Nadu, and he has completed his post-graduation, that is MS Shalyatantra, from SV Ayurvedic College, Tirupati. And the title of his thesis was about leech application in Vicharchika. Then presently he is working as a research officer in National Ayurveda Research Institute for Panchkarma, Cherutu, Ruti, and in CCRS, Ministry of Ayush. His professional experience is he was worked as an assistant professor in Department of Shalyatantra in Santagiri Ayurveda College, Palakkad, between 2013 to 16. He has lot of publications in his credit. Recently, he has published a book, Content Development for the book was, that is Marma Chikitsa, Basic Trends in Ayurveda and Therapeutic Approaches. And this book is published by CCRS in 2020. Around 17 articles he has published in national and international peer-reviewed journals. He has also published 3 articles in conferences proceedings. He has a vast research experience and associated with various research projects, also associated with the documentation of effective Marma practices, a documentary research project. Similarly, he is also related with the documentary research project, that is documentation for the Visa Chikitsa practices. He has also have a great experience in seminars, in workshop. He presented many papers and posters in international and national conferences and workshop. The remarkable one is that is Danish Lymphedema Framework and Wound Healing Society, Denmark. So he is internationally acknowledged personality around us. Also, he was awarded with the Best Paper Presentation Award at Ashwini 2011, which is the International Conference on Ayurveda, which was held in Chennai in 2011. So his biodata is very vast and he is very well known personality to all of us, and Marma, as you know, which is the core topic of Rachna Sharir. And I think the topic of today's his presentation is research trends in prospects of Marma Chikitsa. So sir has the vast experience of this field, and I also welcome you, sir, for this conference. I also welcome the today's chairperson, Dr. Sudhir Kandekar, sir. And I invite you, Dr. Pratap Shankar, sir, for your talk on the topic that is research trends and prospects of Marma Chikitsa. Welcome, sir.
Thank you, sir. Thank you, sir. Hope I'm audible, sir.
Yes, sir.
Yes, sir.
Okay. So with the permission of the chair and the co-chair, shall I share my screen, sir? So hope my screen is shared. My PPT is shared.
Yes, sir.
Okay. Shall I check it is moving? Is it moving, sir?
Yes, yes.
Okay, fine. Okay. So namaste all. So very good afternoon for all the faculties and students who are attending this conference. And so with due respect to the chairperson and the co-chairperson, let me start my session. So today is a Sunday and an afternoon session. So after a heavy meal, and it is an online session also. So the conditions are not favorable for my session. Hope I will, I will overall, I will pass over all these hurdles. That is with, I will make this, I'll try to make this session that is more informative and more interactive and interesting. So let me start my session. So my the topic of today's session is the research trends and prospects of Marma Chikitsa. Actually, as per the that is my biodata told by sir. Actually, I am a Shalya person that is basically trained in anorectal surgeries. But after joining CCRAs, that is for the past 4 to 5 years, I have been involved in that is documentation of Marma Chikitsa. And that is CCRS conducted a documentation research project. So I will be telling about this project in my session. So my relationship or my interest area of interest in Marma Chikitsa started after this documentation. And after this documentation project, that is my clinical interest was more on Marma Chikitsa practice. And so I will try to share those clinical that is the experiences and also the research, what is the present research trends in Marma Chikitsa. So with this brief introduction, let me go into my session. So myself, Dr. Pratap Shankar, Research Officer, National Ayurveda Research Institute for Panchakarma, Thrissur. It is under CCRA's Ministry of Ayush. So let me start my session. So as you all know that Marma Chikitsa, which is based on the human anatomy and physiology and utilizes various vital points or areas of the body for preventive and therapeutic health benefits. It involves various manipulative techniques and 2 complex procedures. That is complex procedures like Abhyanga, Bandhana, Ubanahas, etc. So we all know that what is Marma. So Marma are the various seats or specific locations of prana, that is pranasthana in the body. So before going into the topic, I will give few that is introduction part of Marma, so that it will be a continuous lead. So as you know that Marma is a pranasthana. So the prana, we know that it circulates throughout the body, and when this prana is located in a particular part, and when this particular part is injured, it becomes either fatal or it can cause deformity to the body. So the word Marma is formed by 3 syllables, Ma, Ra, and Ma. The Ra symbolizes Agni and Ma symbolizes Soma. So we can understand that the Agni part, it is ensheathed or it is protected by the Soma part. That explains the importance of Marma. And the disease of Marma affecting Marma comes under Madhyama Roga Margas. So usually we can understand that it is commonly affecting the Sira and Snayus, most commonly. We all know that there is exogenous factors, there is Aganduja cause for Marma Abhigata, but there is also Nija, that is the endogenous cause also. That is, for example, let me make it clear with the example. That is, for example, in the case of Vada and Kapha getting vitiated and located in the Snayu and creating Snayu with the Vada, in the wrist can cause CTS. So there is a Nija Anubandha also in Marma Abhigadas. And as Vedanta Darshana has mentioned 5 types of koshas, Pranamaya kosha is related to Marma. So when we see the functional and there is a structural and functional aspect of Marma, we all know that Marma is nothing but Mamsa Sira Snayu Asti Sandhi Sannipataha Teshu Swabhavada Ye Vishesha Pranas Tishtanti. That is, structurally Marma is a junction of Marma, Sira, Snayu, Asti and Sandhi. So it is classified based upon the constituent and also its locations. That is the common classification. That is, as we all know, that it is classified by Sushruta as Mamsa, Asti, Snayu, Sira and Sandhi. And apart from that, Vagbhata has added Dhamani also in the classification. So based upon the location, that is in the Shadanga, Marma can be localized in the upper or lower limbs, in the trunk, which includes the chest, abdomen and back, and also in the head along with the neck. So when a group of marma, which is located, that is a larger number of marmas, when is located in a smaller area. For example, if it is located in the shiras, those we call it as mahamarmas. That is, as mentioned by Charaga, that is in Trimarmiyam, he has mentioned here shiras, hridaya and basti as the marmas, mahamarmas. So when we analyze the tridosha predominance in this mahamarmas, we can that is identify that shiras is shiramarmas are kapha pradana, hridaya marmas are pitta pradana, and basti marmas are vata pradana. So those as those marmas are located deeply, that is, as I mentioned, it is located in Madhyama Roga Marga. But they for the structural identification and also for the easy for surface anatomy, the marma points are identified and the sizes are given to marma points. That is half angula, maybe 1 angula, 2 angulas, or 3 angulas, or size of the palm, that is thala. And as for the prognosis or the effect of injury, it is classified as Sadhya Pranahar Marma, Kalandra Pranahar Marma, Vishalegna Marma, Vaikalegra Marma, and Rujakara Marma. So what I told earlier is a structural understanding, and this is the function understanding. So we all know that Marma is the 6 of Prana or Pranasthana. So all the 12 Pranas, that is the Agni, which indicates the 5 types of Pitta, the Soma, which is the energy part, and the Vayu, which contains all the 5 types of Vada, Sattva, Rajas, Tamas, the that is Trigunas, Panchendriyas and Bhutatma. This forms the 12 Pranas, and this Pranasthana is nothing but Marma. So we all know that the symptomatology of marma injury, that is Brahma Pralapa Padhanam Pramoho Vijeshtam Samlayana Ushnadeja Srastangada Murchana Murda Vadas Tivra Rujo Vada Kridascha Tastaha Mamso Udagabam Rudiram Chagachet Sarve Indriyarto Uparmas Tadeva Dashada Sankeshapi Vishakteshu Vikshakteshu Samanyato Marmasulingam Muktam. That is, Sushruta is beautifully explained in the 25th chapter, where he mentions about the Ashtaveda Shastra Karmas. So here he mentions that is while telling about the Ashtaveda Shastra Karmas, that is what are the complications can arise. That is, when you analyze these symptoms, it is almost correlating with the different stages of shock. So when we see the different types of marma abhigadas, that is, for example, in Sira marma abhigada, it can be correlated with the hemorrhagic stroke. That is the Surendra. It can be mentioned. It is mentioned as Surendra Indra Gopa Pradimam Prabhudam Raktam Sarvet. That is, it indicates a hemorrhagic shock. And when we analyze the Snayu with the Lakshanas, that is Kaubhyam, Sharira Avayava Sadaha, Kriya Shakti, that is, it affects the structural, physiological, and functional. It can cause the functional disability to the body. And if it is Sandhi Marma Abhigada, then it can cause that is the symptoms similar to septic arthritis or infective arthritis, like Shofa Adivardhi, Ruja, Balakshaya, etc. And when you analyze the Astividya, that is Astividya Marma Lakshanas, it closely resembles with the disease of, that is the affecting astis, for example, osteomyelitis, or it can be that is fractures of the bone. So when we analyze the importance of marma, that is, it is mentioned by Sushruta as it is marmani shalya vishayardham. That is, it is off of, that is 50% of marma, that is shalya tantra is based upon marma. That is, if a person knows about the marma, he will be understanding 50% of shalya tantra. Why means because that is, he mentions that if there is a marma abhigada, immediately the patient dies. Yasmaja marmasu hada nabhavanti sadhyaha. Jivanti tatra yadi Vaidyagunena. That is, even though because of the Sreshta Vaidyagunas, that is the interference of Vaidya, even though he becomes alive, but it causes Vikalatvam Asamshayam. That is, it can cause deformity to the body. It is undoubtful. So with this importance of marma, we will understand what is the importance which is mentioned in Ayurveda, but we'll be having a doubt, that is whether marma chikitsa is mentioned in Ayurveda or not. So we might have read in the that is Rajana Sharira, that is we have mentioned, that is we have read about the preventive aspects of how to prevent the marma abhigadas. But there are also curative aspects of marma abhigada mentioned, but it is sporadically mentioned in different chapters. That is, for example, it is mentioned in Varana Chikitsa, Shashti Upakramas, Bhagna Chikitsa. That is, and also the management of residual damage of the marma abhigadas can be done in the general line of treatment of dosha chikitsa like Shodhana and Shamana chikitsa, Vada Vyadhi chikitsa, Samnyasa chikitsa. So when we analyze the general principles of management of Sroto Dushti, that is, for example, in Sroda Adipravarti, that is in case of marma diseases, in the case of Sroda Adipravarti, usually what we'll do is we will bring back the doshas to its site and we will immobilize that part by bandhana. That is for this Adipravarti. And if there is a Sangha, we will do Abhyanga or any types of manipulation. And if there is any type of Vimarga Gamana, we bring back the doshas to its site. We will make the, that is the normal Gadi of Vada, and we keep we try to keep the dosha in that particular part. So there is also indirect reference of application of concepts of marma in Ayurveda. That is, we can understand the application of talam on the head during Panchakarma procedures, that is to protect the Adipati marma. Massage of that is souls and various other parts of the body during the process of Nasya Karma. That is Ashtanga Sangraha, beautifully as mentioned, that is Datta Matretu Tasya, Karna, Kesha, Bhumi, Ganda, Manya, Skanda, Pani, Pardalanu, Mardayet. That is during Nasya Karma, we have to massage all the parts present in the head and neck and also the Tala and Pani, Pardala. It directly or indirectly mentions the importance of marma, which is present in this head and neck, and also in the marmas, which is located in the foot, that is sole, and also in the hand. And when we analyze the Pumsavana karma, it is specifically mentioned that is the right side and left side, importance of right and left side of the body, which nothing but implies the Ida and Pingala, which is mentioned marma concept, which is mentioned in Yoga Shastra or in Varma Chikitsa, Varma Shastra, which is available in Tamil tradition. And the other treatments procedures like Bandhana, Lebana, Vasti, Dara, Sirodhara, Shiravasti all have a indirect or direct that is a relationship with marma and isthanas. So practically we can say that marma is practiced all over India in these three different schools. That is, it is practiced as a classical Ayurveda tradition of marma, and apart from that, it is practiced as a Varma Shastra in Tamil Nadu and adjacent part of Kerala, and also as Kulayana Marma or Kulabhyasa Marma in Kalari. As we all know that Kalari Pite, which is a Kalari Chikitsa, also it is very famous in Kerala and also in the adjacent part of Tamil Nadu and Karnataka. So these are the various schools. I'm not going into the details of this because it is beyond the scope of this session. So there is, as I mentioned about Varma Shastra, there is always a controversy between Marma and Varma. So they always, there is a, we regard, or it is mentioned that as marma and varma are different. But when we analyze the various Sanskrit literatures and the Vedic literatures, marma and varma are used at the same time. That is, it is extensively used in all Sanskrit literatures. Both it is numerous references are available in Vedic literature, and specifically we can see in Rig Veda it is mentioned as marmani te varmana chadayami somastva Rajamritena Vastam. That is, it is mentioned that is marma, that is mrima, it causes maranam, meaning that which causes death, and varma, which protects the body. So the marma, which is covered in Ayurvedic text, it deals with the point which can cause immediate death, or it can cause disabilities, or it can cause pain, etc. Or the varma, which is Varma Shastra, which is practiced in Tamil Nadu, it protects the marma. And it is used mostly as a therapeutic aspect in Marma Shastra. So when we analyze the therapeutic aspect of marma, so as we all know that if there is an injury to this marma points, as I told, it is a pranasthana, injury to this marma point direct over the marma point or in the peripheral of the marma point, it can cause either fatality or it can cause some disability or pain. So when we use these principles, when we have a direct And with the controlled stimulation of this marma, it can act as a therapeutic, as a therapeutic role also. So this marma, when used as a controlled stimulation, can cure many diseases. It is natural, it is non-invasive. We can say no drug, or it is a minimum drug used. It is instant, which can give instant relief, and it is a holistic healing. That is, we are not only treating the particular marma point, but it can be the entire body is treated, because we are re-establishing the flow of prana. That prana will be when it is blocked in one part, because of this marma stimulation, that prana is liberated and it flows continuous, and there is a re-establishment of this prana flow, and so because of this there is a holistic healing. And there is a number of acute and chronic ailments can be cured, varying from acute injuries to chronic ailments like degenerative chronic injuries, that is repetitive strain injuries. All these can be treated with this marma treatment. So every science has its own strength and weaknesses. So we can, there is a strength we have, we can say that it is a complete science because it has its own philosophical background. It has its anatomical and physiological background, very strong anatomical and physiological background. And can be used as standalone therapy, or it can be used as adjuvant therapy with any other Ayush systems. Or it is effective in a larger spectrum of diseases like musculoskeletal disorders, neurological disorders, neuromuscular disorders, neurodegenerative disorders, metabolic disorders, etc. It is simple, painless, and gives quick results, and it is very cost effective also because of less drug involved, and it reduces the burden of medications. So it has a very vast literature. We can get very vast literature that is we can see in the Ayurvedic literatures and also in the Tamil Varma Shastras. That is there is almost thousands of manuscripts are available in Tamil Nadu related to that is Marma Chikitsa or Varma Shastra. But it has certain weakness also because there is a lack of standardization of the points. Because nowadays we doesn't know how much pressure we have to identify and where the correct points are present, marma points are present, and the methods of stimulation of these marma points and methods of protecting these marma points are still, it is unknown, or it is not clearly known. And it requires a strict discipline to learn the science. Okay, and also there is a if you are not properly practicing it, it can be very dangerous when you used wrong. And unfortunately, very few experts are available in this field. And most of the literatures are confined to a single language. That is, as I told, Tamil language contains most of these manuscripts related to Varma. And there are very less scientific evidences and publications. So this is my topic today. So where there is very few research has been undertaken in Marma Chikitsa. So I will be telling about this research trends which has happened in Marma Chikitsa and what are its prospects, and how we can do the future research in Marma Chikitsa. So with this certain introduction of Marma Chikitsa, I will be going into my session. So let me let me throw light over a few research works which has been conducted in the Marma Chikitsa. So it is both a qualitative and quantitative research. So let me start with our research. That is, it was a documentation project which was conducted, which was started in 2018. It was a documentation research project, and in this project, that is, we conducted a survey around that is Tamil Nadu, Kerala, and also in different parts of India. We collected details of a list of Marma practitioners, and we went to them. We collected. We stayed with them. We did video documentation and audio documentation. We collected the different Marma Chikitsa practices which are done by these traditional practitioners, and based upon that we prepared a protocol, and this was published as a book under CCRS, which is termed as Marma Chikitsa Basic Tenets in Ayurveda and Therapeutic Approaches. And this book is available in all CCRS institutes, and it covers a comprehensive that is research that is overview of the documentation what we have done. In this, there is a collection of data from these practitioners based upon the treatment experiences. And based upon this documentation project, we have started a training program for doctors. That is a 1 month that is a certificate course for Marma Chikitsa also. So let me tell about few studies which have been carried upon Marma Chikitsa. That is, first of all, I will tell about a survey study which was carried on to study the Kurpara Marma in relation to its Vaikalyakara effects when injured. So in this study, 80 patients having trauma of elbow joints due to various causes were included. And these patients were observed for 3 months for any changes in the symptoms. So we all know that Kurpara Marma can cause Kunitva. Apart from that, the symptoms of Vaikalyakara Marmas are like swelling, loss of power, restricted movements, and muscle wasting, and associated symptoms like tingling sensation, heaviness, syncope, sweating, dizziness, and vomiting. All these were kept as the inclusion criteria. And the analysis was done on the admission time and also after 3 months. So it was found in this study that in the survey study that almost all the patients, that is 100% of patients had a swelling and loss of power, and 90% people had Kunitvam on admission. And after 3 months, 50% remained that Kunitvam effect, that is the deformity remained even after 3 months. And 72 patients had restriction in flexion and extension deformity, which still remained in 50% of patients. And Kurpara, so they concluded that Kurpara Marma is definitely a Vaikalyakara Marma. And the disabilities like a restriction of movements, swelling, atrophy remains in an injured elbow joint in spite of even the best treatment available. So as I mentioned earlier, that is, even though if you are giving a best treatment to the Marma Abhigadas, it can cause Vaikalya, that is Vikalatvam. So this is another observational study which was done to analyze the Kukundara Marma with the manifestation in weightlifters with respect to sciatic nerve injuries. So a total number of 30 weight lifters with the low back injury were assessed. So they concluded that sacroiliac joints is the most appropriate anatomical structure with the Kukundara Marma. So as we all know, the Kukundara Marma is a Sandhi Marma and it is a Kalantara Pranahara Marma. And but when you analyze the symptoms of Kukundara Marma, it closely resembles, they conclude that it closely resembles the sciatic nerve injury, because we know that Kukundara Marma Abhigata can cause loss of sensation and motor power loss. So it was closely related to sciatic nerve injury. And they also concluded that injury to the periphery of Vaikalyakara Marma can cause Rujakara Vidya Lakshanas also. So this was their finding in the observational study. So these two studies, by these two studies, we can understand that certain observational studies or survey studies can be carried on. So based upon this examples, we can carry on the survey studies or observational studies and other type of Marma, for example, in Manibandha Marma or in Talahardai Marma or Kshipra Marma, etc. And its relationship with the prognosis and also its the modern correlation also. So such observation studies or the survey studies can be planned. So these two studies are examples for that. So let me introduce for a certain, that is a research which has been underdone in Marma Chikitsa in non-communicable diseases and also in the rehabilitation medicine. So this is a very interesting study. It was a non-randomized control pilot study. So in this study, there is Marma therapy for post-stroke rehabilitation was undertaken. That is patients with both ischemic and hemorrhagic strokes are included. And in that, in the intervention group, there was a standard treatment along with the Marma therapy. And in the control group, only the standard treatment was given. So in this, there is around 30 patients were studied in this pilot study. So it was mainly to examine the feasibility and acceptability issues of the intervention study, that is the protocol, and also to gather the preliminary outcome data. So the feasibility was studied through recruitment and response rate, and also the loss to follow. And the acceptability was done through patient interviews. And the outcome measure was fixed as the Barthel index. So it was found out that the recruitment rate was very high. That is, the feasibility was and the acceptability was very high. Recruitment rate was 15.1 per week, and response rate was 91%. And the loss to follow was very less. That is less than 30%. But interestingly, it was found that the effectiveness data, that is in the case of Barthel index, showed very significant. There is no significant differences in both the groups. But however, interestingly, it was found that the secondary measures, that is during the follow-up, that is the motricity index, which is after the follow-up, that is after 6 weeks or 12 weeks, the motricity index and also the trunk control test, which was very significant. And so this suggests a possible greater improvement in intervention group. So this was their conclusion. So by this we can understand that there is a prolonged effect of marma chikitsa. Even though it is doesn't give a immediate effect in stroke rehabilitation, there is a prolonged effect. It can give effect after 6 or 12 weeks, because it has to be done for a continuous period, so that it can give a prolonged, or it requires multiple sittings. So this was another very interesting pilot clinical trial. It was a single arm clinical trial, and this was done to find out the feasibility and acceptability of a manualized Ayurvedic nutrition and lifestyle intervention for breast cancer survivors. So it was a 4-month individualized Ayurvedic intervention, which included counseling on nutrition, lifestyle, yoga, and marma stimulations. So it was a 8 1-on-1 visit trial. So in this, feasibility and acceptability was studied, and the quality of life was of the patients were studied, with sleep disturbances are analyzed, and depressive symptoms are analyzed through depression scales. Fatigue was analyzed through Lee fatigue scale, and stress through PSS scale. This was analyzed during the prior treatment, midpoint, and the end of the 4th month intervention. So it was found that the feasibility and acceptability was very good. That is, there was a retention of 84%, and adherence was to the treatment was 19.5%. There was very significant improvement in the quality of life. That is, emotional functioning, cognitive functioning was very good, and the sleep and also the depressive scales showed a very good improvement. And there was only moderate improvements in the global health, and in the fatigue scale, and also in the stress scale. And they have concluded that there is no adverse events during the intervention period. So both these studies are nothing but a pilot study. They took minimal sample size of 30 or 32. So, but unfortunately, there is no available data of their continuous study. That is, I understand there is they didn't undertake any randomized controlled trial after this. So this is a very important scope for us. So we can undertake this with the base of these pilot studies. We can undertake projects or research. We can frame research protocols in rehabilitation, and also rehabilitation, post-stroke rehabilitation, and also in rehabilitation of cancer patients. So this is a very interesting study, which was a crossover design, which was done for to analyzing the physical and psychological effects of head treatment in the supine position. And there is same 24 healthy female students were included in the intervention group. That is, intervention group, they did the head massage or the stimulation of marma points, and the control group, just it was a bed rest alone. And this the same 24 healthy female students underwent both the interventions with a gap of 1 week between each treatment group. So it was a crossover design, and they analyzed the physical and psychological effects of the marma treatment. So marma was done as a 7-minute treatment. So they analyzed through physiological indexes like blood pressure and heart rate fluctuation index, and they analyzed there is a psychological effect through liveliness, depression, and boredom through visual analog scale, and anxiety through anxiety was measured as state anxiety through a scale called state right anxiety inventory scale. And found they found that there is a physiological effect was there. That is, there is a parasympathetic nerve activity increased immediately after stimulation, and this gradually decreased thereafter. So this was their main finding physiologically, and there was a psychological effect also. That is, the feeling of liveliness increased, depression and boredom decreased, fatigueness and the state of anxiety decreased after the treatment. So they concluded that head treatment, that is nothing but including the massage and marma stimulations, it offers relaxing and refreshing effects. So this is a case report which was done on the blood pressure normalizing effect of Talahridaya marma. So I included this to show the multimodal and multidimensional effect of marma therapy. So we can understand there is no relationship with Talahridaya marma and hypertension. But this case report found that that is when they analyzed a volunteer that is was subjected to Talahridaya marma therapy. That is, a classical Talahridaya marma point was identified in the, and physical stimulation was given in a controlled way for 10 days. And the patient was also performed self marma stimulation also. So in the right side, we can see a table, their observations. It was very interesting. That is the patient who had a very high systolic and diastolic pressure, that is 171 and 162 before the treatment, which was, sorry, 171 and 97, which gradually reduced to that is the 133 and 79 and 120 and 72 after the 10 days of marma stimulation. So this study, even though it's a case report, it is a leading stone, or it can be a, what is a link to other. We can frame many research protocols in marma stimulation in NCDs, that is in hypertension, also in diabetes also. That is, for example, in Varma Shastra, many points are mentioned for control of diabetes also. That is, they have mentioned the marma which is present in the thigh. That is, I remember it is Amai. It is called Amai Talai. That marma point is very good for controlling diabetes. So we can that is take up these type of studies. That is, we can take up certain we can analyze certain marma points which can be very effective in controlling these non-communicable diseases. So as I mentioned earlier, it has a very good effect in stroke, cancer, rehabilitation, and also we can see that it is having effect over the hypertension also. So when we see about the rehabilitation of marma injuries, so I will show two case reports on traumatic spinal cord injury and also a traumatic brain injury. So this is a case report which was done on there is a rehabilitative potential of Ayurveda for neurological deficits which is caused by traumatic spinal cord injury. So in this study, they found out that it was a case report, and it was called, that is, they have given a group of Ayurvedic internal medications and external medications, which is we can see in the table 2, which is a Panchakarma treatment. There is Pinda Swedam, Griyavasti, Shirovasti, and Kalavasti. And they found out there is a neurological, very good neurological improvement before and after treatments. That is, after 3 months of treatment, there is a very good neurological differences in both sensory and autonomic deficiencies. So this is a study which was done in this was a case report which was done in it was a retrospective case report to study rehabilitation of residual neurological deficits caused by traumatic brain injury. So in this group of medicines, intermedicines were given as per phase. That is Dashmula Kwadam, Dhanvandra Kashayam, Dhanvandra Sevyam, Prasaranita Kashayam, Kalyana Gridam, and a group of Panchakarma treatments was done. That is, it is, you can see in the right hand side. That is Churna Pinda Sweda, Jambira Pinda Sweda, Nasyam, Abhyangam, and Shirodhara Tarpanam, and Shashtika Pinda Swedam, and Pudabhagam was done in this case. And when the functional impairment measure score was done, it was 61 before treatment, 119 after treatment, and 126 during the follow-up of 3rd month. So we can conclude that is the Ayurvedic treatment or the Panchakarma protocol and the rehabilitation procedure is very good, very effective in treating all these types of spinal cord injuries and traumatic brain injuries. So marma chikitsa and degenerative disorders. So very few research has been done in this field. So there is a very good potential in this field. So this is only one study available on osteoarthritis. So it is evaluation of efficacy of marma therapy with Januvasti. That is, they did marma stimulation in 4 marma points. Along with Januvasti was done. It was evaluated on 20 patients, and it was done for 9 days. Follow-up was done for 1 month, and the patient was advised to do self-administration marma therapy at home also. And they found out that there was significant improvement in the subjective parameters and also in the objective parameters like WOMAC index, range of motion, walking time, etc. So this study is a stepping stone for to show the efficacy of marma therapy in various degenerative disorders. But unfortunately, very few studies are done in degenerative disorders. So it is, I think it is what to say, we have to the present generation or the future generation has to take up this challenge, and they have to do more studies on degenerative diseases. So this is a very scope and of marma chikitsa in sports medicine. Nowadays, sports medicine, that is, many people are practicing marma chikitsa in sports medicine. So I want to throw a few points over this topic also. So we all know that sports medicine relates with physical fitness, treatment and prevention of sports injuries. So there is a close relationship with spinal injuries and marma injuries, because we in Ayurveda marma, that is mostly related with the details of injuries. So there is a close relationship with sports injuries and marma. And there are several concepts in Ayurveda can be correlated with sports injuries. For example, like Sadhyovrana, Vranashofa and Vrana Chikitsa, and Snayu, Mamsa, Asti, Sandhigada Vadas, Nidana, and also their Chikitsa can be adopted in sports medicine. Bhagna and Sandhimoksha treatments, Vadarakta and Vadavyadi. So all these concepts can be incorporated in sports injuries, and we can manage sports injuries very well with these concepts. So these are the treatment strategies which we can apply in sports medicines. That is, the internal medicine should be aimed on elevating the pain and associated symptoms like inflammation, tenderness, swelling, etc. And it should be help in boosting the tissue healing. It should strengthen the injured part by tissue healing and also by muscle strengthening. And it should also aim in preventing post-traumatic complications like, for example, in knee ligament injuries, it can cause osteoarthritis. But there are apprehensions in using this internal medicines in sports injuries because of the fear of doping. But we can overcome this by incorporating internal medicines through diet and nutrition. That is, we can give toyas, paniyas, soups, and several other type of diet and nutrition can be incorporated. So external treatments also should be aiming on alleviating pain and other mainly associated symptoms like the stiffness, and should be aiming on rehabilitation. It should strengthen the injured part, and many that is Ayurvedic protocols like Lepa, that is Daras, Kashaya Daras and Taila Daras are very useful in sports injuries. And Bandhanas, herbal Bandhanas, Ubanahas, Abhyanga, Svedana Kriyas, all these can be used in different stages of sports injuries, that is starting from acute injuries to chronic injuries. And also Vasti can be, that is especially Matra Vasti can be useful for tissue healing and for improved muscle performance. And we can incorporate Agni Karma, Anishastra Karmas like Agni Karmas, Iravedana, Jalogojarna in reducing the pain and inflammation factors. And finally, we can incorporate physiotherapy along with this Ayurvedic treatments to Madam, I lost my, there is a current. Hello?
Yeah.
Madam, can you hear my?
Yes, sir. Sir, you're audible.
Your PPT is also audible.
Actually, sir, I'm having a power cut out. Can you share the slides, madam?
Sir, I'll share.
Okay.
Sir, you need to stop sharing. Only then I'll be able to share. Hello. Dr. Shankar, sir, am I audible?
Yes, madam. Yes, madam.
Sir, please stop sharing. I'll share the screen.
Yeah. I have stopped it, madam.
Go to slide number 34.
34, madam. 34.
Yes, just a minute. Is it visible, sir?
Yes, sir. It is. Yes, madam. It is visible.
Thank you, sir. So please, you may continue.
Yeah. Sorry for the interference. It can be utilized in this rehabilitation of sports persons. So next slide, madam. Yeah, if we see that what is the advantage of Marma Chikitsa in sports medicine, it is useful in both acute and chronic conditions. That is, it can be used as that is very effectively in acute injuries like sprains and ligament injuries also, and also to chronic conditions also. So it is very ideal in tissue healing and improve muscle performance. And it can ensure that there will be an early rehabilitation with normal strength to the sports person. And it can give a speedy recovery to the person, because these sports persons, they require a very speedy recovery, because they want to get back to their normal sports activity at the earliest. So that is very important for these people. So our treatment can give a speedy recovery, and that can help them to return to the practice and the field, and it can prevent recurrent injuries also. And also that is, as we know that during the Commonwealth, the recent Commonwealth Games also, we had a we lost many medals because of this recurrent injuries to our athletes. So this can be prevented through our treatment also. And it can prevent many degenerative diseases in their future also, because it can prevent osteoarthritis of the joints, and it can enhance their physical endurance also. That is, the certain Panchakarma procedures can enhance their physical endurance, and by this they can attain physical and mental fitness. Next slide, madam. So this is, I will share two very interesting study on this sports injuries. This is one of the study which is done to identify the effectiveness of Ayurvedic treatment protocol in knee ligament injuries. So this was carried on in our institute. In this treatment protocol was consisting of internal medicaments and external treatments. So in this, it was observed that in 20 patients of ligament injuries, it was the ligament injuries and meniscal injuries ranged from complete tear to partial tear. And the patients were studied with knee outcome survey and international knee documentation scores. And it was found that there was significant improvement in the parameters of pain, swelling, and functional disability of the knee joint. And it was found that statistically, it was statistically significant differences was found in the both scores. That is the KOOS score and IQDC scores in the pre-treatment, post-treatment, and after a follow-up of 3 months. And it was found that the patients were able to return to activities of daily living, that is with improved joint stability. So this was a very good observatory report, and this was published in a Scopus Index journal. So this is very good example for that is the management of that is all application of Ayurvedic treatment protocol in knee ligament injuries. So this is another protocol-based management of common sports injuries through integrated approach of Sandhi Marma Bigada, which was an open-label clinical trial. And in this, they did a phase-wise treatment with integration of Ayurveda and physiotherapy in 30 patients with sports injuries. And in this, they included diagnosed case of common sports injuries within 7 days. That is, they included acute injuries. So in this, they found out there was a significant changes in pain, tenderness, swelling, local temperature, manual muscle testing, and range of motion at different time points. So both these studies prove us that is there is a very good if we frame up a very good Ayurveda, that is Ayurvedic treatment protocol, well designed Ayurvedic treatment protocol, then it is a very success. We can that is we will find a very good success in sports injuries and sports person rehabilitation. Next slide, madam. Next slide. Yeah. So this is when we see the Marma Chikitsa in chronic injuries. Next slide, madam. Yeah. So chronic injuries, we can say it is a repetitive stress injury or occupational ovaries injury, or it can be called as a repetitive motion disorder, cumulative trauma. So several names can be given to these chronic injuries. So we can understand that the overuse or of the part or the stress induced to the Marma injuries to that part can cause this type of stress injuries. It can be workplace. It can be caused by major factors like workplace environment. That is same task repeatedly doing with little variability, decreased time for rest, and increase in expectations. So all this can be found out in nowadays lifestyles. That is, for example, in the case of persons working in IT company, they undergo all these situations. So they have these all types of repetitive stress injuries. So these injuries include nerve injury, dislocation, tendon inflammation, and overuse stress fractures. So a number of diseases come under this chronic injuries, like CTS, as I told earlier, that is the carpal tunnel syndrome, bursitis, epicondylitis, tendinitis, ganglion cyst, tenosynovitis, and trigger finger. All these comes under the chronic injuries or repetitive stress injuries. So the treatment is depending upon the prevention of etiology. Early diagnosis and appropriate treatment is very important. So all these conditions can be easily managed, or we can effectively manage with stimulation of the related Marma points, and through certain Marma, through certain Ayurvedic treatments like Lebas, Ubanahas, Dara, and Agnikarma. So certain internal medications can also be used to reduce the inflammation to enhance the tissue healing and also to prevent degeneration. Next slide, madam. When we see the different innovative formulations, or the normal, we can see about the different types of or the new novel drug delivery system can be developed based upon the different marma pharmacology. Very few medicines are available in marma pharmacology. So those medicines can be converted into new that is can be used in with the new drug delivery systems. For example, in South India, we use more of thailas and lebas. For example, Nagaradi, Leba we use, Muruvanna we use, and different types of Marmaguliga, Lebanas we use. So those things can be used as a hydrogel gel. For example, Nagaradi Churnam can be used as a hydrogel gel. And several thailas can be converted as sprays and can be used in immediate acute injuries in case of sports persons. And several Avarti thailas, for example, Danvadra thaila, Kshirpala thaila, can be converted into oil-based soft gel capsules. And certain our thaila preparations like Danvadra thailam, Muruvanna, Mahanaranam can be converted, or I think it is still it is available. It is nowadays it is available as ointments, creams, emugels, and liniments. And we can there will be that is we can have an innovative approach of transdermal patches of these labas for immediate pain recovery and also reduce the inflammation. For example, that is Nagaradi Churna Lebana in the case of plantar fasciitis. And in case of transdermal patches in sports injuries, immediate sports injuries, we can use Muruvanna lebas, Muruvanna patches. So all these can be developed, and also plasters can also be developed. And certain herbal bandages can be developed in both in acute injuries and also in chronic injuries. And we can innovate the POP, which is nowadays available, the post that is a plaster of Paris, with herbal medicines as phyto-POP. And we can use the cold packs. There is our certain medicines like Muruvanna, Manjishta lebas, which is having a cold Shidavirias, can be used as cold packs in acute injuries. And certain medicines like Toya, Paniyas can be converted into sachet packets, can be converted into powder sachets, and this can be given as an energy drink. It can be given as a immediate drink to the sports persons, like the Sharanga Doyam or Drakshari Doyam, Karjurari Paniyam, etc. And certain drugs which to give the fast effect of certain marma drugs, we can convert them as a sublingual drops and also nanofilms. And we can convert certain our rasayana medicines like the Chavanaprasham, there's Agastha Rasayanam, that is the Narasimha Rasayanam can be prepared as a nutribars, nutriballs, granules, and health drinks in the forms of soups also. So these are the various innovative formulations which can be undertaken under this in the sports medicines and also in the case of in the scope of acute and chronic injuries. Next slide. So finally, so what is the future ahead of marma researches? We can find out new indications of this marma chikitsa. That is, as I told earlier, we can do marma chikitsa in certain NCDs. So we can develop certain protocols for diabetes, hypertension, metabolic disorders, and we can develop protocols for rehabilitative in stroke, post-stroke rehabilitation, and also for cancer patients. So all these are new indications. So many research has to be undertaken. Many observative studies can be undertaken. Though we cannot do all types of RCTs, we can do observative studies. So observative reports, observative studies with a larger sample size, thousands of sample size is equal to these RCTs. So such observative studies can be undertaken. So why this marma chikitsa is mostly drugless, and it can be easily introduced to the public healthcare also. So we can introduce our marma chikitsa in the public healthcare system, and also which can be integrated with other Ayush systems also, and also with the modern that is the modern medicine also, physiotherapy also. So certain research has to be undertaken in this integration of our systems, and we can strengthen we can frame up different protocols which can be given to the Ayurvedic physicians, Ayurvedic community to develop their clinical practice. So that so all these studies are based or should strengthen the Ayurvedic physicians' clinical practice. That is the ultimate goal of these researchers. And new windows of scope can be found at non-communicable diseases, degenerative diseases, chronic injuries, sports medicine, rehabilitation medicine, emergency medicine, personalized medicine, etc. So all these are new windows open to us in research prospects in Marma Chikitsa. And also we can develop new drug delivery forms of medicines. And also we can understand the various action of Marma stimulation through the concept of fascia. That is, as we have two eminent Rachana Sharira persons here, they can throw light on this, because this fascia is it is what is a very lowly understood in anatomy. That is because nowadays fascia is more given more importance in clinical practice, because fascia covers all the musculoskeletal part, all the organs. So it is considered as a internet net in the body. So our Marma stimulation, as I told earlier, it is having a multi-modal and multi-dimensional effect. So this can be studied through fascia, through the concept of fascias, and also the understanding the logics of certain Marma, that is Ayurvedic practices. As I told, like Nasya, Pumsavana Karma, all these can be understood through Marma. So certain studies can be undertaken in this scope also. And we can explore the scope of Marma in anesthesia, because nowadays we are having very usage of anesthesia, local anesthesias in surgical and parasurgical procedures. So we can innovate Marma Chikitsa in reducing, that is, we can use it as for local anesthesia or for pain reduction in post-operative period also. So certain research protocols or research studies can be carried on this subject also. And we can innovate our certain procedures, like our Abhyanga procedures, our Svedana procedures, based upon the Marma knowledge of this, our Marma Chikitsa. So our Abhyanga procedures can be innovated. That is, different types of Marma strokes can be developed, like Pidana, Paripidana. Many types of Abhyanga procedures are available in Marma Chikitsa that can be incorporated into our Ayurvedic Abhyanga practice. So all these are the future ahead of this Marma Chikitsa and also its research prospects. So hope I am very short, and I have given a brief part to this research trends and prospects of Marma Chikitsa. So with this, I thank for your patient hearing, and also for I thank the organizers for inviting me in this prestigious platform. And also I thank the chairperson, co-chairperson, and coordinator of this session. Finally, once again, I thank for all the audience for your patience hearing and for your attention. Thank you. Over to you, madam.
Thank you, sir. Thank you very much for your very knowledgeable session, talk on this today's session of research trends and prospects in Marma Chikitsa. I would now like to invite our co-chair, Dr. Khedikar sir, for question answer session for today's topic, research trends and prospects. So please take over for the question answer session. I request the participants, if they have questions, they can drop in the chat box or they can ask now. If there are many questions, with the permission of today's speaker, we can connect you to him also. Over to you, sir.
Thank you, madam. Today's topic was research trends and prospects in Marma Chikitsa. First of all, I congratulate sir for very well presentation. He has covered almost all the areas related to his topic. Basically, there is only one question in the chat box which I am seeing. That is, question is from Suruchi, and she asked that what we do in Marma Chikitsa means add pressure or what? This is the question from Suruchi.
Yes, sir. Shall I answer it, sir?
Yes, sir.
Yeah. So it is a very good question. Actually, the Marma stimulation, which is not that much explored in Ayurvedic Marma Chikitsa, but it is quite it is done in a very elaborate way, or in a very very good way in Varma Chikitsa. That is in Varma Shastra, which is done in Tamil Nadu. on adjacent parts of Tamil Nadu. And in this, they have they have designed a protocol based upon the that is the Matrai Kanak, that is the pressure point, how much pressure has to be applied over the marma point for its stimulation. So they have analyzed it and they have standardized this point of there is a pressure of stimulation. For example, that is I will give an example for that. That is, they have categorized this pressure. That is they have given a pressure metrics for that. That is, for example, they have given they have categorized as 1/4 matrai, 1/2 matrai, 3/4 matrai, and 1 matrai. So these 1/4 matrai to 1 matrai is for therapeutic purpose. Anything beyond that can can injure the marma point. So for example, if we want to give a 1/4 matrai pressure to that marma, that is what they do is they give pressure from, for example, they give pressure only from the wrist part. That is, if you are pressing and releasing that marma point, they give pressure from the wrist part. That is, giving pressure from the wrist can create 1/4 pressure. When we give pressure from our elbow, it can give 1/2. When we give pressure from our shoulder joint, it can give that is the 3/4 pressure. And if you are giving pressure from our entire limb, then it can give 1 matrai. And if you are giving pressure more than that, it can cause the injury to that part. So based upon this metrics, we can also frame a certain certain protocol to manipulate the marma points. But I understand that many books have elaborated this marma stimulation, and many practitioners are nowadays marma practitioners are nowadays are stimulating marma points, I think. But there is a lack of standardization of these marma points is lacking. So we have to develop this standardization, its identification, and also the metrics, and also the how much pressure we have to apply. So all these things has to be developed. So I think we can get this, or we can borrow this point from our that is the other Ayush team, that is Siddha medicine. There they developed this Varma Shastra, that is they have developed this manipulating techniques quite a lot. Hope I have answered the question, sir.
Yes, sir. I think there is one more question in chat box. Sir, the question is from Nanda Santre. Question is that, can we give pressure by transcutaneous electric nerve stimulation as in physiotherapy?
Yeah, sure. That is actually this study was undertaken in this. I shared one study also related to the sports injury protocol. So in that study, that is they are, as I mentioned, that is they have taken a phase-wise treatment protocol in sports injuries. So in that, they in the initial first 2 phase, they have done Ayurvedic treatment of labors and internal medications, dharas, etc. But in the 3rd phase, they have used physiotherapies, like that is they have given physiotherapy as a ultrasonography methods, and also they have used this transdermal stimulations also. So these stimulations we cannot, that is still there is a need for understanding these type of treatments, how they can stimulate the action behind these stimulations in the understanding in them in marma perspective has to be done. But it is understood that they can stimulate the blood circulation, they stimulate the nerve channels, the blood channels, the muscles, and so all these are nothing but the marma. That is the it nothing but involves the mamsa, sira, snayu, asti, and sandhi. So we can indirectly say that it stimulates nothing but the marma points. But we have to understand, so certain studies still have to be undertaken to study the effect of these types of stimulations in marma points.
Okay, sir, thank you. I think there is no more questions in this session. Sir, I have one question regarding this. Are the marma points are similar to that of acupressure points?
Sorry, sir, I am not, I would say, expert in acupressure, but when we, so I'll share one experience, because when we went for a documentation project, as I mentioned earlier, we were involved in documentation project. So we documented certain practitioners who did both the marma stimulations and also acupressure. So they had a concept that it is related, but that is as a scientific community, or we have to what to say, we have to do more research on that. I think it is both are different philosophical what to say, the base is different, because we have a very strong anatomical, physiological and philosophical background. I don't think so acupressure doesn't have those strong background. Okay, it was, how to say, it was very recently developed. Our Shastra is having a very strong background, but still we have to find out there is any relationship, so that we can do some integrative research also. So we should not close our windows in that research aspect. So we have to find out those research, because as I told, we have to integrate with other systems also. So that window should be always open.
Yes, sir. Thank you, sir. Thank you. So I think there are no more questions for this session. I once again congratulate sir for the nice presentation and nice question answers for this session. And I'm very much thankful to the entire team of Ayurveda Teachers Association, especially President Dr. Rahul Suryavanshi sir and Dr. Nitin Chandurkar sir and whole team of the ATA. Thank you very much, sir.
Thank you, sir.
And I hope if anyone has more doubts on this topic, they can have sir, if sir permits, they can have his email ID and they can directly clear their doubts from sir. Again, we have eminent speaker as a chairperson today for the session, Dr. Sudhir Kandekar sir. He has a vast experience of 15 years. He has been working in this field of Marma Chikitsa. I would like request our today's chairperson to share his expert opinion on today's topic of research trends and prospects in Marma Chikitsa. Over to you, sir. So please share your expert's advice.
Thank you, madam. First of all, I would like to express my gratitude towards ATA organization and the organizing members. Then I would like to express my gratitude also to the esteemed Marma Chikitsak Dr. K.M. Pratap Shankar sir for expressing his knowledgeable views about all aspects of the Marma science as well as Marma Chikitsa. Sir, you have done extensive work for this apratyaksham Shastra. Actually, Acharya Charak said that pratyaksham hi alpam, apratyaksham analpam. The manifested things are very, very low in numbers, but apratyaksham analpam. The unmanifested things are very much in numbers in this universe, and thus the Marma Shastra is also has a pratyaksham knowledge. Very much. This is actually emerging Shastra today, and nowadays we Ayurvedian are very much alert or very much aware about this Marma Shastra. Actually, I have practiced or I have been practicing this Marma Chikitsa since last 15 years, and in Maharashtra there is no Marma Chikitsa at that time, and I am ओके मेरी चिकित्सा दृष्टि से मैं इसके ऊपर काम कर रहा था, बट नाउ lots of मर्म चिकित्सक are prepared in this present era. Dr. Pratap sir, you have short analyzed this particular Marma Chikitsa, that is you express view about the strength of this Marma Chikitsa, that is it is that instant relief or at the low cost. Okay, then its weaknesses. It has no protocols or very less protocols. Marmasthans are very different in the individual perspectives. Okay, opportunities in various conditions. We can opportunate this particular pathy or modality, and lack of standardization and acceptance is the threat. So we can overcome these threats or weaknesses in near time. So I would like to thanks to all of you for this valuable session. Thank you. Thank you.
Thank you, sir. Thank you for your expert comments on today's topic. I have a personal request to Pratap Shankar, sir. CCRS has been doing a great job in this field of Marma, which has been a very underexplored topic. Sir, could you please guide our faculties and even students on the courses conducted by CCRS? I think at Trisur, Cheruturthi, they have a 1-month course on Marma Chikitsa training. Could you please throw some light on that?
Yes, madam. Sure. Actually, we are having a 3 months course for Panchakarma also. So that is, it was almost 17 years it has been started. So this is a 3 months course. This for doctors, for BMS doctors. This is they will get a comprehensive training, hands-on training in Panchakarma, different Panchakarma procedures. So it is for 3 months, and it is conducted every year in 2 batches. That is, we have a July batch and also in December batch. So we have 2 batches. So in between that, we have another certificate course on Marma Chikitsa. So based upon our that is the research study, we have a we have started a certificate course also, and this certificate course is for 30 days. And this certificate course will be taken by different almost 30 Marma practitioners all over from India. They will give an hands-on training to the Ayurvedic graduates, and all these are hands-on training offline programs. So we also have a that is Panchakarma therapy course also. That is for it is not for doctors, but it is for a general public for 10th and +2 students. So these are the 3 courses we are conducting in our NARIP Institute. So the details of these are courses are available in our website, CCRAS website. The Marma Chikitsa course is conducted every year. 2 batches will be there in May and October. So you can send application via email. It is all available in our website. Thank you, madam.
Thank you so much, sir. I'm sure this will be very beneficial